I also just wanted to highlight that very clearly cases are tracking along with vaccination rates. If you look at this graph here, this is just over the last couple of months. What you see, that black dotted line is showing Louisiana, for example, the state that currently has one of the highest cases per 100,000. But then in blue are states in the south, and then in pink in the west, in green in the Midwest, and in red in the west. And the reason that we are seeing differing rates of those increases is because we are seeing differing rates of vaccination. So the West and the Midwest, different rates than in other settings. All right, let's look at our situation here in Chicago. So here in Chicago, as a reminder, this is the same risk matrix that we have been using throughout COVID, even before there was a vaccine available. And all of the metrics that we're following are currently in the lower risk tier. So specifically, we're averaging 165 cases per day of COVID-19. That is increasing. I expect that we will cross the 200 mark and move into moderate risk, probably within the next few days. Our test positivity is at 2.6%. That is also increasing. It's still in the lower risk category, and if we get over 5%, that's when we would move into moderate risk. Our number of hospitalizations is just at the very low end of our lower risk category. You can see we're currently averaging about 101 non-ICU beds a day, and then we're averaging about 32 ICU beds a day. So overall, we do remain at lower risk, but we are moving in the wrong direction, and that's part of why we've been sharing the news with you more frequently as we've been seeing increases. If we look at a couple of graphs quickly, just to put this in some perspective, going back over the last 6 months, our percent positivity, for example, 2.6% is really quite good. And if you think about where we were for months, we would have killed to be at a 2.6% positivity. But compared to where we were just a few weeks ago, we'd gotten as low as 0.4%. And similarly, that 200 cases per day, we've really enjoyed these last 2 months being under 200 cases a day. But for some context, all of last year, from the beginning of COVID all the way through, there were only 13 days in the whole year in early June that we were under that 200 case per day mark. So I want people to be concerned, but I don't want there to be unnecessary panic at this point. I just want to make sure people get vaccinated is the most important thing. Here is data showing the risk of cases, hospitalizations, and deaths in Chicago for people who are vaccinated versus unvaccinated. So in red here, this is for cases. Going back to March, the red line shows Chicagoans who are unvaccinated who were diagnosed with COVID. The dotted blue line shows people who had gotten a first dose but were not fully vaccinated against COVID. And the dark blue line shows people who were fully vaccinated against COVID. So we can see going back to March, including that smaller surge that we had in April, all of the numbers went up a little bit. But the huge majority were in red there in the cases of people who are unvaccinated. And that's really been the pattern that we've seen across the U.S. and that we continue to expect to see moving forward. If we look at hospitalizations over that same time period, similarly in red, this is giving you hospitalizations of unvaccinated Chicagoans. And then in that same time period, the dotted line partially vaccinated and the dark blue line fully vaccinated. And you can see the risk of hospitalizations in the blue there for fully vaccinated Chicagoans is almost to zero. And it's been really great to see how protective the vaccine has been. And then finally with deaths, again, this is just the last 3 months, so not during or going back to March. And again, the highest rates by far in people who are unvaccinated. You see that dotted line of people who are partially vaccinated, and then really very low, near zero, the rate among people who are fully vaccinated. And just to put a more specific number on this, 97% of our hospitalizations and 97% of our COVID deaths going back to January have been in people who are not fully vaccinated. Let me say that again. 97% of the hospitalizations and the deaths here in Chicago in people who are not vaccinated. And if we look at the specific numbers, there have been 788 when we last ran these numbers. People who died from COVID-19 here in Chicago residents just just since January. And among those 788 deaths, 767 of them were unvaccinated. And of the few who were vaccinated, the median age there was 79. Everybody had underlying conditions. So there's no such thing as a 100% protective vaccine, but these vaccines continue to prove their safety and their efficacy in the real world. Today marks 1 year since the first phase 3 trials started for the COVID vaccine. They mark the beginning of vaccination for us here in the US. And I hope people who have been waiting and seeing, which I've heard a lot, now feel confident, where we literally have billions of people who have been vaccinated and a whole year since we've started vaccinating folks here in the US. Now is the time to get that vaccine. You want to be a blue line on these graphs. You want your risk of cases, hospitalizations, and deaths to be lower. 2/3 of eligible Chicagoans have gotten at least that first dose of vaccine. That's 67% if we look at everybody over the age of 12. It goes up to about 69% if we look at those over 18, about 73% of those over 65, and about 60% of Chicagoans who are eligible are fully vaccinated. The vaccination rate in Chicago has actually stabilized over the past few weeks. Again, you see these numbers are much lower than they were back in April. But I want to point out here that the majority of people getting vaccinated are getting vaccinated in pharmacies. That's that pink line, the pink numbers there. And then after pharmacies, we're seeing people getting vaccinated predominantly in their outpatient settings, meaning with their doctor, whether that's a federally qualified health center or an outpatient doctor. And then there are more getting vaccinated in the hospital setting and through public health. But as a reminder, you can walk into pharmacies, nearly every pharmacy here across Chicago. You're not needing an appointment. They make it easy. And I want to remind people, getting vaccinated is the most important thing. You will get the same card. We got this question, regardless of where you get vaccinated. But please make that decision to get vaccinated today. We continue to focus on vaccinating both adolescents and seniors. We're making the most progress each week in that 12 to 17-year-old group, which is good because that's the group, particularly as we're looking toward heading back to school, that we'd like to have as protected as possible. But you can see we still have a ways to go for both our younger Chicagoans and those over 80. And we're continuing to focus on vaccinating Black Latinx and Black non-Latinx and Latinx Chicagoans. You can see about 41% of Black Chicagoans have gotten at least a first dose of vaccine, about 49% of Latinx, compared to more like 62 to 65% of white and Asian Chicagoans. And we know that COVID has hit harder in the Black and Latinx communities, so particularly there, would encourage folks to please take advantage of the safe, effective, free, and available vaccine. Finally, I want to talk about Lolla because I know people have questions. So where we're thinking about attending Lollapalooza and how to attend safely, I want to remind people to enter, you must bring a printed copy of your vaccine card, vaccine record, or a negative COVID test taken within 72 hours of the day that you're coming into Lolla. You need to activate your festival wristband and register for cashless. And then if you're unvaccinated, we're recommending you wear a mask throughout your time on site. Also, just as a reminder, only clear bags are allowed, and there are no liquids allowed to be brought into Lollapalooza. Remember to wash your hands or use a hand sanitizer, limit consumption of substances, especially if you're not sure what they are, and consuming alcohol that can make you less likely to follow COVID measures and generally can be an issue that we've seen associated with Lolla in the past. And don't attend Lolla, really. Don't attend. If you develop any symptoms of COVID-19 and you haven't taken a test, even if you're fully vaccinated, and if you've tested positive for COVID in the last 14 days, do not attend. The last thing is to make an announcement that we are expanding our capacity for Chicago at Home, Protect Chicago at Home. For those who are not aware, this is the program that we started with for people who were homebound, and then we expanded it to people who were over 65. And then we were really, I believe, the only large city that has expanded this to anybody in Chicago over the age of 12 who would like to schedule a vaccine appointment at home. We will make an appointment for you free of charge. You can call 312-746-4835. 35. So we're doubling capacity because we've seen very good uptake, especially among both older folks and young and adolescents with their families, which is a primary area. We've also seen a majority of vaccines going to Black Chicagoans, which is a group that we've been working hard to reach. So appointments can be booked now, chicago.gov/at-home. You can do either Pfizer or Johnson & Johnson. We can vaccinate up to 10 people at a time, and we're expanding the hours as well so that there are now hours available till 6:30 p.m. On the Monday through Friday to better meet needs of working folks. And then the last thing is Grubhub had sponsored the initial expansion phase of this to everybody, and we'd been giving folks who were getting vaccinated a Grubhub gift certificate, one for the group. As we are coming to an end and expanding that, we are now providing $25 Visa gift cards. One of the reasons we're doing that is we heard that people who didn't have a phone maybe couldn't access the Grubhub app. This is literally just a card that you can use anywhere that Visa would be accepted. Again, we'll be giving one of these to anybody who is vaccinated in this group. So if you get 5 people together, each of those people will get a gift card. But we encourage you, just as we did last time, use that opportunity to celebrate vaccination, and it's to also encourage people to spread the word. We continue hyperlocal vaccination events. We've been doing really well at a number of our outside events like Swaparama and Brickyard Mall in the Northwest and Southwest continue to be very successful events for us. And so we're out there every weekend. And I just wanted to give you a flavor of last weekend alone. We were at a community health fair with the Allergy and Asthma Network. We were at the Chicago Humanities Festival. We were at vaccine pop-ups in Greater Auburn Gresham, as well as Little Village. We were at the Mason Park Block Club. We were at a Fatherhood Initiative summer celebration. We were at a church. We were at a laundromat. We were at another church and a jazz coalition. And we've really been working to try to make sure where we are putting our efforts, they're places where people are excited to get vaccinated and where we're seeing good numbers. And then in a lot of the larger, more fun events where we don't always find people saying, I want to get vaccinated on the spot, we're doing more of the vaccine ambassador work and helping people sign up for at home. So for example, at Lollapalooza, we're not that interested in vaccinating on the spot. We need people to already be vaccinated by the time they come in. But where people are coming with testing, our vaccine ambassadors will be on site, encouraging those people to sign up for at home. Appointments remain available, ZocDoc.com/vaccine or through that same phone number. And I just want to remind everybody that we certainly are concerned as numbers are increasing around the.
All right, guys, going to be turning away from Chicago's update because we do want to get into the press conference. Just a heads up, this is an audio CDC briefing as they give us some new mask guidance. So the box you're going to see is going to be black, but we're going to be listening in as they're giving us some new guidance on masks when it comes to both vaccinated and unvaccinated people.
Welcome, and thank you for standing by. At this time, all participants are in a listen-only mode. During the question and answer session of today's call, if you would like to ask a question, please press star 1 on your phone, record your name, and your line will be open. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I would like to now turn the meeting over to Mr. Benjamin Hayes. You may begin when ready. Thank you.
Thank you, Katrina, and thank you all for joining us today for this briefing to discuss CDC's latest guidance on recommendations for those who have received the COVID-19 vaccine. We are joined by CDC Director Dr. Rochelle Walensky, who will provide opening remarks and then be happy to take your questions. This is an on-the-record briefing and not under embargo. At this time, I would like to turn the call over to Dr. Walensky.
Thank you all for joining us today. As you have heard from me previously, this pandemic continues to pose a serious threat to the health of all Americans. I have said throughout my tenure at CDC that our guidance and recommendations will follow the science in our efforts to protect the health of as many Americans as possible. And today, we have new science related to the Delta variant that requires us to update the guidance regarding what you can do when you are fully vaccinated. The Delta variant is showing every day its willingness to outsmart us and to be an opportunist in areas where we have not shown a fortified response against it. This week, our data shows that Delta remains the predominant variant circulating in the United States. 8 in 10 sequence samples contain the Delta variant. In recent days, I have seen new scientific data from recent outbreak investigations showing that the Delta variant behaves uniquely differently from past strains of the virus that caused COVID-19. Information on the Delta variant from several states and other countries indicates that in rare occasions, some vaccinated people infected with the Delta variant after vaccination may be contagious and spread the virus to others. This new science is worrisome and unfortunately warrants an update to our recommendations. First, we continue to strongly encourage everyone to get vaccinated. Getting vaccinated continues to prevent severe illness, hospitalization, and death, even with Delta. It also helps reduce the spread of the virus in our communities. Vaccinated individuals continue to represent a very small amount of transmission occurring around the country. We continue to estimate that the risk of a breakthrough infection with symptoms upon exposure to the Delta variant is reduced by 7-fold. The reduction is 20-fold for hospitalizations and deaths. As CDC has recommended for months, unvaccinated individuals should get vaccinated and continue masking until they are fully vaccinated. In areas with substantial and high transmission, CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others. This includes schools. CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status. Children should return to full-time in-person learning in the fall with proper prevention strategies in place. Finally, CDC recommends community leaders encourage vaccination and universal masking to prevent further outbreaks in areas of substantial and high transmission. With the Delta variant, vaccinating more Americans now is more urgent than ever. The highest spread of cases and severe outcomes is happening in places with low vaccination rates and among unvaccinated people. This moment, and most importantly, the associated illness, suffering, and death could have been avoided with higher vaccination coverage in this country. COVID-19 continues to present many challenges and has exacted a tremendous toll on our nation. We continue to follow the science closely and update the guidance should the science shift again. We must take every step we can to stop the Delta variant and end this pandemic. And now I'm happy to take your questions. Thank you.
Thank you, Dr. Walensky. Katrina, we are ready for our first question, please.
First, we continue to strongly encourage everyone to get vaccinated. Getting vaccinated continues to prevent severe illness, hospitalization, and death, even with Delta. It also helps reduce the spread of the virus in our communities. Vaccinated individuals continue to represent a very small amount of transmission occurring around the country. We continue to estimate that the risk of a breakthrough infection with symptoms upon exposure to the Delta variant is reduced by 7-fold. The reduction is 20-fold for hospitalizations and deaths. As CDC has recommended for months, unvaccinated individuals should get vaccinated and continue masking until they are fully vaccinated. In areas with substantial and high transmission, CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others. This includes schools. CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status. Children should return to full-time in-person learning in the fall with proper prevention strategies in place. Finally, CDC recommends community leaders encourage vaccination and universal masking to prevent further outbreaks in areas of substantial and high transmission. With the Delta variant, vaccinating more Americans now is more urgent than ever. The highest spread of cases and severe outcomes is happening in places with low vaccination rates and among unvaccinated people. This moment, and most importantly, the associated illness, suffering, and death could have been avoided with higher vaccination coverage in this country. COVID-19 continues to present many challenges and has exacted a tremendous toll on our nation. We continue to follow the science closely and update the guidance should the science shift again. We must take every step we can to stop the Delta variant and end this pandemic. And now I'm happy to take your questions. Thank you.
Thank you, Dr. Belinsky. Katrina, we are ready for our first question, please. While we're waiting for our first question, I just want to take the opportunity to let everyone know that if you have questions following the briefing, please feel free to call our main media line at 404-639-3286, or you can also email those questions to media@cdc.gov. We'll continue to stand by for our first question.
Thank you. Our first question comes from Adriana Rodriguez. Your line is now open.
Hi, thank you so much for taking my question. I guess the number one question that a lot of people have right now is, what does this mean for vaccinated Americans? Who are these guidelines trying to protect if vaccinated Americans are not commonly hospitalized or dying from COVID and transmission is not as common? Are these guidelines mostly trying to protect them or the unvaccinated? And if it's the latter, then how do these guidelines protect the unvaccinated?
Thank you for that question, Adriana. I think the most important thing to understand is the vaccines continue to do an exceptional job in protecting the individual who is vaccinated from severe illness, hospitalization, and death, and even against mild illness, as we have indicated. But your point is well taken, and what is different with the Delta variant than with the Alpha variant is that in those cases, those rare cases that we have breakthrough infections, we felt it important for people to understand that they have the potential to transmit virus to others. Now, importantly to convey in all of this is that of the transmission that is happening in the country right now, the vast majority of transmission is occurring through unvaccinated individuals. But on that exception that we might have a vaccine breakthrough, we thought it was important for people to understand that they could pass the disease on to someone else. And that is important in the case, for example, of a vaccinated individual who might be going to visit an immunocompromised family member. We wanted to make sure that they took the precautions necessary to not pass the virus to those.
Next question, please.
Our next question comes from Hillary Brick. Your line is now open.
Hi, thanks for taking my question. I just wanted to ask, thinking back to the pandemic of the unvaccinated you were talking about last week, Dr. Walensky, is there a better way to think about the situation when with Delta now? Like, what are you telling your vaccinated friends and family when they go out for dinner, for example?
Thank you, Hillary, for that question. I think we still largely are in a pandemic of the unvaccinated. The vast majority of transmission, the vast majority of severe disease, hospitalization, and death is almost exclusively happening among unvaccinated people, which is why we so very much want to double down on making sure people continue to get vaccinated. That said, if you have a vaccinated individual who is in a place that with substantial or high transmission, they're contacting a lot of people, 1 in 20, 1 in 10 of those contacts could potentially lead to a breakthrough infection if you have an effectiveness of 90 to 95%. And so that's why we're saying in areas of substantial or high transmission, even if you are vaccinated, that we believe it's important to wear a mask in those settings.
Next question, please.
Our next question comes from Caitlin Collins of CNN. Your line is now open.
Thanks so much, Dr. Walensky. 2 questions. One, you said that you are seeing some people who are fully vaccinated contribute to the spread. Can you say exactly how many people you have seen from this data that are vaccinated that are spreading this? And secondly, when it comes to having everyone, regardless of vaccination status, wear a mask in schools, can you explain the thinking behind that? And are you worried that it will take away the incentive for some parents to get their children who are eligible to be vaccinated?
Thank you for those questions, Caitlin. First, with regard to your first question, we are now actively conducting outbreak investigations of what is occurring in places that are having clusters, and many of you have heard of many of those clusters. What we've learned in that context is that when we examine the rarer breakthrough infections and we look at the amount of virus in those people, it is pretty similar to the amount of virus in unvaccinated people. We are now continuing to follow those clusters to understand the impact of forward transmission of those vaccinated people. But again, I want to reiterate, we believe the vast majority of transmission is occurring in unvaccinated people and through unvaccinated people. But unlike the Alpha variant that we had back in May, where we didn't believe that if you were vaccinated you could transmit further, this is different now with the Delta variant, and we're seeing now that it's actually possible if you're a rare breakthrough infection that you can transmit further, which is the reason for the change. With regard to schools, when we released our school guidance on July 9th, we had less Delta variants in this country. We had fewer cases in this country. And importantly, we were really hopeful that we would have more people vaccinated, especially in the demographic between 12 to 17 years old. Next week, we have many school systems that are starting around the country. And I think we all agree that children less than 11 and less are not going to be able to be vaccinated. And with only 30% of our kids between 12 and 17 fully vaccinated now, more cases in this country, and a real effort to try and make sure that our kids can safely get back to full in-person learning in the fall, we're recommending that everybody wear masks right now.
Next question, please.
Our next question comes from John LaPorte of CBS News. Your line is now open.
Hi, Dr. Walensky. Some people have asked me, why change mask guidance to protect people who decide not to get vaccinated even though they can? Can you say something about the role the unvaccinated person who gets infected, even if they have mild or no illness, can play in the development of the next variant of concern, with that variant potentially going on to have a higher chance of potentially infecting those of us who are vaccinated?
Yeah, that's a really important question. Thank you for that. The first thing I think we all need to acknowledge is there are some people who are not able to be fully vaccinated, like children, and some people who are not able to be fully protected even though they are vaccinated, like immunocompromised people. And so part of the reason for this guidance is to make sure that we can protect those, and that people who are seeing immunocompromised people, for example, know how to protect them even though they themselves may be fully vaccinated. But your point is well taken about those who have made the choice to not get vaccinated and the amount of virus that is circulating in this country right now. So for the amount of virus that's circulating in this country largely among unvaccinated people, the largest concern that I think we in public health and science are worried about is that virus and the potential mutations away we are from a very transmissible virus that has the potential to evade our vaccines in terms of how it protects us from severe disease and death. Right now, fortunately, we are not there. These vaccines operate really well in protecting us about forms of severe disease and death. But the big concern is that the next variant that might emerge, just a few mutations potentially away, could potentially evade our vaccines.
Thanks.
Next question, please.
Our next question comes from Yasmeen Abu-Taleb from the Washington Post. The line is now open.
Hi, thanks for taking my question. I was wondering if you could talk a little bit more about the data showing that some vaccinated individuals have similar viral loads to unvaccinated, and if you could talk about whether the CDC is looking at expanding the mask guidance to maybe require masking indoors in public spaces in all circumstances, or other public health measures given the spread of Delta.
Thank you, Yasmeen. So as I mentioned, in these outbreak investigations, we are able to stratify the clusters that we are seeing. Unfortunately, because we have so much disease right now, some of these clusters are large, and we're able to stratify them by a smaller proportion that are vaccinated and breakthrough infections and a larger proportion that are unvaccinated. And so when we look at their CT values, or otherwise their viral load, what we're seeing is that they're actually quite similar. That leads us to believe that the breakthrough infections, rare as they are, have the potential to forward transmit at the same with the same capacity as an unvaccinated person. So the burden is less because there are fewer of them people-wise, but the amount of virus is the same between those two strata. In terms of otherwise updating our guidance, we're not looking at that right now. What I will say is if you are in a place that doesn't have very much disease out there, obviously I should mention it's always a personal choice as to whether someone chooses to wear a mask or not, and that should not be something that is stigmatized or otherwise. But in terms of our guidance, if you have a vaccine that is 90 to 95% effective and you don't have very much disease around, the chance of you getting infected should you meet somebody is already pretty low. But then the chance that you're going to meet somebody who is infected is also pretty low. So the potential for this to be a problem is much, much lower in areas with low amounts of disease, which is why we really need to work hard to get these areas in the country that have substantial and high amounts of transmission right now down to lower amounts of transmission to protect the unvaccinated and get them vaccinated, and also to protect the vaccinated.
Thank you.
Next question, please.
Our next question comes from Julie Stenheiser of Rutgers. Your line is now open.
Thanks. Hi. Dr. Lewinsky, can you tell me whether or not you are intending to start collecting and releasing data on the breakthrough cases? I mean, a while back, you had the CDC announced that they were not going to be, reporting on this data, but it looks like the Delta variant is changing the equation in a lot of ways. When will we start to see those data? Thanks.
Julie, thank you very much for that question because I would like to correct a misperception that is out there. The first thing I want to say is we are collecting passive reporting data on people who are hospitalized and who have died. But we recognize that epidemiologically, that is not going to give us the best information with regard to rates of breakthrough infection because passive data collection is generally underreported. In order to counter that, we have been collecting data through more than 20 cohorts of people. These include tens of thousands of people who we are following nationwide, and they include healthcare workers, essential workers, long-term care facilities, and in some of these cohorts, we're collecting PCR data from every person in them weekly. So we are absolutely studying and evaluating breakthrough infections in many different sites, many different people across the country. We are looking at those data on a weekly to bi-weekly basis, and we will be reporting on those soon.
That sounds okay. Next question, please.
Our next question comes from Cheryl Stolberger of the New York Times. Your line is now open.
Cheryl, are you there? Katrina, can we move on to the next one and come back to her if she jumps back in?
Certainly. A moment. Okay. Our next question comes from Andrew Joseph from Stat. Your line is now open.
Hi. Thanks very much for taking my question. And apologies if you already did this, but can you just sort of define how you assess substantial and high transmission? Like if someone, reading one of our stories wants to know if this applies to them, like how are they supposed to know what their community level of transmission is and, in turn, like when they should be wearing a mask and then, maybe if rates fall, when they can kind of get, put them back away?
Yeah, thank you for that question, Andrew. So CDC COVID data tracker tracks the amount of community transmission by county and is updated daily. It's color-coded, so substantial is orange and high is red. But I will give you, and in fact, most departments of public health and local jurisdictions track this pretty carefully as well. We can get you the link, of course, to find the data. But the important thing I want to continue is what it means. Substantial transmission is areas that have 50 to 100 cases per 7 days, cases per 100,000 over a 7-day period. And substantial is places that have more than 100 cases in a 7-day period per 100,000. So I do want to sort of articulate that we have places and counties and states here that are now reporting over 300 cases per 100,000 over a 7-day period. So really an extraordinary amount of viral transmission, which is what we're concerned about.
Next question, please.
Okay, our next question is Cheryl Stolberg. Your line is now open.
Okay, can you hear me now?
I can, thank you.
We have you.
Okay, that's great. Thank you for taking my call. I am wondering if, given what you now know about the Delta variant and the transmissibility, if the CDC is giving any thought to recommending vaccine mandates, for instance, of the federal workforce or of the military, which President Biden could impose, or mandates perhaps for schools or employers.
Thank you, Cheryl. So that is not something that the CDC has jurisdiction over. We certainly will be technical advisors to the government as they're making these decisions. What I will say is that we are recommending that communities look to their community levels and really look to what would motivate their communities to help get vaccinated. If businesses believe that it would be a mandate, then we encourage them to do so. We're encouraging really any activities that would motivate further vaccination. Not all communities are going to be responsive to a mandate in the same way. So we're really encouraging communities to look to their own areas and see what would be most motivational to get vaccinated.
Next question, please.
Thank you. Our next question comes from Asal Ahmed of AFP. Your line is now open.
Yeah, hi. Thanks for doing this. Dr. Walensky, high caliber masks because in areas where there's low vaccination rates, one would expect that mask adoption would also be low. And in order to sort of maximize personal protection, are you emphasizing N95 masks over cloth and surgical? Thank you.
Thank you, Assad. Right now, we're really motivated to get people masks to prevent transmission. If people have a personal choice as to whether they have access to and want to wear an N95, I'd leave that to their personal decision. The CDC does have guidance as to what are the best masks to wear, multi-layered cloth masks, surgical masks. So we're leaving that to the CDC guidance on masking.
Next question, please.
Thank you. Our next question comes from Michael Mahoney of KMB-CTV. Your line is now open.
Very good. Thank you very much. Doctor, given the definitions that you've had here of high and substantial transmission, and I understand that you're doing it county by county, would you consider much of the state of Missouri now as in a high or substantial transmission and subject to the recommendations that CDC is making this afternoon? And are some of the clusters that you're investigating also in the state of Missouri?
The state of Missouri, I'm actually just even looking, but my understanding is the state of Missouri is largely classified as high or substantial. It's not entirely classified. It's not entirely, but it's largely classified as substantial or high with a few exceptions in the counties. And we are collaborating with the state when they ask for our assistance related to outbreak investigations.
Katrina, we have time for 2 more questions, please.
Thank you. Our next question comes from Jonathan Wilson of San Diego Union Tribune. Your line is now open.
Hi, thank you for taking our questions. I guess one of the big, outstanding questions here is how much compliance we may get from, you might expect to get in terms of folks masking up indoors. Have you done any type of modeling work to get a sense of if you get a certain percent compliance, whether that would be sufficient in helping to drive down cases at this time? Just curious about that. Thank you.
We work together. Thank you. We work together with numerous modeling groups. I don't specifically know which ones might have examined that, so I think I should probably refrain from answering that right now. But I suspect that one of the modeling groups has examined this question. I really do believe that masking right now, especially for those unvaccinated, is the temporary measure. What we really need to do to drive down these transmissions in areas of high transmission is to get more and more people vaccinated, and in the meantime, to use masks.
Last question, please.
Our next question comes from Kimberly Russell. Your line is now open. Okay, Kimberly has disconnected.
If I may I just have one sort of closing remark?
Absolutely.
Thank you. So I just want to indicate that this is not a decision that we or CDC have made lightly. This weighs heavily on me. I know at 18 months through this pandemic, not only are people tired, they're frustrated. We have mental health challenges in this country. We have a lot of continued sickness and death in this country. Our health systems are in some places being overrun for what is preventable. And I know in the context of all of that, it is not a welcomed piece of news that masking is going to be a part of people's lives who have already been vaccinated. So this new data weighs heavily on me. This new guidance weighs heavily on me. And I just wanted to convey that this was not a decision that was taken lightly. Public health experts, scientific experts, medical experts, when I've shown them these data, have universally said that this required action. I saw it and I felt it when I saw the data myself. So I just wanted to perhaps close and say that this was not something that we took lightly and something that I know weighs heavily with me and with all of America.
Thank you, Dr. Walensky. And thank you all for joining us today. Like I've mentioned earlier, if you have any additional questions, please call our media line at 404-639-3286, or you can email media@cdc.gov. Thank you.
Thank you.
This concludes our conference. You may all disconnect. Thank you for your participation.
And there it is, everyone. The CDC saying yes. Masks are coming back for inside. You're watching Live Now from Fox. Coming up in just a little bit, 20 minutes, we will speak to a doctor talking about what this latest recommendation from the CDC means and how it feels as America, we are taking steps back in the fight of this COVID-19 pandemic. And happening right now, President Biden is here, and he is addressing right now the national intelligence right now, getting an update there. Let's listen.
President, and now as president, and have touched the lives of a great many of us over that time. And I know even this room is familiar. You were here as vice president in 2014 to commemorate the National Counterterrorism Center's 10th anniversary and to open the museum that's upstairs. And you know how special this community is. The extraordinary dedication, expertise, and passion the workforce brings to the mission of keeping America safe. And this community knows you too. One of my favorite things about working for you in this job is having a front row seat, frankly, as you engage our work. You are an avid consumer of intelligence. You see our work every day, perhaps most obviously in the form of the President's Daily Brief, which of course is produced as a consequence of the people in this room and those who are watching us from their desks here in the United States and abroad. People who collect, analyze, and otherwise support the delivery of the intelligence that underpins the briefs you receive, while also supporting your diplomats, your war fighters, and civil servants as they work for the American people. And in those briefs, you always ask hard questions, pushing us to do better, to bring the best expertise to bear, and to explain our views. But as you do so, you also always make clear that what you want from us is the unvarnished truth as we see it. You even like it, I think, when we provide an alternative or a dissenting view. And you push us because you want to have the best information with which to make the tough decisions that you are faced with every day. And we in the intelligence community are grateful for that fact. Our culture and our ethic is one of service and to provide you with what you as the first customer and others across the government need to lead the country to make the most informed decisions possible. And this is where I think our bond with you is particularly special and even personal. You have committed your life to service for this country, and those who join the intelligence community have that in common with you. We are bound by a common purpose to keep this country safe so that the people of the United States and beyond might prosper in a society that promotes human dignity and the values we were founded on. It is my great honor to introduce the President of the United States, and although normally we bring intelligence to the President, on behalf of all of us, I would like to thank you, Mr. President, for coming to us. How a president spends his time speaks volumes, and we are grateful to share this moment with you. Thank you.
Thank you very much. It's an honor to be here. I guess you all are the ones that lost the lottery, huh? You had to be here in person. Well, I'd like to thank Director Haynes and Director of National Counterterrorism, Senator Christy Abizade, for showing me around the watch floor. Folks, the main reason I came, and I mean this sincerely, is to say thank you. Thank you, thank you, thank you, thank you. The American people, almost by definition, are not able to know what you do. And you devote so much of your time, your effort, and many of you in the risk in your lives in the intelligence community to do things to make sure that your families and people back here are safe, make a difference. And you'd be amazed as I travel the world as chairman of the Foreign Relations Committee or a member of the Intelligence Committee for all those years, or as Vice President of the United States dealing with national security issues, or as President of the United States, how many of now my foreign counterparts thank you for what you do. I'd like to introduce you, by the way, to my National Security Advisor, Jake Sullivan. Jake, would you stand up? And, you know, the leaders of many of our intelligence agencies are here today, and I thank you for your diligence and keeping our country safe and your commitment to supporting your teams. Because if there's anything a team sport, it's what y'all are doing. If there's going to be anything that's going to be accomplished. Because the people I most want to honor and thank today are the intelligence professionals whose names the public is never, ever going to know, never have any notion what you've done for us. The analysts, the linguists, the collectors and field officers, scientists, support staff, so many others who are real experts whose careers started much longer before my administration and whose service to our nation is going to extend well beyond my presidency. You know, you're the eyes and ears around the world and the front lines of our national defense, and in many cases, for the world through us. And you serve the American people no matter which political party holds power in Congress or the White House. It's so vital that you are and should be totally free of any political pressure or partisan interference. It's basic. And I want to be absolutely clear that my administration is getting us back to the basics, I promise you, you will never see a time while I'm President of the United States for my administration in any way tries to affect or alter your judgments about what you think the situation we face is. I'll never politicize the work you do. You have my word on that. It's too important for our country. Getting back to basic also make sure the IC scrupulously acts within the legal constraints and abides by our strong traditions of internal and congressional oversight, including respect for whistleblower protections. And it also means understanding that much of the work you must do is in secret, but necessary and for the sake of safety. But we should strive to be as open as possible with the American people about the nature of the threats we face and just how serious they are and they aren't. Every one of you joined up because you believe in being part of something that's bigger than yourselves. It's especially you guys and women in uniform, bigger than yourself. You're patriots. It's a word that we use lightly, but I mean it. It's not, I don't use it lightly. I really don't. My son, who spent a year in Iraq and died, was a patriot. He wasn't just somebody else. You all are patriots. You risk your lives and your sacred honor for all that we need to have done for us. And you believe in the American idea, and living up to that idea is embracing democratic values that are our greatest strengths at the end of the day. Leading not just by the example of our power, but by the power of your example. The power of your example. In addition to thanking you for your bravery, integrity, and your sacrifices, I want to make it clear to everyone here today, and to the members of the intelligence community working around the globe, that you have my full confidence. It doesn't mean I don't question what you send me. That doesn't mean it's not that I'm not a new guy on the block in terms of these issues. But one of the reasons I question is to push you to the limits to determine just how certain you are about what you do. And lots of times, the only honest answer, we're not certain. We're not certain, but this is what our best judgment is. I really do know how hard the work you do is. I've been doing this for a long, long time before I became president. I know there's no such thing as 100% certainty in the intelligence world. Occasionally that happens, but rarely, rarely, rarely. But I also know that your work is invaluable to our ability to make informed, strategic national security decisions. And I just had an interesting meeting, as you all know, with my very close friend Vladimir Putin. I can tell. The one thing, I've been dealing with world leaders a long, long time. And just like all of you women and men, you can sort of sense somebody else after a while. He knows that you're better than his team. And it bothers the hell out of him. Not a joke. Not a joke. And he, as a consequence of you, thinks we have capacities he may even exaggerate. But that's a good thing. That's a good thing. You know, one of the things I miss most during the 4 years between my time serving as vice president and being a professor at a college, and I mean this sincerely, from the time I was 31 years old, every morning I woke up and got in a train to come to, I commuted every day from Delaware after my wife and daughter were killed. And I come every day, and one of the things I'd get a brief in the morning. I was more informed than 99% of the American people. You know what I miss most, for real, in those 4 years of being a professor? The PDB. Or you think I'm joking? I am not. A sense of knowing where all the pieces were. Whether we had it all down, we knew where all the pieces were. Knew where the pieces were. And so now I have access again, and as to the chagrin of many of you, I read it in detail. And I ask questions of my briefers and follow up with my team. And I ask each of you the same thing. I asked Director Haynes, just give it to me straight. I'm not looking for pablum. I'm looking for straight from the shoulder assessments. And when you're not sure, say you're not sure. But give me your best judgment of what you think is. Your best judgment is better than almost anybody else's judgment in the whole world. Even if the news is hard, even if the news is bad. I can't make the decisions I need to make if I'm not getting the best unvarnished, unbiased judgments you can give me. I'm not looking to hear nice things. I'm looking to hear what you think to be the truth. I greatly appreciate just how much work goes into the analysis that the IC produces and the tactical intelligence supporting your warfighters and the superb effort to ensure our IT, our human capital, and the facilities are the best in the world. Because again, without knowing what you while you're telling me, I don't know enough to know what to ask for from the Congress, how much money we need, what we need to focus on. It's a massive coordinated global effort to pull together reliable intelligence in a timely way. And all of you, no matter which agency you work for, are part of one team with one shared mission, keeping America strong and secure in the world, or simply making sure your families are safe. It gets down to basic things, just really basic things. You know, for most of the last 20 years, much of the work has been focused on counterterrorism, making sure the United States doesn't experience another horror like occurred on September the 11th. And that work has to continue and evolve to address the changing shape of terrorism as we find it today. And it's no great insight on my part, it's going to change significantly more. It's going to change significantly more. I always get kidded by my colleagues when I served in the Senate for 36 years for quoting Irish poets. They think I quoted Irish poets because I'm Irish. That's not the reason. I quote them. They're simply the best poets in the world. And there's a famous poem written by them that says, "All's changed, changed utterly. A terrible beauty has been born. The world is changing so rapidly, technologically, and in terms of alliances and human intercourse, that more is going to change across the board in the next 10 years than the last 50 years. That's not hyperbole. That's a fact. If I talked to you 15 years ago about hypersonic flight, you'd look at me like I was crazy. So much is going to change. And that's going to put an enormous burden on you to stay ahead of the curve. It's really going to get tougher. But we have the best folks in the world. And one of the things that I think, and I don't want to get off too far afield here, but one of the things that's really important is our greatest strength, in fact, is our diversity, bringing completely different perspectives to it. And I really mean that. That's not hyperbole. I'm not trying to be kumbaya, everybody get along. It's just a fact. It's a fact. And so threats that are more geographically dispersed than they were 20 years ago are going to continue to require our vigilance. We have to continue efforts to better understand some of the hardest and most important intelligence targets we face as a nation. But, you know, we also need to make sure we're positioning ourselves to stay ahead of the security challenges that will stretch the IC in new ways that never been stretched before. You know, we've seen how cyber threats, including ransomware attacks, increasingly are able to cause damage and disruption in the real world. I can't guarantee this, and you're as informed as I am, but I think it's more likely we're going to end up, if we end up in a war, a real shooting war with a major power, it's going to be as a consequence of a cyber breach of great consequence. And it's increasing exponentially, the capabilities. When I was with Mr. Putin, who has a real problem, he's sitting on top of an economy that has nuclear weapons and oil wells and nothing else. Nothing else. Their economy is what, the 8th smallest in the world now? Largest in the world? He knows he's in real trouble, which makes him even more dangerous in my view. Take a look at China. I've spent more time with Xi Jinping as a world leader than anyone else has. I spent 25 hours alone with him when I was vice president because it was important that, according to President Obama, that someone knew who the new guy coming on board was, and it couldn't be the president. Travel 17,000 miles with him. I've sat with him, with me, and just an interpreter. Each of us have a simultaneous interpreter. He is deadly earnest about becoming the most powerful military force in the world, as well as the largest and most prominent economy in the world by the mid-40s, 2040s. It's real. I don't know, we probably have some people aren't totally cleared, I don't know, but you saw just what we found out about hypersonic. Anyway, as they say in Southern Dole, this boy's got a plan. And, you know, we better figure out how we're going to keep pace without exacerbating and moving us in a position where we increase the hostilities unnecessarily. I think we also need to take on the rampant disinformation that is making it harder and harder for people to assess the facts, be able to make decisions. In today's PDB, you all prepared for me. Look what Russia is doing already about the 2022 elections and misinformation. It's a pure violation of our sovereignty. Now you see what's happening. More people get their information from the internet than they do from any other outlet. What's all the disinformation that's having real consequences in terms of people's access? And so there's so much that you all, particularly those of you who are new and coming along, are going to have to keep up with and ahead of in ways that are not even happening now, as good as everything is. You know, as we compete for the future of the 21st century with China and other nations, we have to stay on top of the cutting edge developments of science and technology. If you'd hold for a second here, I want to point out something. You know, we used to be, when I first got here as a U.S. Senator, actually 3.5 decades ago, we invested more money, R&D, money in R&D as a percent of our GDP than any nation in the world. We're now number 8. China was number 9. They're now number 2. It matters. It matters. Look where we are in things that intelligence communities and others don't even think very often about how educated the public is. We're coming around right now. This doesn't relate to the intelligence community per se, but it does. Think about it. If we were having a debate that was taking place in the United States in the late 1890s and the early 1900s about public education, do you think any of us would say 12 years of free public education was enough to compete in the 21st century? Not a joke. Think about it. What do you think? I don't think there's a shot if we were doing that today. So the fact we have the best educated public in the world, that that's our objective, will matter a great deal. Matter a great deal. It is as much a part of national defense, in my view, as anything else is. So I think we have to think differently. I don't expect you to agree with me. I expect you to at least understand where I'm coming from. Because the world is changing so significantly. And it's especially important that we work closely with our partners and allies to maintain our technological edge, shore up supply chains, ensure that the rules that govern technology support democracies, not autocracies. You know, at the same time, we have to work in cooperation with nations like China and Russia that are competitors and possibly mortal competitors down the road in the context of to meet the existential threats, for example, of climate change. There are certain things that are in mutual interest. But we can't be lulled into thinking that that's enough and that we don't have to really keep a watchful eye on what the ultimate objective of the other team is. But there are things where we should be cooperating. This shared danger impacts all nations. Climate challenge is already accelerating instability in our own country and around the world. Extreme weather events that are more common and more deadly. Food and water insecurity. Sea levels rising, resulting in changing climate, driving greater migration, and posing fundamental risk to most vulnerable communities. We could hold for just a second again. We're in a situation where, think about this. Think about this. I'll never forget the first time I went down in the tank as vice president after he got elected. The Defense Department said, what's the greatest threat facing America? Climate change. If in fact the sea level rises another 2.5 feet, you're going to have millions of people migrating, fighting over arable land. You saw what happened in North Africa. What makes us think this doesn't matter? It's not your responsibility.
All right, everybody, we continue on right here on Live Now from Fox. It is a new hour. It is 4 o'clock out on the East Coast, 1 o'clock out on the West Coast. Big story of the day, obviously, CDC announcing the new guidelines there. It seems like now we are taking steps back in the COVID-19 fight. Now masks are back on. We want to get some updates here and really some guidance of our own right now. So that's why we bring in Dr. Nicole Saphier, Fox News medical correspondent with the very latest. Thank you, Dr. Nicole. First off, what are your thoughts on this?
Well, it wasn't unexpected, I'll be honest and tell you that. I do think that, unfortunately, putting forth some of these vague recommendations about starting to wear masks again, vaccinated or not, does contribute a bit to vaccine hesitancy. But as you can see, there are areas in our country where you are having rising cases of new cases. You're also having rising vaccines. So what are we going to, rising hospitalizations. So what are we going to do in these areas? And, the go-to right now is to do mask mandates. Whether or not that's actually going to do anything, I'm not sure. But we can tell you when it comes to the vaccines, they are still very good at preventing severe illness, specifically in those who are at high risk. So I would still encourage everyone to go out and get vaccinated who wants to, who doesn't have a contraindication. But at the end of the day, there are certain people who maybe should be wearing masks again, those who are immunocompromised, those who are over the age of 65, vaccinated or not. As we see, about 75% of the severe breakthrough infections are in those people who are over 65 years of age. I do not think universal mask mandates are the way to go at this point.
And maybe help our viewers out here, because months and months for now, the White House has really been pushing for people to get vaccinated. So much so, it seemed like every week we were getting updates on the percentage of people getting vaccinated. Now it seems like if you're on the edge and maybe contemplating it still about getting the vaccine, maybe you wouldn't now, because what's the point, really?
Well, so that's a very good question. So my concern is, by saying that vaccinated or not, everyone's going to need to wear a mask if you are in an area where there's higher transmission. And while I do think that high-grade medical mask wearing is warranted in those who are vulnerable, those who are over 65, even if they're vaccinated, and those who are immunosuppressed, if you are in tight, indoor, crowded areas where you're around a lot of people and there could be a good amount of virus circulating, yes, I actually think that those people should be masking up. But I think for the general population, even if there are in areas where the transmission is high, I think that for the majority of the people who are vaccinated, they are still going to be protected from severe illness and hospitalization. We have to stop looking at the new cases and really should just be focusing on hospitalization, because unfortunately, our testing is not uniform. We have some states that are testing a lot of asymptomatic people who have been vaccinated, and whether or not those are clinically significant infections and leading to increased transmission, I would say probably not. So unfortunately, I do think that our data is a little muddied, and we should really be going by hospitalizations. And when you look around the country, even in the states that have some of the highest cases right now, Florida, Missouri, and other areas of the Sun Belt, their 7-day average of deaths and even hospitalizations are still much lower than we have seen throughout the course of this pandemic. We have to start putting COVID-19 in an area of risk versus benefit. We have been okay with certain levels of risk when it comes to many other things, certain bad flu seasons, certain respiratory viruses in children, car accidents, even accidental drownings. You have more people dying of more children who die of accidental drownings than COVID-19, yet we haven't shut down pools.
Very, very good point. And what about alcohol? What about tobacco and all that as well? That is still freely available, and everyone has issues with that as well. And then, Doctor, can you also talk about the CDC talking about masks for kindergarten to all the way senior in high school?
So listen, I'm a physician, I'm a mother of 3, so I have many different opinions on this, and it's all about risk-benefit here. And while there are some children, albeit extremely rare, have had severe outcomes from COVID-19, it does appear that it is very rare. Less than 500 children out of probably over 10 million that have been infected with SARS-CoV-2 have had a severe outcome, whereas you have over almost twice that much who die of, say, RSV and other respiratory illness every single year, and as I mentioned, drownings and car accidents. I think that the risk of wearing masks every day, especially for the younger children, less than 12 years old, I think it really does impede on their social development, their ability to have facial recognition. They can have some dentition problems. They can have some anxiety. I think the risk of those consequences of mask wearing really doesn't outweigh the benefits of children wearing masks. We have seen in multiple studies that when you're looking at school transmission, it isn't necessarily the young children having in-school transmission, it was the adults. Now, those studies were done before vaccines were available. So now that the adults have the opportunity to be vaccinated, the chance of transmission inside of schools really approaches zero. And as we know, severe outcomes regarding hospitalization and deaths in healthy children also approaches zero. So really, what are we trying to do by masking children at this point?
Absolutely. And another thing to really ask about, too, a lot of people might be looking at this one, where earlier in that announcement, the CDC did say talking about color-coded areas of the U.S. that are going to be maybe in a different zone than, say, a different city out west or east or vice versa. But how does that even match up? I mean, is it one day, hey, you got to wear a mask, and then a week later, maybe not if you're in the right color code?
Well, so that's the big question. I mean, unfortunately, the local townships are going to have a real issue about going back and forth. And so what they're going to need, they're essentially not even going to do this based on community transmission. What they're going to do is just do a blanket response, say, you know what, forget it. Kids are just wearing masks all school year long. That doesn't, and unfortunately, when you do that, because it's too hard to wax and wane based on community transmission and to wax and wane based on the ever-changing CDC recommendations, you're going to have children wearing masks when it's probably unnecessary, but that is because we have had such inconsistent messaging.
Yeah, it just seems like a back and forth right now. And lastly, Dr. Nicole, a lot of people might be saying this, that hey, they did it once before with lockdowns, shutdowns, mask mandates. This seems like it's just really easy for them to pull it on back. What happens if they never take it the other way again?
That's a really good point. So you have to remember, a year ago, when mask mandates were going out, we had no mode of protection against this virus. We didn't have a vaccine, we didn't have proven treatments, and we certainly didn't have over 2/3 of the population with some form of immunity. We're in a very different place than we are right now. And it's important to remember that. And yes, while you see these cases rising, you're not seeing the parallel rise in hospitalizations and deaths. Yes, you are seeing a bump in hospitalizations because this Delta variant is extremely contagious, and it is actually causing a higher viral load in people. However, as it has been reported, over 99% of the people who are dying from COVID-19 right now are unvaccinated. I wish that they would report how many of those people also didn't have a history of a COVID-19 infection, because I think it is very disappointing that they are continuing to not acknowledge natural immunity at this point. But I actually think as a country, we're doing much better as a whole than the media headlines would make you think. There are pockets of the country that have low vaccination rates, low immunity rates, and they are going to see a bump in COVID cases. But again, we are not going to get to the same place as we have been during the first and second wave with hospitalizations and deaths, because over 90% of those 65 years and older have at least one dose of the vaccine. We have a staggering amount of immunity happening all across our nation. Yes, we want to make sure people are still going out and getting the vaccine. Those who have gotten the first dose go and get that second dose. But the good news is we have a high level of community immunity. So we need to actually become more uniform in how we are testing and reporting of new cases, because I can tell you that I actually don't think that we are in as bad of a position as the media headlines would make you think.
Yeah, I just don't know where this all came from this week, because if you think about just 2 weeks ago, 3 weeks ago, I mean, in the media, we were being told, hey, let's go to other topics. Let's try to find different stories. You know, COVID-19 is coming on the downtrend. And then starting this week. You sort of saw something happen yesterday when some of these cities, like even states like California, Governor Gavin Newsom, begin to talk about COVID-19 again and maybe talk about masks. I mean, how did this all, just a month ago, they said, hey, Vegas is back, everyone's back.
Well, it's upsetting. It's upsetting to say the least, because if you would just take a snapshot of what's going on in the media, you would think that this Delta variant has its grip on the United States and we're in a terrible position. But if you actually look at it, right now, on average, you have about 220 people dying of COVID-19 a day. Well, obviously, any death is tragic. 220 deaths a day is what we have deemed acceptable previously in bad flu season. We also have more people dying of cardiovascular disease, cancer, opioid epidemic, drug overdoses than COVID-19. So while it makes for a really good headline, we actually have a lot of other things going on in our country causing a lot more disability and death every single day. But again, that's the name of my book, Panic Attack, because these make for really good media headlines. Now, that's not downplaying the significance and importance of the Delta variant. Sure, it is more contagious. It causes a higher viral load, which means it can send more people to the hospital, and we are seeing some breakthrough vaccine cases. But if you are vaccinated and an otherwise healthy individual, the chance of you having a severe outcome of COVID-19 or you giving it to someone else really is about nil. But for those people who are over 65 who are immunosuppressed, then in that case, yes, I would consider maybe changing your lifestyle a little bit to, again, further decrease your risk, however best you can, because it's possible booster shots will be in your future.
Dr. Nicole Saphier, thank you so much for always giving us really the insight and really the context, really behind this whole pandemic. We truly always appreciate it. And thank you so much for your time. Have a great day. We appreciate it.
Thanks so much for having me.
Yep, no problem. And we continue on with more news from across the country right here on Live Now from Fox after this 2-minute break. And we continue on here on Live Now from Fox, everyone. As we continue on here, we just talked to a doctor breaking it all down for us on this CDC decision, talking about masks for those that are even vaccinated in some areas. And right now we are going to be getting a fresh update from California in just a little bit, talking about as they try to vaccinate more Californians across the country.
of us to see this last year. Everyone is entitled to be healthy, and I really honestly believe that. And oftentimes those vulnerable populations do not have access to health care for a variety of reasons. And this bill today that is going to be signed is going to be one step closer in making that happen. Health care is a basic need, one we often take for granted. And that is the driving force behind Assembly Bill 133, making sure that the basic needs of Californians are met, especially in our underserved population. It's also the importance of everyone getting the vaccine. We want to reemphasize that time and time again. I'm encouraged by the fact in Fresno County last week, we had 11,500 people be vaccinated. We are now at 50. We are now in Fresno County at 56.4% of our eligible population. Those are 12 and older. And 86% of our population that is 65 and older have been vaccinated in Fresno County. But we have so much more work to do. We have got to get those numbers up, and thank you to Clinica Sierra Vista for all you do to make sure we're getting the vaccines. Thank you to the governor for what you put in motion this last week at the state, and I believe we're going to see local governments follow suit very, very quickly. And so with that, I want to introduce Jose Torres Casillas, and he is from Health Access. Jose?
All right, thank you, Mary, and good morning. Buenos dias, buenas tardes. My name is Jose Torres Casillas, Policy Advocate with Health Access California, the statewide healthcare consumer advocacy coalition. We are a proud co-chair, along with the California Immigrant Policy Center, of the Health for All campaign to ensure access to Medi-Cal for all Californians, regardless of immigration status. Along with the nearly 100 organizations that are a part of the Health for All coalition, we are thrilled to be here witnessing history. With the signing of AB 133 today, California will move closer than ever to universal health coverage. These first-in-the-nation investments will expand healthcare to hundreds of thousands of Californians and improve our health system for all who call California home. Since 2013, advocates have pushed to end harmful exclusions in Medi-Cal for undocumented Californians. In 2016, California expanded Medi-Cal to all children, and 2 years ago, Governor Newsom led California in becoming the first state to expand Medi-Cal to young adults as well. Now, today we are here proud to stand alongside the governor as well as our legislative champions, Senator Durazo and Assemblymember Arambula, as we continue to lead the nation in the march towards universal coverage by removing the exclusion in Medi-Cal for undocumented Californians over the age of 50. This means that people like my tios, my tias, mis abuelos, they can go and access a primary care doctor, that they can get treated for the variety of chronic conditions that they may be experiencing as they're getting older now, or and see about any other issues that may have been exacerbated by the pandemic. AB 133 makes major investments in improving the Medi-Cal program as well, so that all who now have access can get the care that they need. This includes removing the Medi-Cal asset test, expanding doula services, and continuing CalAIM reforms. On behalf of Health Access California, the Health for All Coalition, and healthcare consumers, we are thankful for these major steps toward a more equitable and inclusive health system. Today, we celebrate these victories for California's health and commit to continuing to improve our health system to create a true California for all. And so next up, I would love to introduce my colleague Beatriz Hernandez with the California Immigrant Policy Center.
Hi everyone, my name is Beatriz Hernandez with the California Immigrant Policy Center. As I stand here, I'm full of emotions to represent my undocumented community, Health Access, and the California Immigrant Policy Center, and all advocates and organizers who made this possible today. I'm out of words, to be quite honest. I am undocumented and I know what it's like to not have access to health care. I beneficiated from the expansion of young adults to get access to health care, and I want that for everyone, for all Californians, regardless of where they were born. It is such happiness, and I'm here to thank Governor Newsom and everyone here today who made this possible. And to all of you watching at home, know that this is the right thing to do, especially now as we're all dealing with the pandemic and losing loved ones. We all need this access to healthcare now and when we recover from the pandemic. It doesn't matter the color of our skin we're born. We all deserve this, and we all contribute to the social fabric of this state. So I want to say thank you y un saludo y mucho amor para toda mi gente del Valle Central, a todos los campesinos y toda la gente que trabaja día y noche aportando y dando a esta economía, a este estado, porque sin ellos pues no estuviéramos aquí, ¿verdad? Entonces muchísimas gracias, and yeah, that's all I have to say. Thank you. Now I would like to introduce Senator Eggman.
Good afternoon, everybody. I am very honored to be here in this clinic with all of you. I'm just standing here reflecting. I have worked in and around healthcare since I joined the United States military at the age of 18 and was a medic, and have worked way more years than I'd like to admit in and around healthcare. And this year, when I went to the Senate and was able to become the chair of the budget health on Health and Human Services, it was like a dream come true. And I know I speak for my colleague Joaquin Arambula as well, who's also worked in the healthcare. And when we started this year, thinking that was going to be a terrible budget year, and then when we were able to see that the very wealthy did very, very well, very, very well, and it shows by the excess of money that we're able to have. So what better use of all of that money of people who have done very well than to help those who helped them do so well. And so we not only are able to expand access, but we've been able to expand what is provided. In public health, we're putting a lot more money. In mental health, I'm a social worker. In mental health, huge amount. We know the trauma that people have incurred. We know the stress that people have been under. We know mental health as just as important. We've worked on telehealth, so you don't have to drive all day. And I still have a bill that hopefully we can do 2 billings on one day for both medical and mental health care. But then to be able to provide expanded health care, really to be able to do good work, and then to expand it to those who had no access. That was our goal this year. We were glad the governor partnered with us. The Latino Caucus, I'm proud to be a member of. That was one of our priorities, and I know Dr. Arambula and I both pushed on our sides. So it was a combined effort, but really it's your stories, the stories we've heard. And through the pandemic, we have seen so many of our essential workers are brown skinned. So many of our essential workers are even from our API community as well, who are undocumented folks who didn't have access, but were out there in the front lines so we could still eat and so we could still survive. So to be able to cover as many people as possible is one more step to really fulfilling the dream for all of us. So I want to thank the governor, I want to thank the leadership in the Senate, my colleagues up here, all the advocates, and then introduce my colleague, my friend, Dr. Joaquin Arambula.
Now, it's hard to summarize all the work that you've done for 6 months in 6 minutes, and I will make sure not to talk for 6 minutes today, as I'm sure many of us want to hear from Governor Newsom and see him sign AB 133. But there's a fair amount that we have not spoke about that is within this bill that needs to be addressed and love to follow up. Whether or not that's California leading the way with the Children's and Youth Behavioral Health Initiative, which will allow our children to receive resources and benefit after going through this pandemic of the century. Whether or not it's the California Advancing and Innovating Medi-Cal, an innovative program that will focus on population health, on enhanced care management, and in lieu of services, ways in which we can improve the very system that a third of all Californians rely on. The programs that are also in here to help us to expand workforce, as in the health profession career opportunity programs, that will allow thousands of students to be able to enter into a health career field after this pandemic of the century, is something that we need to highlight today. But I'd like to talk about, if I can, the importance of increasing access to health care, as it has been a major driving force for me leaving my career field practicing medicine. But it was seeing those inequities firsthand that led me to running for office in the first place. What happens to our essential workers, to our frontline workers, to our ag workers who are working in packing houses, to those who are taking care of us within our health facilities, to those who help to put food on every one of our tables? We have seen how they have helped to keep our economy going and essential to our state functioning during this pandemic. But it's those same workers who bore the brunt during this pandemic. It was those same people who suffered the worst consequences, and it is why it is so important that in this budget we are doubling down and investing in those same communities. It is our immigrant brothers and sisters, our communities of color, who are going to benefit from this increase in access. It's going to be our elders and seniors, our income-eligible uncles, aunts, grandparents, our families who will benefit from this investment and increase in access. But it does not go without advocacy for years. From groups like Health Access to the California Immigrant Policy Center to great legislators like our champion, Senator Durazo and Senator Eggman, as well as our tremendous leadership with Pro Tem Atkins and my speaker, Anthony Rendon. But none of this is possible without our governor, Gavin Newsom, and the great state of California continuing to invest in all Californians. I will say how important it is to increase this access, but I believe those who will benefit will speak more about what it means to them. As a representative for the Central Valley, where I have the honor and privilege of representing many people who contribute and pay taxes but can't always benefit from the health care systems they pay into, today they can. It is for those elders and seniors who have been paying taxes for years that we will now be able to provide health care coverage, and this is a day we should celebrate. This is a day we should be excited and recognize that our government is working for the people, and I am so pleased to be doing the people's work. Thank you for allowing me to share what is within AB 133, but I would be remiss as a physician not to also uplift the importance that our vaccines play right now. They are our best protection and defense against COVID-19 and the variants like Delta that is going through our communities right now. It is important for everyone, regardless of immigration status, to receive vaccinations, and wants to make sure to encourage everyone to come out and do that. Now, without further ado, I would like to introduce my friend, my colleague, our champion, Senator Maria Elena Durazo.
Thank you very much. Buenos días. Todavía son buenos días. Yo soy senadora María Elena Durazo, representando al área de Los Ángeles Central.
And we will take another quick 2-minute break right here on Live Now from Fox.
Central Los Angeles in the 24th District. And as my colleague said, I want to acknowledge him, Assemblymember Arambula, Senator Eggman, our legislative leadership, President Pro Tem Atkins, Speaker of the Assembly Rendon, the Latino Legislative Caucus, advocates, supporters, activists. Congratulations to everyone for your hard work in raising this issue. Today we stand and we are proud to be Californians. Governor, we are proud of what we have accomplished together. You have combined humanity and reality, pragmatism and idealism, and a good heart with great courage. Through all of your efforts, we have seen California first expand to cover approximately 250,000 children and young adults. And now, today, approximately 250,000 more Californians, 50 and over, will also receive basic health care. This is an important day to celebrate. It's a milestone for our Health for All movement, especially in the wake of this global pandemic. The cost of doing nothing is far greater than the cost of providing coverage. People suffer, people lose their lives. Our healthcare system works best when all Californians have access to preventative treatment. Too many states have made healthcare impossible for immigrants to get. Now, those very same states are making it harder for people of color to vote. California is better than that. And I stand with you, Governor Newsom, as a proud Californian. Thank you very much. Solo quiero decir unas cuantas palabras que hoy nuestro gobernador demuestra un buen corazón y gran valor al firmar la.
All right, folks, we are going to go to another live event here that just popped up. We are going to this virtual meeting right now. This is with Emory University. They are talking about the latest CDC news as well as the surging cases of COVID-19 in the U.S. Let's listen.
So that we can be able to continue our daily lives. The recommendations for mask wearing for vaccinated also feels a little bit maybe like a punishment. You got vaccinated, you're following sort of public health advice, but in general, we don't want anybody to be infected, even if there's a small chance for you to be infected and there's a small chance for you to transmit it. This is just a way to sort of really stop that transmission at all times. And make sure that it's not going to persist and also mutate any further.
Great, thank you, Dr. Kraft. And if anyone has any questions, please enter them in the chat function. So we'll hold for questions. Oh,
Catherine, do you answer them as they come in, or?
So, Dr. Kraft, did the CDC move too quickly to lift its mask guidance when it did?
Thanks, Sam. I appreciate the question and as always, your engagement in this topic. So I think in general, they did not move too quickly to lift the mask guidance. We were not dealing with the percent of the Delta variant that we are today. Over 80% of people that get COVID today are getting the Delta variant. That's how quickly it's spreading. And so I think there was a time during the summer when we had such a low community prevalence and people's whether they were mask wearing or not, the transmission was really low. And so I think that the mask guidance actually was really appropriate for what we're seeing. I don't think any of us really want to be in this position or want to go back to masking. But again, we're finding ourselves in the same place we were a year ago, July 2020. And I think instead of sort of making nuanced guidance, I think trying to just make sure that everybody understands we've got to go back to stopping transmission is our most important part of this.
Thanks, Dr. Kraft. I can read the next one.
Okay, thanks.
So with the relatively low vaccination rate in Georgia and the pace really slowing down, what can and should be done to boost numbers? And what can state leadership and DPH and others be doing as vaccination rates have stalled and numbers rapidly rising?
Yeah, so I'll start with sort of the middle question first. What can state leadership and DPH and others do as vaccination rates have stalled? I think telling personal stories, sharing your own vaccine success is really important. So I was going to say, if anybody on this call has any ideas on how we can communicate this better to the public, I would really cherish those ideas. I think the best way that we've boosted vaccination rates locally at our healthcare system is just through relationship building. And when one person gets vaccinated and they feel fine and they don't have a lot of side effects, or they, they feel like they've benefited quite a bit from having the vaccine, they can kind of do things that they hadn't done before. Those anecdotes tend to trigger people who trust those individuals to then themselves go get vaccinated. So I think that's what we can do, is sort of share our story, share our encouragement to get vaccination. There's always going to be fear. There's always going to be confusion, especially, there's the whole idea of it's not FDA approved or not, and I want to wait for FDA approval. I think given the hundreds of millions of people that have been vaccinated and the safety that it's shown, I think it's something that's really important for us to do it for ourselves, and then also describe for other people, what our experience was, and encourage them to get the vaccination as well. And I would love to know what we can do. I've tried all sorts of different ways. I think the personal and relationships and trust are going to have to be something we really try to work on in order to get individuals to get vaccinated.
Thank you, Dr. Kraft. The next question, Dr. Walensky said today that new evidence shows breakthrough cases can transmit the virus. and have about the same viral load as the unvaccinated. Does that align with your research or expertise?
So that's a great question, because remember, we really felt like the vaccination, there was an aspect of it, it's protecting sort of your shedding of the virus after you get it. And so when we see these breakthrough cases, these are people that that are actually not producing enough immunity to fight against that variant, and it's going to be most likely the variant in this case. And so, that sort of setting up shop in your nose and making you symptomatic is going to produce enough virus to be able to transmit it to somebody else. But I mean, the benefit of having the vaccination is that you yourself should not be seriously ill, and for sure not hospitalized due to that breakthrough infection. So again, this is why we're going back to this masking, which is we just really need to stop transmission. And vaccinations certainly stop transmission, but with a low vaccine uptake and a lot of hesitancy, then we need to go back to sort of our things that we know stop transmission. So we know the Delta variant can't get through masks. And so we need to go back to the things that worked, even though we were hoping with increasing uptake and vaccination that people could kind of be able to do their normal activities. In terms of it aligning with my experience or expertise, we have seen that people who have symptoms and don't have symptoms often have the same amount of virus in their nose, which to me was very disturbing. We learned this very early on. So you can have billions of copies of COVID in your nose, whether or not you have symptoms or not. And that's just because of how quickly it infects the cells in your nose and inside your nasopharynx.
Great. So the next question, has the U.S. put too much faith in vaccination, especially since we've been unable to get vaccination rates up? It seems like the focus on vaccination as the answer to ending the pandemic undermines the value of other NPIs like masking, distancing, etc., which maybe we're seeing now with the CDC reversing its course.
Yeah, so I think that we needed to put our faith in something. I do think that if we had achieved sort of a high vaccination rate, we would have felt that we had been able to stop transmission before the Delta variant could have gotten into our borders or come from our borders, whichever way it was transmitted. So I think that there's a lot of individuals. I think the masking aspect there was a lot of fatigue with that. And so trying to get masks off by vaccination, I think was an appropriate, logical aspect. It's just that we didn't get as many vaccinated as we'd hoped. So I do think that.
Okay, everyone, we are going out to some live breaking news out of Wisconsin here. Well, we're going to go back to the shot once it clears up. It looks like it will in just a moment here. But a house explosion in Rome, Wisconsin right now. And we're hoping that that will clear up in just a little bit here for us. But this is a house explosion right now. Crews are on the scene, and we'll get you a little bit more info. Of course, we'll go back to it when the shot does clear up as well. They're having a little bit of signal issues there, but we'll work on getting some more updates for you. But we have a fire department there on the scene in Wisconsin of that house explosion.
That quite a bit in our practice. Just having been in a lecture hall at a different part of Emory University, there's a lot of plexiglass up, still in a lot of businesses. They've done some of these mitigation strategies that they probably don't plan on taking down. So I think in general, we have, the stickers on the floor that says 6 feet haven't been pulled up. So I do think that we have tried as a society to try to work on if we can kind of go about our daily work with masks and distancing and plexiglass if needed. But I think that, at this point, universal masking is going to have to come back in order to really stop the transmission cycle of the Delta variant.
Okay. So the next question, how do you anticipate this new guidance will affect COVID-19 safety policies at colleges and universities?
Yeah, so I think this is exactly what businesses are going to be facing, like I just described. I think people putting their policies in place, maybe at the end of the semester or middle of semester last year, I think they're going to continue to have to keep expanding on them, where I think many people, even myself included at the beginning of the summer, was hopeful that, we'd had enough vaccination plus natural infection that we could keep it at a very low sort of endemic level of transmission. So I think that U.S. colleges and universities, and I think a lot about elementary schools and high schools because that's the age of my children. I think that there'll be continued enhancement of trying to balance that ability to sort of allow people to have some independence where they can, and then also where there's high levels or high ability to have spreading of COVID, that they'll have to work to mitigate those.
Great. And I also included Emory University's policies in the chat. So next question, with breakthrough cases you've seen, what are the demographics of serious cases?
Yeah, so the demographics of serious cases are the same demographics of our serious cases that we've had all along. So these are individuals that are almost always not vaccinated. They are individuals that have chronic medical problems, and they're sometimes individuals that may have had their chronic medical problems under control, but this leads to a series of things getting worse, all at once. So that's really the demographics of our serious cases, are the same as they've always been.
Great. And you talked about not as many people vaccinated as we had hoped. Is it enough to hope? Should vaccines be pushed harder, mandated? If so, by whom?
Yeah, so I think, Sam, I appreciate your good questions. So I think that, we've really tried to straddle as a country how to support public health during a pandemic where there are fairly extreme perceptions about the pandemic. And so as somebody that wants to respect an individual and their decision to make a decision about their own health, I am a physician, I'm a clinician, I want to empower people. I think that we are probably going to be getting into the mandated aspects, at least for some groups of people. You can look in the Emory University FAQs regarding students. So in some places where it makes sense, and that can be mandated because people will have a choice whether or not they're going to be there, I think that makes sense. I just have a hard time, especially because it's not FDA approved yet, of us completely saying we should mandate masks. I think there's a logic that most people want to know that the FDA has approved vaccines prior to mandating them. It is probably not enough to hope, Sam Whitehead, as you said in the chat, but I think that we are trying to balance really wanting people to feel like they do have a choice on what they can do. I think if we push harder, I think we end up with side effects that maybe we don't, side effects not of the vaccine, but side effects of the culture that sort of seems to form the core of who we think we are as Americans. I'm not saying that I wouldn't advocate for a vaccine mandate, but I also want people to be educated, make their own good decisions as well. So I think to me, it's that balance, and I'm not sure that we're hitting that balance yet.
Okay, great. So we'll take our last question. Should parents worry if their school is not mandating masks?
Yeah, so this is, there's been a lot of variability among schools, and it just depends on sort of what their county or state or if their private school can do. And so I think that, this all depends on the community prevalence. So there have been schools, even in the state of Georgia, that have not done mask mandates, and they have had to mitigate their risk and transmission throughout the school year in the ways that in their local areas. If you're in a region that has very low prevalence and people are masking in general in public, I'm not sure that it's worrisome to not have masks in school. It's really all about the context of the school. And if they're going about it in sort of a safe way, that they're not mandating masks, or if they're, if it's more of a, just sort of not based on any rational judgment, then I might be concerned.
Great. Thank you, Dr. Kraft. So we'll be wrapping up today's briefing. Did you have any follow-up remarks?
Yeah, I've actually, even though this feels like a one-sided discussion, I've actually really enjoyed these questions. I think this is something that we're all wrestling with. I think people that have been vaccinated and trying to follow every guidance that comes out are feeling discouraged, that we sort of have to go back to that they, wanted to kind of put into practice. But I think we have to refocus the conversation, and I would love any ideas on how to try to encourage people to get vaccinated. But to focus it on transmission, stopping transmission. So, I sometimes say if we could have contained it early on, we wouldn't have needed a vaccine. And so I still think that if we can stop the transmission, then we will wear masks for a shorter time. Things will be more efficacious. But if we kind of always approach these ideas sort of half-heartedly, then I think that we're going to kind of continue this sort of behavior where we're going to have a surge. I think for those of us that have been in healthcare during all of this, to have another surge after having vaccine available to everybody is highly discouraging. And I think we really need to figure out how we can motivate, encourage people so that we don't have to be doing, these types of kind of back and forth. I know that also introduces confusion into the population, and we don't want to.
Great. Thank you, Dr. Kraft. So now we'll be wrapping up today's media briefing. So I will send out the recording within 10 minutes when we wrap up. And if you have any follow-up questions, please reach out to me. You guys all have my email. And thank you for joining today's briefing. Thanks, everyone.
With that wrapped up, everyone, let's take a quick 2-minute break right here on Live Now from Fox.
Presley. We're here very simple today. We're here today to call on President Biden to extend the pause on student loan payments, which is right now set to expire in September. Now, we all know the pause was put in place at the beginning of the pandemic. It was already extended once by the President. It's proven to be one of the most effective steps that the government has taken to help Americans get through the health and economic crises created by COVID-19. That's why last month, Senator Warren, Representative Presley, and I, along with many of our state, Senate, and House colleagues, sent a letter to President Biden asking to extend this pause to give Americans more time to get back on their feet. COVID created severe hardship for some, threw many others off their stride. To make borrowers repay their debts now would be unfair, would be harsh, and in many instances would be cruel. People were thrown off their stride by COVID. Give them a chance to recover. Wait till the spring. That's all. Well, that's not the only thing we're asking, but that's the first thing we're asking. We are also continuing to call on President Biden to use his existing legal authority to cancel up to $50,000 of student debt. This pause has actually shown how important canceling student debt is to borrowers and to our economy. We've heard about how being saddled with this debt has affected millions of Americans' lives on so many choices that they'd like to make. They're not able to pursue the career they want. They're putting off getting married or starting a family. They aren't able to open a business, buy a house, even buy a car, which many of them need to get to work. So we know how much of a difference extending the pause makes. Well, 10 times over, canceling $50,000 in debt would be even more important and helpful to these folks who are borrowers, to get the economy going, and to deal with the racial inequality which student debt has exacerbated. Resuming these payments could stall our country's economic recovery. It could bring millions of loan borrowers to the edge of financial crisis. If the pause on student loan payment isn't extended, the average borrower would have to pay about $400 a month. Just figure that out. You're getting back on your feet from COVID. You may have had a loss of income. You may have missed some rent payments. You may have been able to have to put off other things, your credit rating. $400 a month is much too much right now for so many people. It's $400 a month that can't cover groceries or books or rent or supplies for kids as they go back to school. In short term, it's going to mean more people will struggle to recover from the pandemic. We've had enough struggling. In the long term, extending the pause and eventually canceling student loan debt would be a bold step towards economic opportunity for millions of Americans and for our whole economy. There's hardly a better way to give a shot in the arm to this economy than this. As I said, canceling student debt would also, a passion of the three of us, would deal with decades of economic injustice and racial inequality. Student debt falls disproportionately on black and brown borrowers, many of whom are first-time college graduates. Canceling up to $50,000 in their families. Canceling up to $50,000 in debt would close the racial wealth gap between black and white borrowers by 25%, between Latino and white borrowers by 27%. So with all this good, all President Biden has to do is flick his pen, sign it, make America a happier, better, more prosperous place. Senator Warren, Representative Presley, and I are going to keep fighting until this happens. I'm going to turn it over to Senator Warren, who's been a complete champion on this. And I reminded my colleagues here, this is my mask that I wear all the time, you know that. Cancel student debt. I wore fight anti-Asian violence. That passed. I wore save the restaurants. That passed. I wore save the stages. That passed. We hope to have the same karma today.
Well, thank you, Mr. Leader. It is a real privilege to be here with two such terrific partners in this fight. Tick-tock, tick-tock. Over 30 million Americans will have a bill coming due in about 2 months. The payment pause is running out on student loan debt payments. The size of these payments for many borrowers is the size of their rent, their car payments, groceries, child care. That's going to put a lot of people making hard choices. Do they pay the student loan debt, or do they keep up with their car payments? Do they pay the student loan debt, or do they keep up with their child care? Now, those are hard choices, and remember, the student loan debt system is set up to make our federal government a tough creditor. People will see their wages garnished, even Social Security checks get garnished. Penalties and fees that mount up mean that someone who has borrowed $10,000, if they start to fall behind, can suddenly discover they owe 12 or 15 or even more. The choice about what to pay will fall hardest on the most vulnerable among us. 40% of those with student loan debt do not have a diploma. The majority of black borrowers do not have a diploma. They are paying for college on a high school graduate's wages. Seniors, people who are unemployed, will also be put to hard choices. Pew recently did a study and determined that about 2/3 of borrowers are not ready for payments to resume, that they will find it difficult to manage their debts. These people live with a sword hanging over their heads, and every day that goes by, that sword draws a little closer. This is a matter of economic justice. It is a matter of racial justice. The President of the United States can remove this sword. The President can prevent this pain. The President can cancel $50,000 in student loan debt. He can wipe out all debt for about 36 million Americans, that's 85% of borrowers, and make life a whole lot easier for the remaining 15%. So we're here today to say, tick-tock, tick-tock, Mr. President. Millions of Americans ask you now to pick up a pen and cancel student loan debt, to pick up a pen and extend the payment pause, to pick up a pen and make their lives better. Thank you. And with that, I yield to my partner from Massachusetts, Congresswoman Presley. Ayanna?
Thank you. Indeed. Tick-tock, pick up the pen. Thank you, everyone, for joining us here today, and to my colleagues, Senate Majority Leader Schumer, Senator Warren, grateful for your close partnership as we work to deliver robust, long overdue relief to the millions of student loan borrowers across our country. As policymakers, we have a duty to do everything in our power to fundamentally improve the lives of the people we represent. Now, even before this pandemic hit, this was a $1.7 trillion student debt crisis, $1.7 trillion. That's a lot of people crushed and burdened, millions of borrowers across the country with student debt. People like the grandmother who is still paying off her student loans on a fixed income, like the new parent struggling to manage the skyrocketing costs of childcare, rent, and her student loan payments, or the teacher who fears losing his teaching license because he can't come up with that monthly student loan payment, not even the minimum. And the disproportionate impact of this student debt crisis has weighed heaviest on Black and brown borrowers in the Massachusetts 7th and across the country, who, due to generations of what I would characterize as precise, intentional, policy violence, have been forced to take on higher rates of student debt for just a chance, the same degree, as our white peers. President Biden has an opportunity and a responsibility to address the hurt and harm these communities are feeling by using his executive authority to cancel $50,000 in federal student loan debt. Doing so is one of the most effective ways he can provide sweeping relief to millions of families while helping to reduce the racial wealth gap and lay the groundwork for a truly just, equitable, and long-term recovery. This is a crisis created through policy decisions. We have a responsibility to address it head on. In this moment of ongoing crisis, our families need every bit of help they can get. We need to alleviate their hurt. In just over 2 months, student debt payments are scheduled to resume for millions of people across this country. Families who have already been struggling to make ends meet throughout this pandemic through no fault of their own because of a pandemic-induced recession. They will have an additional bill at their doorstep, many that are the equivalent of a mortgage payment. That's why last month we wrote to the president urging him to extend the pause on federal student loan payments through March of next year. Extending this critical payment pause will provide a crucial additional layer of protections for the millions of borrowers, disproportionately women and people of color, who currently face a disastrous financial cliff at the end of September. It doesn't have to be this way. Canceling student debt is sound economic policy that will allow the average borrower to put hundreds of dollars a month towards paying for rent, buying groceries, purchasing diapers, baby formula, and other essential goods. Earlier this month, we saw reports that officials at the Education Department support extending this payment. They support extending this payment pause, so we urge President Biden to act. with urgency. Failure to act would be unconscionable. It would undermine our economic recovery and only exacerbate the hurt and harm student borrowers are experiencing. But make no mistake, as we continue the work of building a just and equitable recovery from the current economic crisis, broad-based, across the board, and permanent, student debt cancellation must remain front and center. The people, including the broad and diverse coalition that elected President Biden, demand, deserve, and require nothing less. Let's get this done.
I want to thank both of my colleagues. We'll take questions on this subject. We're not taking other subjects. Go ahead, Du Bois.
And this is what we do here on Live Now from Fox. When a live event happens, we bring it to you right here. And right now we are at the Capitol, where House Democrats coming together to talk about U.S. military veterans discussing a new rule on pistol stabilizing braces proposed by the ATF. Let's listen right here on Live Now from Fox.
Into felons, actually. Republicans have introduced many ideas and solutions to deal with, to lower crime and to prevent gun violence. But this rule punishes law-abiding citizens and veterans. Today, our call to action is very simple. If you're listening to this out there and you care about this issue, go to hudson.house.gov and you can go link directly to the ATF and make a comment and tell them to withdraw this terrible rule. You've got until September 8th. But go today to hudson.house.gov. I want to thank our Whip Scalise, Ranking Member Bost, and these veterans who are standing behind me for joining us here today. Before we hear from our Whip, I want to introduce Rick Cicero. Rick is a former police officer and a retired Army paratrooper. In 2010, Rick and a K-9 were injured by an IED while in Afghanistan. The blast caused Rick to lose his right leg and did significant damage to his right arm. Since then, Rick has been a champion not only for our military and our veterans, but also for the Second Amendment. Rick is the gentleman for which the original brace was designed to help. And we look forward to hearing Rick tell his story here. Rick, thank you for being here. Thank you for your service to our country. Rick, please come forward.
Thank you, sir. Good afternoon, ladies and gentlemen. It's an absolute honor to be here today on the grounds of the Capitol. 10 years, 357 days ago, my life made a drastic change. Within that change, it was a development of new lifestyles, techniques, equipment, and technology. Within that technology was a fellow paratrooper named Alex Bosco, who created the original brace. That gave me the ability to get back out and shoot things that I never ever expected I would be able to again. Because prior to the amazing technology at Walter Reed that I have now, my prosthetic arm would fall off at the drop of a hat. This gave me so much more, and my life changed drastically. Within that, among my other talents, is I'm a senior firearms instructor. I took my skills that I had prior to my injury, I relearned to shoot again, and I am the guy who actually developed the techniques that the brace was designed to be used for. I wrote the lesson plans at Sig Sauer Academy, and for the last several years, I've been traveling the country teaching veterans how to shoot again. That brace is the foundation of everything I did around the country and continue to do today, because I can take someone who has limited strength in their hands or is missing digits and give them the confidence and the skills and the capability to grasp a firearm again and get them back to the things that brought them, that was so much part of their life as firearms in being a soldier. And that is a big piece of who we are today. This is just a fraction of where this can go. I can't tell you the life-changing aspects it has. One instance that I had that'll never ever leave me. I was teaching at Brooke Army Medical Center for the Center for the Intrepid in San Antonio, Texas. And I had a young man who had half of a finger, and that was all he had. And I took him out there with a braced firearm, and I took him on the range, and in about 30 minutes, I had him hitting a target consistently at 25 yards every single time with his one little digit. And it completely changed his perspective. No other tool in the world could do that. I'll leave you with a thought. There are things out there that are used sometimes properly, sometimes improperly. Everything has a learning curve. That brace is a wonderful piece of equipment. And yes, there are people that we can teach out there to use it better, but don't take it away because somebody doesn't understand it. Knowledge is power, and we're here to spread it. Thank you very much, and it's an honor.
Thank you. Thank you, Rick. I'd now like to introduce my good friend and a strong champion for the Second Amendment, our Republican whip, Steve Scalise from Louisiana. Steve.
Well, thank you, Richard, for your leadership, and Rick and all of the other veterans that are here before us. Thank you for your service to our country. We wouldn't be able to express our freedoms if you hadn't risked your life for ours. And the least we can do when you come back home is ensure that you can live life to the fullest. And so we understand the sacrifices you made, but it's perplexing. It is perplexing to see how the Biden administration is trying to take away the Second Amendment rights of our disabled veterans by trying to go after these pistol stabilizing devices that have been so proven to help veterans who are disabled in combat to be able to come and again enjoy life to the fullest, but also exercise their constitutional rights, in many cases who were injured fighting for our constitutional rights. Look, we know the Biden administration embraced the defund police movement. We see crime rising all throughout our country right now. And at that very time when you see more and more families going out and buying guns to defend themselves and their families, for the Biden administration to come and try to take away that right for disabled veterans to be able to use these stabilizing devices so that they could exercise their rights to protect their families is just mind-boggling. And so we're calling on the Biden administration to drop this ridiculous rule that they're trying to impose on veterans and all other Americans. And so in the meantime, between now and September 8th, every American citizen can go to the ATF's website, or is it hudson.house.gov, and link to that website to file your public complaint against this rule. I would urge every American who wants to stand with our disabled veterans and any other American who believes in the Second Amendment and the ability for every law-abiding citizen to exercise those rights to go online now and oppose this rule by the Biden administration. But more than anything, we call on the Biden administration to stop this attack on our veterans and just withdraw the rule. Shouldn't be there in the first place. Let's allow our veterans to exercise their Second Amendment rights since they risked so much in preserving our rights. Turn it back to Richard.
Thank you so much. Now I'd like to introduce Pablo Cadena. Pablo joined the Army in 1993 in San Diego, California. During a deployment to Iraq in 2008, Pablo was struck by an RPG, causing significant damage to his left leg. After retiring from the military, Pablo has since worked to support other veterans through our Second Amendment. Pablo, thank you for being here, and thank you for your service to our country.
Pablo, thank you. Yes, sir. Good afternoon. My name is Pablo. My name is First Sergeant Retired Pablo Cadena. I'm a 20-year-plus veteran of the United States Army. I've served in both Iraq and Afghanistan. On June 1st, 2008, while on a routine patrol in Afghanistan, my platoon was involved in a complex ambush. Due to the severity of my injuries, I was medically evacuated to Brooke Army Medical Center. At that time, if I had gone anywhere else in this world, I would have lost my leg. After retiring in 2014, I went through my own kind of depression. My wife saw this, and she voluntold me that I was going to go on a deer hunt with Hero Hunt. Since that time, I've been able to meet the founder and the president of the Hero Hunt. We've become really good friends. I really like the way that he ran the program, and as a result, I started volunteering my time in any way possible. In 2018, I became an ambassador for the Hero Hunt program. Since that time, I've been blessed and asked to become a board member. While working with Hero Hunt, I've been able to use a stabilizing brace, which allows me to be able to also instruct. Stabilizing brace has allowed me to instruct the other wounded veterans and first responders to participate in hunts by using similar braces, without which that due to their injuries they would not have been able to use with normal stock weapons. As a law-abiding citizen, I cannot understand how the legislation can overreach our forefathers' intent for the Second Amendment. If this overreach is allowed, it would make a majority of law-abiding veterans and first responders criminals overnight. These are the people that answered the call of our great nation. Up to the personal injury and sacrifice payable to this nation. We are the ones running into the firefights, into the fires, and into the domestic disputes. We have carried a variety of these weapons for our country and community almost daily for most of our adult lives. And now with this legislation, blanket mid-intent will essentially make us all criminals. It is a gross miscarriage of the intent of our founding fathers, in my opinion, and a gross miscarriage of lawmaking for political gain, without understanding, unforeseen, or secondary consequences in the effect of the law. It will curb the healthy possibilities of opportunities of those injured, protecting that very lawmaking body and system. I leave you with this one question. Does any of this make sense to you?
That's very powerful. Thank you, Pablo. I'd now like to introduce my good friend and another strong leader on the Second Amendment and a tireless advocate of our veterans, the ranking Republican on the Veterans Affairs Committee, Mike Bost of Illinois. Mike.
Thank you, Richard. And thank you, Pablo, and thank you to all of our veterans here and for your service in uniform and your advocacy here today. It's an honor to stand alongside of these veterans in defense of the Second Amendment. Veterans fought to defend our rights, freedoms, guaranteed by our great Constitution. Anything that would unduly strip veterans of those rights is flat wrong. That's why not only are we talking about this today, but I want to bring up, I introduced Veterans Second Amendment Protection Act. I want to prevent veterans from losing their rights to bear arms simply because a VA appoints someone to help manage a veteran's financial benefits. Let me say that again. When someone is assigned by the VA to have someone manage their financial benefits, they also, and that's also why I'm here to protest the Biden administration's action on this. The ATF proposal could hurt thousands of law-abiding gun owner veterans simply because they use a stabilizing brace. Disabled veterans have given their country enough. The last thing they should be subject to is absurd fines and government overreach. Veterans are no better than anyone, that the Constitution's rights are sacred. They're sacred to them as well. Yet time and time again, we see here in Washington bureaucrats trying to take those rights away. For long as I am the Republican leader in the VA, I will do everything I can in my power to stop this from happening. And with that, I thank them all for being here, and I thank you for the time today, and I hope that you will all join us in getting on the websites, giving your comments, and to explain how important it is not to turn on our veterans on this situation, and would encourage everyone to be involved with that. And thank you, and I yield back.
Thank you so much, Ranking Member Bost. I'd now like to introduce Anson Roberts. Anson was assigned to a weapons company at Camp Lejeune, North Carolina. During a deployment to Iraq in 2007, Anson was wounded when an IED exploded, causing significant damage to both his left and right hands. Since then, Anson has continued to be a leader and a role model for other veterans. Anson, thank you for being here today. Thank you for your service to our country. Please come forward.
Hello, my name is Anson Roberts, Lance Corporal retired from the United States Marine Corps. I served in Iraq in 2007 with Regimental Combat Team 6. I was deployed on an EOD team as a security member for them. So we were constantly dealing with IEDs and situations like that, obviously well known in the war on terror. I was severely wounded in action on April 13, 2007, where I was severely burned on 30% of my body with second, first, and third degree, and my left and right hands are clearly the brunt of that injury. So taking the SB brace away, or the stabilizing brace, is meant for this exact case, also like Richard and every other veteran out there, but not just veterans, because there's people that are born with all kinds of disabilities that have the same rights that we do, as the Second Amendment protects them, just like every other citizen. So with the ATF, I almost said AFT there for a second, specifically thousands of disabled Americans will be affected by this legislation. It's right, it's wrong for any rule to be taken away. SB, the stabilizing brace, helps individuals being able to shoot once again. It helped me, and it's helped thousands of other veterans, and I'm sure it's helped thousands of other disabled people in America shoot again. Who's some guy sitting in an office here in DC gonna tell me that I can't use the stabilizing brace to help me shoot, or any of these other veterans across the country, across the nation? This is the type of legislation or rules or kind of things that the ATF does on a consistent basis to the Second Amendment, and we're a strong community. Don't get that wrong. So we're a solid front in the community to fight the ATF with representatives like Mr. Scalise and everybody else here, helping push this law, or whatever you want to say. It's wrong, and it's taking away the self-defense right for me, for my family, or some other person in America that is disabled. I don't have the same strength in my hands or my arms or my legs anymore. Using this device helps me eventually, and God forbid, protect my family. And taking that right away could harm my family or somebody else, in the nation. It's ridiculous, and I believe that that this legislation should be thrown out, and the ATF should just go away. Thank you.
Powerful stuff. Thank you, Anson. Well, there you have it from the veterans who rely on these braces. They are the face of this issue, and they've traveled many, many miles to be here today. Rick Cicero, Pablo Cadena, Anson Roberts, as well as Wesley Pincence, Joe Towers, Jeff Spring, Larry Thompson, Carlos Angulo, KC Heyer, all standing behind me. They've all traveled a great distance to represent their fellow veterans. Now it's your turn. Visit hudson.house.gov so that you can make your comments known to the ATF. Go to the website today and tell the ATF to withdraw this terrible rule. Together we can make a difference. Together we can stand on behalf of our veterans and on behalf of the Second Amendment. Thank you. I'd be happy to take any questions. Yes, sir.
This one's for Scalise. I just wanted to ask, what were your takeaways from the testimony from officers, including one Iraq veteran at today's January 6th committee hearing?
Well, we've been clear that what happened on January 6th shouldn't have happened. And as you see, anybody who broke into the Capitol that day is being prosecuted to the full extent of the law. And I expressed my appreciation to the United States Capitol Police officers and all other officers who came to help keep the Capitol secure that day. What we've raised questions about is why were they not given more tools to prevent that from happening? And some of our members, including Jim Jordan, have been vocally raising that question, especially as it relates to what Speaker Pelosi knew. There are reports that she was given notice weeks before January 6th, but even on the day of January 6th, was giving a notice to call for the National Guard, to bring in the National Guard, and the reports say that she turned that down. She needs to answer those questions. And instead of answering those questions, she removed members who were going to ask those questions. And then ultimately they made the Speaker's office off limit. So how is this commission going to even get those answers as to why the Capitol Police weren't given the proper tools and backup that they needed to be more safe and secure that day.
Were you able to watch bits from the hearing today?
Well, I had another committee hearing that day. The Select Subcommittee on the Coronavirus had a hearing today. Unfortunately, Speaker Pelosi refuses to have the committees like the Select Subcommittee on Coronavirus have hearings into the origin of COVID or even these outbreaks that we're seeing. Look, on the border, she has a wide open border right now that President Biden has created. His border crisis on the southern border is bringing a lot of COVID cases into the United States. Our Border Patrol agents have told us many people coming across illegally, thousands a day. Many of them are COVID positive, and then they're being put on buses. They're not even being tested. They're being put on buses and planes and being spread throughout the United States. And especially with this new Lambda variant, which many say could be worse than the Delta variant, which is coming from Peru. It's widespread in Peru, and now we're starting to see that come into the United States through our open southern border. It's time for President Biden to protect the American people from these new variants by securing the southern border, just like when President Trump banned flights from China and banned flights from Europe to protect America during the initial outbreaks of COVID. And even Dr. Fauci testified that President Trump's actions save lives. By that same regard, President Biden needs to step up and protect Americans from these other variants coming across our southern border. Are there any questions related to this attempt by the ATF to take away the rights of our veterans to exercise their Second Amendment rights? We'd be happy to take any questions on that. Well, I appreciate that our veterans covered this so well, and Richard, obviously the work you're doing, and Mike Bost. We're going to continue to fight for the Second Amendment rights of our veterans and everybody else who's disabled who wants to exercise their Second Amendment rights. But in the meantime, we're going to continue to call on the Biden administration to withdraw this harmful, ridiculous attempt to limit Second Amendment rights for our nation's veterans who are disabled. Thank you.
Thank you. I haven't seen it, but I'll associate myself with the whip's comments. Thanks. Yeah.
All right, so what we've just been watching there, in front of the Capitol, that was an event with House Republicans, including Steve Scalise, holding this news conference with U.S. military veterans to discuss this new rule by ATF. And we want to explain some of the rule. It's on pistol stabilizing braces. It's been proposed by the Bureau of Alcohol, Firearms, Tobacco, and Explosives, and how the regulation jeopardizes the Second Amendment. And so we just wanted to show you that press conference. That was live today on this Tuesday. Thanks for being with us. I'm Andrew Kraft. We have a lot more stories left to get to, a lot of news happening on the coronavirus pandemic front. We'll be speaking with some reporters from across the country about new CDC guidance re-implementing some of these mask measures and mandates. And then we'll be going out to some other stories. As you know, the first hearing for the House Select Committee on the January 6th insurrection, getting to the bottom of how that happened and why that happened. We'll play some updates and some highlights from that hearing earlier today on Capitol Hill as well. So right now, we're just going to go to a quick 2-minute commercial break. We'll see you back here in 2 minutes. All right, so we are just monitoring this shot here. Looks like our reporter is in the frame there from Fox 6 in Milwaukee, but we are told that soon authorities will be holding a press conference to update on this house explosion that happened a little earlier today in Jefferson County, Wisconsin, near the city of Rome. And so earlier, the energy utility was responding to this explosion. Apparently, the cause is not yet known, but we are hoping to get an update there. We'll also be hoping to speak with our reporter there on the scene. That's Fox 6's Jason Calvi, who is live on the scene for us there. In the meantime, we do want to just move on to some of these other events that we want to show you that we have not gotten to yet. Earlier today, Vice President Harris held a virtual hearing earlier today, but we didn't get to show you any of that. So we're going to show you those remarks, and then hopefully we'll get an update on this house explosion in Wisconsin. Terrible story.
Rights of citizenship and the ability to exercise those rights, about who has a voice in what happens to them, to their families, and to our country. So simply put, the right to vote is the right that unlocks all other rights. And let's take a moment to think about last year, about 2020. Voters said they want jobs. They called for jobs. They voted. And now more than 3 million jobs have been created. Voters called for relief. They voted. And now HBCUs received $2.6 billion, and families are getting monthly child tax credit payments. Voters, well, they called for a national vaccination plan. They voted, and now more than 160 million Americans have been vaccinated. But I'll say, and I said this to Madam President, as an aside, and I say this to all of the members, the NBA leaders, if you know somebody who has not yet been vaccinated, please remind them the vast majority of people who are in the hospital now, and almost everyone who has recently died from COVID, are unvaccinated. This is no joke. Now back to the voters, which include a lot of folks. Voters in 2020 also called for more diversity and representation in our judicial system. They demanded it, as did the NBA. And they voted, and now we have confirmed as an administration more black women to be circuit court judges in just 6 months than any other administration in all of history. All that to say, the vote matters. But in the year 2021, 18 state legislatures so far have enacted 30 new laws that will make it more difficult to vote. And I believe they want to make it more difficult so that folks don't vote. Because just think about it. In the last election, voters were able to cast their ballots weeks before Election Day so they could make a plan to vote. With all of the burdens and the demands of life, they could make a plan to go and vote. They didn't have to just go on Election Day. Voters in the last election were able to cast their ballots by mail. Voters were able to drop their ballots in drop boxes. But now, state legislatures are trying to limit these options, reducing the number of days in early voting, reducing the number of drop boxes that are available, making it more difficult for people to stand in line to receive food and water. But here's the thing. Not everyone can stand in line for hours to vote on Election Day. We all know that. Nor should they have to. Americans need options to be able to cast their ballot, which is their right. And remember, this fight isn't only about who gets to vote or how. This is also about who gets to count the vote. Let's not lose sight of what's going on out there. Because some of these state legislatures are also trying to shift authorities from trusted local election officials to partisan political actors. So we must fight back against all of these efforts. We must fight to pass the For the People Act, which would create national voting standards, get dark money out of politics, and create fair representation by ending extreme partisan redistricting. We must fight to pass the John Lewis Voting Rights Advancement Act, which would prevent discriminatory laws and changes in voting laws that would discriminate. We must fight, NBA, we must fight on many fronts, including our Department of Justice, which under the leadership of Associate Attorney General Vanita Gupta and Assistant Attorney General Kristen Clark, has said it will change anti-voter and challenge, and by challenging, hopefully change, anti-voter laws. Civil rights organizations are similarly contesting anti-voter laws in the courts. And lawyers, including many of you, are starting to plan now to mount massive voter protection programs for next year's election. And let us pause for a moment to reflect and praise the incredible leadership of the National Bar Association, always and most recently in 2020, because it was the NBA and its members that were answering calls on the hotline, responding to litigation needs, monitoring the polls, and it made a difference. And so as we move forward, it's going to take all of us to ensure that all Americans can vote and have their vote counted in a fair and transparent process. So, you know, I mentioned earlier that the National Bar Association has helped to shape history on so many levels, and especially this. And indeed it has. And that is because time and again, members of this organization have risen to the moment. When Black lawyers were barred from joining other legal associations, the founders created this one. When people of color and poor people could not afford counsel, this organization set up free legal clinics and offered pro bono services. When segregation kept people of color, kept Black people from being able to determine their future, it was lawyers among this membership who were among the leaders who argued against it. And today, as the right to vote is yet again under attack, I know that the members of the National Bar Association will rise once again to the moment, because we believe and we know our democracy is stronger when everyone can participate, and it is weaker when anyone is left out. So thank you all for your ongoing commitment, for your excellence, for your work. Thank you, and may God bless you, and may God bless America. I'll see you soon.
Thank you. Thank you, Madam Vice President. Thank you so much. Well, ladies and gentlemen.
All right, so there we were just listening to the Vice President from earlier today get on a virtual call with members of the National Bar Association, talking about an issue that President Biden has tasked her with handling, and that is voting rights in the country. And so you heard her speak at length about the precious right to vote and how she thinks many of these Republican state-controlled legislatures are infringing on that and suppressing it, in the words of many people in the Biden administration, including the Vice President and the President. Just want to give you update on what we are watching at this hour. Let's go out to Rome, Wisconsin, and right now we're just awaiting a press conference on a house explosion that happened there earlier today. We're going to speak with a reporter on the ground there in a couple of hours as well, but we're told that the police are going to be updating the public very, very soon here, so we're going to be monitoring that. We're also going to go across the country now to Los Angeles because we're following this story yet again. This is in Los Angeles outside the courthouse there where we are monitoring that a verdict will be coming down soon in the case of Ed Buck. Now, that name might not sound familiar to some of you, but we'll be hearing from survivors and family members of the victims in this case. This is Ed Buck's federal trial. You may remember that Ed Buck is a former high-powered Democratic Party political donor. This case involved the distribution of controlled substances, including methamphetamine, resulting in the deaths of 2 men at Ed Buck's apartment. And so we're told the verdict is expected to be read shortly in court, and then attorneys and family members of the men who died are expected to speak after the verdict is announced. Buck was on trial in Los Angeles on 9 felony counts. And so there you can see a podium has been set up. And so these happened back in 2017 and 2019. The deaths of Jamel Moore and Timothy Dean. If convicted, Buck faces 2 charges and they carry a 20-year mandatory minimum. And so right now, we're going to be learning very soon that the verdict was handed down, and we will get an update on exactly what this jury has decided. Prosecutors say Buck exploited vulnerable, primarily black men, by paying them to come to his home to use drugs and pay them for sex. And so you see that podium set up there. And so we are waiting to see if family members of the victims and their attorneys will come to the podium. Let's take it back, though, to Washington, D.C. It's been a really busy day on Capitol Hill. As you know, today was the first hearing from the House Select Committee on the January 6th insurrection. We are going to play some of the highlights of that a little bit later today. We aired it in its entirety when it was happening live. It was 3.5 hours. It was very compelling, emotional testimony from several of the Capitol police officers who fought and defended the Capitol on that day from those rioters. So we'll show you a little bit of that later on in the stream tonight. What we want to do now, though, is go out to House Minority Leader Kevin McCarthy. He spoke as well in light of all this. You'll remember the drama that unfolded last week where he picked 5 members from his caucus who he wanted to sit on the hearing. Speaker Pelosi rejected 2 of them. House Minority Leader McCarthy pulled all 5. So let's just hear his reaction to the testimony from earlier today.
I first want to start by expressing my condolences to Deputy Philip Campus, an officer who was selfishly serving his community in Kern County, who was killed in the line of duty on Sunday. He is a father, a husband, a Kern County Sheriff officer, and a former Marine. 3 others were shot in the standoff as well. Our prayers are with his family and those who are wounded as they continue to break through this. Each of us are indebted to our brave Capitol police officers who come every day to this house prepared to defend us. On January 6th, these brave officers were put into a vulnerable and impossible position because of the leadership at the top has failed. December 14th, the leadership knew there was a problem. Even prior to that, Inspector General report told us there was failed leadership at the top of the police for the training. Rodney Davis will speak in a moment of a bill that he had to make sure the structure of the Capitol Police would change. We had many failures within the leadership. You had a chair of House administration with responsibility that did not come to the Capitol for more than 6 months. First time showing back up on January 3rd to vote for the Speaker. No hearings about the IG report. No movement of Rodney Davis's bill. There's questions into the leadership within the structure of the Speaker's office, where they denied the ability to bring the National Guard here. We now have a committee that all of America wants to know the answers to. Why were we ill prepared for that day, and how can we make sure that it will never happen again? But unfortunately, Speaker Pelosi will only pick on people onto the committee that will ask the questions she wants asked. That becomes a failed committee and a failed report, a sham that no one can believe. If you want the true answers, do not be afraid of the questions that will get asked. And drive the evidence to wherever it comes forward. We owe it to the officers, we owe it to the nation, to have an open and fair debate with all questions being asked. Again, the Republicans want to participate with the Republicans that are able to be on the committee, that have jurisdiction, have the knowledge, and the ability to ask the tough questions that can get the right answers. It's unfortunate we start with a committee chair who will tell you everything's on the table except the Speaker's office. How can you ever get to the bottom of the questions? How can you ever get to the solutions to make sure the Capitol is never put in this position again? From December 14th, they knew. The last time there was a break in the line was during the Kavanaugh hearings. Why weren't changes made then? Why weren't action taken after the IG report? It's a lot of questions that could get asked today to make sure these officers will never be put in this position. January 6th should have never happened. We should have prepared and be prepared for the officers, make sure they had the training and the equipment that they needed. With that, I'd like to call up our whip, Steve Scalise.
Thank you, Kevin, and I share those same sentiments. Our prayers go out to so many law enforcement officers who lost their lives in the last year. And every day, we thank those Capitol Police officers who risk their lives to keep us safe and to keep this Capitol hopefully open again to tourists who can come to the Capitol to see their government in action. But what we're here to talk about today is Speaker Pelosi's constant attempt to cover up facts that she doesn't want out there. You know, for weeks now, Jim Jordan and Jim Banks have been raising some very tough questions that need to be answered about why Speaker Pelosi didn't make sure that Capitol Police had all the tools they needed to be prepared for that day. Now, maybe because they were raising those questions, they got canceled by this new cancel culture that we see moving throughout the country, led by Speaker Pelosi and a lot of our socialist allies here in Congress, where they want to shut out voices that raise tough questions that they don't want to be asked or answered. And yet, they were starting to raise those questions about why the Capitol Police didn't have the tools they needed. What kind of intelligence did Speaker Pelosi get early off, weeks in advance, as Leader McCarthy talked about, that gave telltale signals that could have prevented what happened on January 6th? But Speaker Pelosi said that she doesn't want those questions asked, so she kicked them off the committee. She took an unprecedented step of refusing to allow members to be appointed by the minority leader to a select committee. Had never before happened in the history of Congress. And so as we see these kind of actions taken by Speaker Pelosi to cover up the facts that she doesn't want out there, it has completely debased the legitimacy of this commission, because clearly they're not searching for the truth. They're searching to get a narrative out that Speaker Pelosi has already written. And anybody that's going to ask questions that go against that, she just has them removed so that they can't bring those questions up. That's not an investigative panel. People know that. We've seen other bodies. The Senate's done some investigative work. The Department of Justice has done some investigative work. And it should be about following the facts, not about trying to cover up facts that tell a story differently than the one she maybe has already had written, and she just wants to now get others to back it up. So it's unfortunate that she's done it, because clearly it can't be about people who voted against certifying electors, because she appointed members herself who voted against certifying electors on January 6th, against them on January 6th of 2005, some of her own members who objected on January 6th of 2017. So clearly that's not what it's about. It's probably more about some of the tough questions that were already being raised by Jim Jordan and Jim Banks. And that's a shame, because those questions need to be asked and answered as well. And now they're not, because of the cover-up that Speaker Pelosi's continued to do. We see this with COVID. She won't hold a hearing on the origins of COVID. Too often we've seen this pattern by Speaker Pelosi of trying to cover up a narrative that she doesn't want out there, when we should be trying to get all of the facts. Now to come up next is our conference chair, Elise Stefanik.
There is a reason that Nancy Pelosi is the most disliked elected official in America. She always puts her own partisan politics over what's best for the American people. She's an authoritarian who has broken the people's house. She is a lame duck speaker, and everyone knows it. The reason why Nancy Pelosi is refusing to seat accomplished and well-respected hardworking Republicans like Jim Jordan and Jim Banks is because she doesn't want the American people to know the truth or learn the facts. She doesn't want a fair or bipartisan investigation. She wants a political one. It is a fact that in December of 2020, Nancy Pelosi was made aware of potential security threats to the Capitol, and she failed to act. It is a fact that the U.S. Capitol Police raised concerns, and rather than providing them with the support and resources they needed and they deserved, she prioritized her partisan political optics over their safety. The American people deserve to know the truth that Nancy Pelosi bears responsibility as Speaker of the House for the tragedy that occurred on January 6th. And it was only after Republicans started asking these important questions that she refused to seat them. House Republicans will continue to follow the truth and the facts and support our law enforcement officers to make sure this never happens again in the U.S. Capitol, the People's House. And I'm proud to turn it over to my colleague, very well-respected member, Jim Banks.
Today we will hear tragic stories by Capitol Police officers, tragic events that should have never happened at this Capitol building on January 6th. Tragic events that happened on Speaker Nancy Pelosi's watch. It's clear at this point that Nancy Pelosi has cherry-picked the members to serve on this committee. She's pre-written a narrative. Only members who will stick to her talking points are allowed to serve on this committee. If this is truly a fact-finding mission to make sure that January 6th never happens again, this isn't what that looks like. Today, I want to repeat a call that I made last week to the chairman of this committee to bring before this committee today on this panel the head of the Capitol Police Union, who told many of us last week and has said publicly and privately that on January 6th, the rank and file members of the Capitol Police Department, the heroes that make up the men and women, the heroes that make up the Capitol Police Department, they were not prepared for what happened on January 6th in spite of intelligence reports that date back 3 weeks before that day. They weren't equipped on January 6th with the proper equipment that they needed to handle what happened that day. And they weren't trained for what was going to happen that day. As the Senate investigation report, a bipartisan report, already identified, there was a systemic breakdown of security, a lack of leadership at the very top of the United States Capitol Police who report and who Nancy Pelosi is ultimately responsible for that lack of leadership. That's where this committee should go if it's serious about making sure that something like this never happens again. Bring the head of the United States Capitol Police Union to sit on the panel today to provide a different perspective than the cherry-picked narrative that Nancy Pelosi wants the American people to hear. I repeat that call. I hope that the Democrats
And welcome back to Live Now from Fox. You're just taking a live look at the U.S. Capitol building at this hour, almost 6 p.m. there on the East Coast. We're going to be going out again to House Republicans who were right outside that building earlier today, responding to the first hearing from the House Select Committee on January 6th, looking into the insurrection from that day. And so we've been hearing from a number of House Republicans. Let's go back to that event, and I believe...
And everyone knows it. The reason why Nancy Pelosi is refusing to seat accomplished and well-respected hardworking Republicans like Jim Jordan and Jim Banks is because she doesn't want the American people to know the truth or learn the facts. She doesn't want a fair or bipartisan investigation. She wants a political one. It is a fact that in December of 2020, Nancy Pelosi was made aware of potential security threats to the Capitol, and she failed to act. It is a fact that the U.S. Capitol Police raised concerns, and rather than providing them with the support and resources they needed and they deserved, she prioritized her partisan political optics over their safety. The American people deserve to know the truth that Nancy Pelosi bears responsibility as Speaker of the House for the tragedy that occurred on January 6th. And it was only after Republicans started asking these important questions that she refused to seat them. House Republicans will continue to follow the truth and the facts and support our law enforcement officers to make sure this never happens again in the U.S. Capitol, the People's House. And I'm proud to turn it over to my colleague, very well-respected member, Jim Banks.
Today we will hear tragic stories by Capitol police officers, tragic events that should have never happened at this Capitol building on January 6th. Tragic events that happened on Speaker Nancy Pelosi's watch. It's clear at this point that Nancy Pelosi has cherry-picked the members to serve on this committee. She's pre-written a narrative. Only members who will stick to her talking points are allowed to serve on this committee. If this is truly a fact-finding mission to make sure that January 6th never happens again, this isn't what that looks like. Today, I want to repeat a call that I made last week to the chairman of this committee to bring before this committee today on this panel the head of the Capitol Police Union, who told many of us last week and has said publicly and privately that on January 6th, the rank and file members of the Capitol Police Department, the heroes that make up the men and women, the heroes that make up the Capitol Police Department, they were not prepared for what happened on January 6th in spite of intelligence reports that date back 3 weeks before that day. They weren't equipped on January 6th with the proper equipment that they needed to handle what happened that day, and they weren't trained.
All right, so we're just going to step away from this event for now. We're going to come back to it, but we're going to have to get to some of these other stories still on this Tuesday afternoon. Thanks for being with us. As you know, a lot has been happening with new CDC guidance, especially in schools. And so cities are trying to respond around the country, especially with the school year a couple of weeks away. To join us right now, live from Minneapolis, is Fox 9's Rob Olson. Rob, so good to see you. How is Minneapolis responding to the new CDC guidance about, K through 12 school children have to mask up again?
Yeah, and the school year here begins after Labor Day. That's always how it started for years. It's always the day after Labor Day, so a little bit more time to prepare here for kids going back to school. Well, I talked to the Minnesota Department of Education today about, okay, the CDC guidance is out that all kids K through 12 should be wearing masks regardless of vaccination status. That's the guidance. The Department of Health here said now they are working, they're waiting for the Minnesota Department of Health. Their schools team works with the CDC, and then they issue their guidance to the Minnesota Department of Education. The Minnesota Department of Education then tells me in the next several days or so that they will have guidance going out to districts across the state, and they don't expect there to be any sort of requirements, but recommendations. And they've always sort of followed the guidance that follows from above them. So you can expect that this CDC guidance will go down to the Department of Health and the Department of Education, who will tell districts the same thing, that they will recommend masks K through 12. They anticipate these are not requirements. There'll be recommendations. So again, we have to wait to see how this plays out and how districts will respond to this. Now, I did talk to, a number of parents of elementary age students under age 12. You can't get vaccinated. So those students, and I talked to a teacher too as well today, saying that they just fully expected that kids at that age would probably just be wearing masks anyway. One parent said, I'm just going to send my kids, regardless, I was going to send them to school with masks to wear, because it's the prudent thing to do considering vaccinations are not yet open to the elementary age level.
And Rob, you're standing out there in front of that school. Have you heard from administrators, maybe at that particular institution, are they unhappy with this, or did they kind of see this, coming their way with these rising number of cases with the Delta variant? Did they expect this, or were they thrown off guard?
Well, I talked to a couple of different districts today, just their communications folks saying, what do you expect to do? What's your reaction to this CDC guidance? And they're just in that holding pattern. They said, well, we're waiting for guidance from the state. And so when we get it, then we'll figure out what to do. So, they're not really taking a stand on this one way or another. But again, sort of the broad reaction that I got today is, well, this isn't surprising. Again, younger ages, we figured we'd probably wear masks anyway, that would be the recommendation. But with the Delta variant and some of the other variants that are going around and seeing rising case numbers, primarily among the unvaccinated, but that were the CDC saying that even vaccinated, there's those breakthrough infections as well. Parents I talk to certainly say, well, it's not surprising. We need to do what we need to do to try to get this trend going the other way, because here we are late July, and for all intents and purposes, it really felt like this virus was in the rearview mirror. The pandemic was in the rearview mirror. Things look normal again. We haven't been wearing masks indoors. We're seeing crowds gather again. But with rising numbers, the reaction I got from parents and a teacher saying, this isn't surprising. Again, the districts themselves taking a very neutral view on this, is saying we're waiting to find out what the state tells us their recommendations will be, and then we'll figure out how to communicate that to parents, how to manifest that in the classroom. But again, here in Minnesota, with the school year starting in September, they've got a little time to play with.
All right, we'll leave it at that. Fox 9's Rob Olson kind of giving us a view of how major cities around the country are adapting to this announcement in the last couple of days. Rob, thanks so much. Good to see you.
You bet. Thanks.
All right, we want to move on to some of these other stories we have yet to get to. And like I mentioned earlier, we do have some breaking news that we want to bring to you, because that jury in Los Angeles convicted former political donor Ed Buck today in connection with the drug overdose deaths of 2 men at his West Hollywood home. And happening right now, we're going to show you from the very beginning our family members of those victims and their attorneys celebrating this win for them today, in which a jury found Ed Buck guilty. The verdict came on this first day of jury deliberations in the case. He was charged with 9 felony counts, 2 counts of distribution of a controlled substance resulting in death. The charges, again, stem from the deaths of Jamel Moore back in July 2017 and Timothy Dean back in January 2019 at Buck's West Hollywood apartment. Here's some of this testimony from earlier today.
Almost overdosed, and he's the reason why we're here today. Because he didn't die, and he came forward, and he stepped forward, and somebody other than us believed him. This is Miss Letitia Nixon, and put a capital T on that name. And she's Jamel Moore. So in any order you guys want to speak? I'll just go. I should say, I'm just over the moon excited for victory for my brother, Timothy Dean. We loved him so much, and also I'm excited for victory for Jamel Moore and his mom. And Ed Buck, I'm so happy that he will never see the light of day again. That this trial was overwhelming. It was grueling. This man did some terrible things to human beings, and I'm just glad that they found him guilty. Thank you, all of you. What was your name? Joanne Campbell. Thank you. I'll give you all the stuff. I just want to make sure. Hi, everybody. My name is Joyce. My last name is Jackson. Timothy Dean. Charges. Finally, Ed Buck will never harm anyone else, and I thank God for that. And as I leave LA, going back home, I thank everybody that has helped keep us strong throughout the 3 weeks that we've been here. LA is a beautiful place. It's just a bad timing that we had to come. But I thank God that we're leaving knowing that Tim did not die in vain, Jamel did not die in vain. And I just thank God for all of you. And I just continue to pray and pray for our family, because this right now is a time for me to begin healing. But healing will really begin to close once he sent us. Thank you. That's right.
Hello, my name is Letitia Nixon. I'm Jamel Moore's mom. I want to say thank you to everybody that believed us. Thank you to everybody that reported correctly on my son, because my son was more than an escort, more than a prostitute, as many of you guys said. It's more than a movie or a documentary. This is my baby, my son, who is a human being and is loved by lots of people. But today is bittersweet. Today is the day that my son was murdered when he left my house 4 years ago. But we got victory today. We got victory in the West today. So I'm grateful and I'm happy. And thank you guys.
Hi, I'm Dane Brown. I'm the person who was able to walk out of that bus house and be able to tell my story. I want to say thank you to the officers, Paul Caldera and the ADA and everyone who listened to me and believed me, because I didn't think I was going to be believed. Walking out of that house, I didn't know what was going to happen next, and I didn't know all this was going to happen, but I'm so happy and I'm so relieved that these families can get the justice that they deserve, because they're the ones who suffered pain more than I did. I made it out alive, but they're suffering because they had to lose someone in order for this to happen. Don't forget about it. I'm not a sex worker. I may have been an addict, but these people need to be heard, and these people need to be helped, and listen to them when they have a story. Believe them when they need help, because without them, their family's going to miss them, and it's just going to be a sad day. Thank you, everyone.
And right quick, we had a whole team of folks that worked for 4 years to get to this day. Jerome Kitchen, West Hollywood Mayor, Lindsay Horvath, Sammy, Corey, I mean, all of Jamel's friends, Mark, our attorney, Yana, she's back on the phone, and Marcus and Hussein. So I just want to make it clear that this was really a community and a team effort that lasted 4 years. And I can't wait to make a victim impact statement at sentencing to let him know just how much he is hated. Does anybody else want to speak? Let them know who you are.
I'm Samuel Lloyd. Jamel was my closest friend. This case is a representation of how much this city has neglected its community in a whole. This should have never happened. It would have never happened to Timothy Dean. We were protesting in front of Ed Buck's home for weeks and numerous times before Timothy Dean died. We could have saved him. We could have saved so many people, but nobody cared. It's like the cameras show up here when it's like, oh yeah, now he's going to jail. But what happened for all the other people that aren't here? And for the people that we could have saved? Like, we got, as a community, we have to start standing up before it gets to this point, because we lost everything. We have people here that have lost, so much, and people that were neglected by our own community in West Hollywood, where that's our community. We should have been safe there. And we had a serial killer on the streets for years. For years.
I also want to just say one more thing. There's someone who died that was not a part of this case, but would have been a part of this case had he lived. He died from complications of AIDS. His name was Star. And he was one of Ed Buck's victims. And this day is as much for him as it is for Jamel and Timothy. I know if Star had been alive, Star would have testified. Yeah. Star would have been right. Star would have showed up. Yeah. And so I just want to make sure we lift up Star as well.
All right. I think it's just important that the hunting of black men stop. The hunting of black men for our body parts and treating us like elephants, searching for our tusks and killing us for the process of getting our tusks has to stop. We are not creating the need and the desire for our body parts. Someone else is. Fortunately, someone finally went to jail for the need of our body parts. But it has to stop. The media creating this need for our body parts has to stop. The hunting of black men for some thrill has to stop. You all are creating it. You all are. So it's your responsibility to try to turn the light down on us so that they're not continuing to hunt for us for some exotic desire of us black men. We're not creating this desire for us. You all are. And this case is a result of them desiring us for our body parts. More of this is ongoing. This is just one example of it.
All right, so we just wanted to show you some of that. That was live today, just moments ago in Los Angeles, where the former political donor, Ed Buck, convicted today in connection with the drug overdose deaths of 2 men at his West Hollywood apartment, one in 2017 and one in 2019. And so this verdict came down on the first day of jury deliberations in this case. Now, Buck reportedly has given more than $500,000 to mostly Democratic politicians and causes since 2000. He was found guilty on all 9 counts today. There you heard from family members of some of those victims speaking after the verdict was announced. And they thanked everyone there who helped to make this happen. They were very jubilant today about this decision that jury handed down. Anyway, we do want to move into some of the other coronavirus stories. We just brought you that one from Minneapolis, where school districts around the country are trying to have to contend with this new CDC guidance about mask wearing for students with the school year upon us. But right now, the question, as the pandemic is surging nationwide and in some states, people that are fully vaccinated are still testing positive for COVID. That's called a breakthrough case. Fox's Jayla Whitfield is live for us in Nashville, Tennessee, where more than a dozen vaccinated people have died. Now, Jayla, this is puzzling to many people, these breakthrough cases. How rare are they?
You know, health officials are telling me they're super rare, but that doesn't change the fact that 27 people in Tennessee have died and they were fully vaccinated. According to the state health department, there were 1,000 breakthrough cases since May 1st, and of those, nearly 200 people were hospitalized. Health officials are saying that this should not discourage people from getting vaccinated. They should still get vaccinated because it could save their life. But of course, it's causing some conversation. The chair of the Nashville Coronavirus Task Force says breakthrough cases happen, but they are rare. Over 2.6 million residents in Tennessee have been vaccinated, and Nashville has a vaccination rate of over 50%. But over the last few weeks, they have seen an increase in cases, and hospitalizations have tripled. Public health officials say the numbers are concerning because it can be prevented.
It's concerning me that these numbers are rising is because this is completely avoidable. You know, vaccinations have kept our numbers at a really good number. Now with the Delta variant, obviously we're starting to see people who are not vaccinated get sick. You know, over 99% of our people who are in our hospitals right now in Tennessee are unvaccinated. Over 99% of people who have died from this disease over the past month or so are unvaccinated. It's concerning me that these numbers are...
And the Tennessee Department of Health says 25% of the breakthrough cases were asymptomatic and 50% of them were in people 60 and older. Health officials say if people don't get vaccinated, the coronavirus crisis could continue as this Delta variant spread. And public health officials in Tennessee are warning residents that the Delta variant is here and it's spreading rapidly. I'll send it back to you.
Jayla, yeah, thanks so much for that update. I think that has been quite a concern, especially amongst the vaccinated and the unvaccinated at this point, as these breakthrough cases, like you mentioned, rare, albeit they do happen. Did you talk to anyone as well for your story that, was vaccinated and they did test positive? Have you spoken to anyone with that?
No, I haven't spoken to anyone one-on-one in that scenario because it is so rare, but the fact that it's happening is something that is scary and it's causing a lot of conversation here amongst residents that are vaccinated, that are, they're feeling well, but the fact that you can still, get the Delta variant and pass it on to someone else while vaccinated is a scary thing to think of.
All right, Fox's Jayla Whitfield live for us in Tennessee, not Atlanta, for this story. We appreciate you. We'll see you again.
Thank you.
All right, really interesting there. We'll be showing you a lot of COVID-19 updates as the Delta cases do rise from across the country. New CDC guidance, not only about people who are vaccinated having to put their masks back on, but also some of those teenagers going back to school this fall as well will have to wear masks too. When we come back, we'll get an update from Wisconsin on that house explosion there. We'll also get an update from Houston very, very soon about the reaction in Simone Biles' hometown about her withdrawing from the team gymnastics competition. So all that and more in 2 minutes here on Live Now. All right, we are still monitoring these live pictures. I know they are a little, not the best signal, not the best quality at the moment, but that is live in Wisconsin after this house explosion earlier today. We just heard from officials there on the ground, and so want to bring you that update right now to see if we can glean any more details about exactly how this might have happened earlier this afternoon. So here's that update.
Investigation. The officers that are trained in how to handle these type of investigations go through a lot of training. Their experience in dealing with this just doesn't come from basic police recruit training. They go through extensive training to become familiar on how to process the evidence that they see. You know, I have a lot of faith in these men and women that have shown up today through DCI. To conduct a very thorough and extensive investigation to be able to let the family involved and everybody else know. You know, the one thing that I want to end by saying in this this news briefing is Jefferson County Sheriff's Office, as well as all of the fire and EMS first responders, we want to give our condolences to the family that is involved here tonight, and to the individual that was lost, that lost their life in this explosion. This is a very small community. It's tight-knit, and this is going to have a great impact on the loss of this loved one.
So this is about halfway through that press conference. Let's go out to the very beginning again as officials are updating on this Wisconsin home explosion.
Press release regarding a home explosion that was called in today at 1:48 p.m. to the Jefferson County Sheriff's Office. The explosion occurred at N3907 West Water Street in the town of Rome. Units responding to the incident were fire and EMS from the following agencies: Johnson Creek Fire and EMS, Waterloo, Ixonia, Western Lakes Fire and EMS, Fort Atkinson, Whitewater, Sullivan, Rome, Palmyra, Jefferson, and Lake Country Fire and EMS. After arriving on scene, units found that the home involved in the explosion had been basically leveled. The property was smoldering. At this time, it was unknown if there were anybody inside of the home. Units continued to conduct firefighting techniques on putting out the fire. After working on the fire, We Energies was also called to the scene, and We Energies eventually did disconnect gas to the residents. They disconnected gas as well as electricity to several of the area homes within the surrounding area. Once both electricity and gas was disconnected to the residents, the involved agencies that were here fighting the fire continued to distinguish the fire. After the fire was distinguished, they started conducting an area search of the remains that were left, and at this time we have one fatality to report. Unfortunately, no further information can be given at this time, pending notification of the family as well as the ongoing investigation itself. Deputies have been able to conduct a canvass of the area, to conduct a safety and security sweep of the neighborhood. There were no further injuries to report. We do have information that the individual that was located at the residence was home by themselves, and that that person was the only person located within the residence. A canvass of the area showed that there were no other injuries to anybody else located within the neighborhood. There is signs of other property damage with other homes, including structural damage in the form of broken windows, outside damage to some of the structures, to their siding because of debris that had been carried throughout the area to adjacent properties. Some of the roads adjacent to the property have been closed because of the debris field affected the roads adjacent. Right now, the Sheriff's Office has requested the assistance from the State Fire Marshal's Office and the Department of Criminal Investigations. They are now on scene. They are conducting their investigation to gather information on what may have caused the fire. The individuals that conducted a previous press media interview with me concluded that based on information that they've seen from past fires of this nature, that it did appear that this fire, strong indicators show that this was probably a fire caused by a natural gas leak of sorts. So at this point, being a law enforcement officer, I probably can't answer a lot of questions regarding the details of the fire itself. All I can say is that the U.S., not the U.S., but the state fire marshals are on scene. Their personnel are trained in going through the debris field, examining the evidence that is part of that debris field, and processing it accordingly to determine what actually occurred and what are the causes of the fire itself and the explosion.
Can you give us an idea of how wide ranging or radius the debris field is?
So this property was literally located on almost a city block. The home was centralized, what would almost be like the equivalent of a city block. So the debris field encompassed their entire property, the city block itself, And then the debris field, when the explosion occurred, the debris field took itself across both the adjacent streets into people's other properties, and to one direction. I mean, it literally has gone into other people's homes, up into the trees, on people's roofs. It's located extensively.
How tricky of an investigation is this for you guys to work through something like this?
Well, I don't personally have a background in arson investigation. The officers that are trained in how to handle these type of investigations go through a lot of training. Their experience in dealing with this just doesn't come from basic police recruit training. They go through extensive training to become familiar on how to process the evidence that they see. I have a lot of faith in these men and women that have shown up today through DCI to conduct a very thorough and extensive investigation to be able to let the family involved and everybody else know. The one thing that I want to end by saying in this news briefing is Jefferson County Sheriff's Office, as well as all of the fire and EMS first responders, we want to give our condolences to the family that is involved here tonight, and to the individual that was lost, that lost their life in this explosion. This is a very small community. It's tight-knit, and this is going to have a great impact on the loss of this loved one. So we want to extend our condolences and our sympathy to them and this entire community for the loss.
All right.
All right, thank you.
Thank you.
Guys, I'm done. I've done like 4 or 5 of these, man. I gotta tie it up.
Okay, so there you have it. Jefferson County officials on the ground there saying that a resident has died as a result of this home explosion, citing that it possibly could have been a natural gas explosion there that could have been the root cause. We'll be getting more live updates within the hour here on Live Now from Fox, but we want to move into another story that we have been tracking all day today. Reigning Olympic gymnastics champion Simone Biles is out of the team finals with what USA Gymnastics described as a medical issue, the circumstances sparking national conversation about the mental health of professional athletes in general. Fox 26's Maria Salazar actually spoke with some of those local gymnasts out in Houston, the hometown of Simone Biles. Maria, what they have to say?
Hi, Daytona. Well, they kind of see this moment as sort of part of the bigger change that they've seen in USA Gymnastics since the last Olympics, and they really say that they're encouraged by this. And I also spoke to a local psychiatrist who says that he often sees these type of tendencies in high-performing athletes and people, that they tend to compartmentalize their mental health and put it last, but he really hopes that this moment in history will change that.
Round off right here. Good.
As an athlete, Sophia Butler says she's always admired Simone Biles.
It's not only, shows you how strong of a gymnast she is, but just as a, human.
I say put mental health first.
Now her admiration has only grown deeper after Biles withdrew from the Olympic gymnastics team final, citing her mental health.
It showed how mentally strong that you have to be in order to, be able to exit yourself from a situation, even if it is, the Olympics. And I hope there's going to be a lot more talk about it, a lot more understanding about it.
At Discover Gymnastics in the Heights, where Sophia trains, it's been the talk of the day.
I think the most important lesson is that winning isn't everything.
Coach Juan Jimenez says mental health is a topic he and other coaches here discuss regularly. He believes this moment is pivotal.
I would love for my girls to walk away from here saying, like, hey, the things that are happening with me whenever I compete, the nerves that I get whenever I compete is perfectly normal. If the best gymnast in the world can have these moments, then I'm allowed to have these moments also.
There's a difference between healthy striving and perfectionism.
Psychiatrist John Stevens says perfectionism can turn into an all-or-nothing mindset, which in turn can cause someone to view failure not as an event, but as a personal character flaw.
Their effort, their practice, their dedication, that is, I think, something we can take away from this, not just whether it was a gold medal or not.
Sophia hopes Simone's courage will change that.
It shows that no matter what, no matter how big of a stage you're on, no matter how many people are watching you, no matter how high the stakes are, your mental health and, you know, you as a human rather than an athlete comes before anything else.
And Daytona, something else that Dr. Stevens said that I found really interesting was that he brought up the fact that there's a lot of restrictions, health restrictions put on these Olympic athletes. And he says that could force them not to do certain therapies that are beneficial for their mental health or take certain psychiatric medicines. And he says preventing them from doing that puts them at an unfair disadvantage. I'm reporting in Houston. Daytona, I'll send it back to you.
Yeah, Maria, this is just such a huge conversation. We've seen this with athletes in the past, Naomi Osaka going through similar trials right there, but Simone Biles just exploding this conversation about mental health for not only athletes, but aspiring athletes, speaking with so many of those local journalists, local athletes. It is definitely something to be taking note of. Maria Salazar reporting live for us in Houston, Texas tonight. We'll be speaking with you soon, I'm sure.
Thank you.
We're going to go out to a quick break here on Live Now. As you can see, it's been quite the busy day here. We're tracking the latest out of Wisconsin when it comes to this home explosion claiming at least one person's life. We brought you that full press conference just minutes ago. So we'll be back here in just 2 minutes with more specifically about the coronavirus. Welcome back here to Live Now from Fox, almost 3:40 here in Phoenix, Arizona. We want to be stepping into some more coronavirus news because there has been a lot today. To break it all down, we have Fox 5 in Atlanta with a nice little Q&A session that might be answering some of the questions you have at home.
Close to 60 medical organizations are calling for healthcare workers to be required to get the COVID-19 vaccine. Now, here in the metro area, Piedmont Healthcare has announced it will mandate the vaccine beginning this fall. But other hospital systems say they're still trying to sort through all the details here. The Fox Medical team's Beth Galvin joins us live now to talk about this. Good morning to you, Beth.
And good morning, Portia.
There is a lot to sort through here for all of us, but particularly healthcare workers. Do we know what percentage of healthcare workers are vaccinated at this point?
So there are different surveys that look at different groups, and I think there's kind of a range. The American Medical Association had a survey, and in that survey, 96% of physicians said that they were vaccinated. And in a nursing association, American Nurses Association poll, about 83% of nurses polled that they were, had their full regimen of vaccination doses. It drops, Portia, when we start to think about nursing aides and people in long-term care facilities. In those facilities, according to federal data, just 58% of the staff in long-term care facilities are fully vaccinated. So the levels kind of drop as we sort of move into nursing care facilities, with a lot less, I think, uptake of the vaccine in those facilities. Portia?
Well, Beth, I know you spoke to the chief medical officer at Grady Memorial Hospital. Are they considering a vaccine mandate for their employees?
So I talked to Dr. Robert Jansen yesterday, and he said, that they're always in constant discussion about how to handle vaccinations. He said that they're about 50% of staff, maybe a little bit over 50% of staff are now fully vaccinated at Grady. But he said that, at this point, they're not there where they're ready to say we're going to mandate or require vaccinations for our healthcare workers. And one key thing, Portia, is that, the vaccine has been approved under sort of an emergency use authorization. It has not been fully approved by the FDA. That makes things a little bit more complicated when we talk about, whether we're going to mandate the vaccine, because there are, he said it might be really prudent, he believes, to kind of wait until there's full approval of the vaccine before telling healthcare workers you have to have the vaccine. Portia?
Right. And a lot of these medical groups issued a joint statement saying getting vaccinated is an ethical obligation, their words, for healthcare workers. So what do they mean by that? Seems like a bit of pressure if it's not something you want to do, and something people would surely embrace if it is something they believe in doing.
Well, the organization's saying that it is really an ethical obligation because they care for vulnerable populations, especially when we talk about nursing care facilities. They bore the brunt of the early months of the COVID-19 pandemic. And so, they're really saying we've got to be their line of protection, and we have to be a solid line of protection, and we have to be vaccinated if we're going to be working with these vulnerable, sick populations. The biggest sort of, I think, reason why some healthcare workers have not been vaccinated is that the vaccine, for the same reason many Americans have not been vaccinated, and that's because, the vaccine is considered new. They want to learn more about it. They want to wait. They're concerned about side effects, just like others who are reluctant about, getting vaccinated. So, and I think, Portia, just kind of in wrapping things up, I think that, for healthcare workers, they were first in line, and it happened kind of quickly, I think, where they were like, okay, the vaccine's ready, line up, let's go. And so I think in that group, there are some that are hanging back and saying, no, this happened too quickly. I need more time to work this out. So it'll be interesting to say 55 organizations or healthcare organizations or hospitals have now said that they will mandate the vaccine, including Piedmont Healthcare. So it'll be interesting to see how this plays out over time, especially with this much more contagious Delta variant. Portia?
Beth, thanks so much for keeping up with all of these details. So much to manage here.
Well, with the coronavirus rising, cases rising across the country, that's also bringing up conversation about further restrictions, including travel advisories. We're seeing Chicago, they're adding 9 states to the COVID-19 travel advisory amid this uptick. We're going to play out some of that press conference for you from earlier today with public officials as well as Mayor Lori Lightfoot.
Dr. Geraldine Luna, Medical Director at the Chicago Department of Public Health. We're here to give a COVID-19 update. I'll do that in English, and then Dr. Luna will follow in Spanish, and then we'll have an opportunity to take your questions. So first of all, we want to start with an update to the travel advisory. And as you have been hearing, the news around the country on COVID-19 is not good. There are now 14 states and 1 territory on Chicago's travel advisory. So today we added 9 states: Alabama, Alaska, Arizona, Kansas, Mississippi, Oklahoma, Tennessee, Texas, and Wyoming. They join the states that were already on the list: Arkansas, Louisiana, Missouri, Florida, and Nevada, as well as the Virgin Islands. As a reminder, these states are added to the travel advisory list when they are seeing surges in COVID-19 cases, specifically more than 15 cases per 100,000 population per day. And as another reminder, people who are vaccinated, the travel advisory does not apply. For people who are unvaccinated, if you are traveling from one of these states in orange, you need to either get a negative COVID-19 test or quarantine for 10 days upon return. I also wanted to get a little more detail into this and give you a sense of the fact that here in Chicago, we remain actually in quite good control for COVID, but that is not the case around the country. And to put that in some perspective, on this map here, the lightest yellow, which includes Chicago and the area around us, are parts of the country that are still averaging fewer than 10 cases per 100,000 per day. As you see those numbers go up, the number of cases grows significantly. And there are a number of counties. The darker the red, the higher number of cases. And there are some counties where we're seeing levels back over 100, even 150 cases per 100,000, literally 10 times the rate of what would put the state on the travel advisory. So I know there's a lot of concern about COVID here in Chicago. I'm glad for that concern because I want people to take this seriously and I want people to get vaccinated if you haven't already. But this is the Delta variant spreading across the U.S. It is now making up more than 80% of the cases here in the Midwest region and really across the country. I also just wanted to highlight that very clearly cases are tracking along with vaccination rates. If you look at this graph here, this is just over the last couple of months. What you see, that black dotted line is showing Louisiana, for example, the state that currently has one of the highest cases per 100,000. But then in blue are states in the South, and then in pink in the West, in green in the Midwest, and in red in the West. And the reason that we are seeing differing rates of those increases is because we are seeing differing rates of vaccination. So the West and the Midwest, different rates than in other settings. All right, let's look at our situation here in Chicago. So here in Chicago, as a reminder, this is the same risk matrix that we have been using throughout COVID, even before there was a vaccine available. And all of the metrics that we're following are currently in the lower risk tier. So specifically, we're averaging 165 cases per day of COVID-19. That is increasing. I expect that we will cross the 200 mark and move into moderate risk probably within the next few days. Our test positivity is at 2.6%. That is also increasing. It's still in the lower risk category, and if we get over 5%, that's when we would move into moderate risk. Our number of hospitalizations is just at the very low end of our lower risk category. You can see we're currently averaging about 101 non-ICU beds a day, and then we're averaging about 32 ICU beds a day. So overall, we do remain at lower risk, but we are moving in the wrong direction, and that's part of why we've been sharing the news with you more frequently as we've been seeing increases. If we look at a couple of graphs quickly, just to put this in some perspective, going back over the last 6 months, our percent positivity, for example, 2.6% is really quite good. And if you think about where we were for months, we would have killed to be at a 2.6% positivity. But compared to where we were just a few weeks ago, we'd gotten as low as 0.4%. And similarly, that 200 cases per day, we've really enjoyed these last 2 months being under 200 cases a day. But for some context, all of last year, from the beginning of COVID all the way through, there were only 13 days in the whole year in early June that we were under that 200 case per day mark. So I want people to be concerned, but I don't want there to be unnecessary panic at this point. I just want to make sure people get vaccinated is the most important thing. Here is data showing the risk of cases, hospitalizations, and deaths in Chicago for people who are vaccinated versus unvaccinated. So in red here, this is for cases. Going back to March, the red line shows Chicagoans who are unvaccinated who were diagnosed with COVID. The dotted blue line shows people who had gotten a first dose but were not fully vaccinated against COVID. And the dark blue line shows people who were fully vaccinated against COVID. So we can see going back to March, including that smaller surge that we had in April, all of the numbers went up a little bit, But the huge majority were in red there in the cases of people who are unvaccinated. And that's really been the pattern that we've seen across the U.S. and that we continue to expect to see moving forward. If we look at hospitalizations over that same time period, similarly in red, this is giving you hospitalizations of unvaccinated Chicagoans. And then in that same time period, the dotted line partially vaccinated and the dark blue line fully vaccinated. And you can see the risk of hospitalizations in the blue there for fully vaccinated Chicagoans is almost to zero. And it's been really great to see how protective the vaccine has been. And then finally with deaths, again, this is just the last 3 months, so not during or going back to March. And again, the highest rates by far in people who are unvaccinated. You see that dotted line of people who are partially vaccinated, and then really very low, near zero, the rate among people who are fully vaccinated. And just to put a more specific number on this, 97% of our hospitalizations and 97% of our COVID deaths going back to January have been in people who are not fully vaccinated. Let me say that again. 97% of the hospitalizations and the deaths here in Chicago in people who are not vaccinated. And if we look at the specific numbers, there have been 788 when we last ran these numbers, people who died from COVID-19 here in Chicago residents, just since January. And among those 788 deaths, 767 of them were unvaccinated. And of the few who were vaccinated, the median age there was 79. Everybody had underlying conditions. So there's no such thing as a 100% protective vaccine, but these vaccines continue to prove their safety and their efficacy in the real world. Today marks 1 year since the first phase 3 trials started for the COVID vaccine. They mark the beginning of vaccination for us here in the US. And I hope people who have been waiting and seeing, which I've heard a lot, now feel confident, where we literally have billions of people who have been vaccinated and a whole year since we've started vaccinating folks here in the US. Now is the time to get that vaccine. You want to be a blue line on these graphs. You want your risk of cases, hospitalizations, and deaths to be lower. 2/3 of eligible Chicagoans have gotten at least that first dose of vaccine. That's 67% if we look at everybody over the age of 12. It goes up to about 69% if we look at those over 18, about 73% of those over 65, and about 60% of Chicagoans who are eligible are fully vaccinated. The vaccination rate in Chicago has actually stabilized over the past few weeks. Again, you see these numbers are much lower than they were back in April. But I want to point out here that the majority of people getting vaccinated are getting vaccinated in pharmacies. That's that pink line, the pink numbers there. And then after pharmacies, we're seeing people getting vaccinated predominantly in their outpatient settings, meaning with their doctor, whether that's a federally qualified health center or an outpatient doctor. And then there are more getting vaccinated in the hospital setting. And through public health. But as a reminder, you can walk into pharmacies, nearly every pharmacy here across Chicago. You're not needing an appointment. They make it easy. And I want to remind people, getting vaccinated is the most important thing. You will get the same card. We got this question, regardless of where you get vaccinated. But please make that decision to get vaccinated today. We continue to focus on vaccinating both adolescents and seniors. We're making the most progress each week in that 12 to 17-year-old group, which is good because that's the group, particularly as we're looking toward heading back to school, that we'd like to have as protected as possible. But you can see we still have a ways to go for both our younger Chicagoans and those over 80. And we're continuing to focus on vaccinating Black Latinx and Black non-Latinx and Latinx Chicagoans. You can see about 41% of Black Chicagoans have gotten at least a first dose of vaccine, and about 49% of Latinx, compared to more like 62 to 65% of white and Asian Chicagoans. And we know that COVID has hit harder in the Black and Latinx communities, so particularly there.
So you've been listening in to this press conference out of Chicago with health officials down on the ground there. The big news out of this press conference, they're adding 9 states to the COVID-19 travel advisory. So we'll be keeping our eyes as each state is making some new restrictions day by day here. And you know, we have it all here on Live Now from Fox. Staying with the pandemic, though, as many people were staying home, they needed some, something to do when they were at home. A lot of people picking up home projects and buying quite a bit of furniture. Well, this is causing a major backlog for a lot of businesses right now. Fox News' Austin Westfall reports on why you might have a long wait time when it comes to getting that couch you might be waiting for. Hi, Austin.
Hey there, Daytona. Yeah, so the delays are mounting at furniture manufacturing facilities like the one I'm at right now. It's going to mean long days for all those workers that are building the furniture and also long wait times for those orders. Normally, during an economic slowdown, items like furniture see a drop in business.
Everything is tenfold from, 2-3 years ago.
Instead, the pandemic has doubled business for furniture manufacturers like Carolina Custom Leather in Conover, North Carolina.
When the business went up at such a fast rate, it definitely put a strain on the supply side.
Owner Todd Stroud says the rush is causing nationwide backlogs. It normally takes about 8 weeks for Carolina Custom Leather to ship an item, but right now it's 22.
Orders have been up 30%, but the shipments have only been up 6 or 7%.
Jerry Epperson has analyzed the furniture industry for 50 years. He says a shortage in foam is causing problems too. Severe weather forced suppliers in Texas to temporarily shut down earlier this year.
And they got way behind in being able to make those chemicals.
So instead of getting 100% every week, we were getting 30 and 40%, and that lasted for over 2 months.
Experts say furniture supplies shipping from overseas have also been delayed at U.S. ports. It could mean your furniture order isn't available for a long time.
In a year, it'll be easier to custom order exactly what you want.
Now, Stroud says that he does not see an end in sight for these delays as of yet. He says it's possible that this could even be the new normal. For now, here in Conover, North Carolina, Austin Westfall, Fox, Live Now.
Yeah, Austin, really interesting conversation as we're seeing, backlogs for a lot of industries right now. I'm curious, did they say that there's a certain influx in a specific type of furniture?
I think most of what we're seeing are delays in custom-built furniture. A lot of furniture that's built on production lines, those are the types of furniture that might not be seeing as big of delays. It's more like these handmade facilities that are selling more upper-end types of furniture, things that people custom order, have specific colors in mind, specific lengths in mind for specific pieces. Those are the types of things that you should be expecting those longer delays on.
Yeah, really interesting. Again, Austin Westfall, he's a new face here on Live Now from Fox. You'll be seeing him a lot more, though, bringing us reports from across the country here on Live Now every day.
Daytona, thank you.
And we're going to go out to a quick commercial break here on Live Now. When we come back, we are expecting a live report out of Wisconsin, Rome, Wisconsin, as we've been following this home explosion and investigation underway. They're saying it possibly was a natural gas leak, but we heard from officials not too long ago. We'll now be hearing from reporters down on the ground that have seen the wreckage of this explosion. We'll see you back here in just 2 minutes. And welcome back here to Live Now, almost pretty much 4 o'clock here in Phoenix, Arizona. We've got a stacked lineup for you coming in the next few hours here. Also a stacked lineup for Lollapalooza. We hear from officials down in Chicago. We were just talking about those travel advisories that are in place at this point in time. Well, there's also some other talk about COVID-19 restrictions for the massive music festival. Let's listen.
About Lala because I know people have questions. So where we're thinking about attending Lollapalooza and how to attend safely, want to remind people to enter, you must bring a printed copy of your vaccine card, vaccine record, or a negative COVID test taken within 72 hours of the day that you're coming into Lala. You need to activate your festival wristband and register for cashless. And then if you're unvaccinated, we're recommending you wear a mask throughout your time on site. Also, just as a reminder, only clear bags are allowed and there are no liquids allowed to be brought into Lollapalooza. Remember to wash your hands or use a hand sanitizer, limit consumption of substances, especially if you're not sure what they are, and consuming alcohol that can make you less likely to follow COVID measures and generally can be an issue that we've seen associated with Lala in the past. And don't attend Lala, really. Don't attend. If you develop any symptoms of COVID-19 and you haven't taken a test, even if you're fully vaccinated, and if you've tested positive for COVID in the last 14 days, do not attend. The last thing is to make an announcement that we are expanding our capacity for Chicago at Home, Protect Chicago at Home. For those who are not aware, this is the program that we started with for people who were homebound, and then we expanded it to people who were over 65. And then we were really, I believe, the only large city that has expanded this to anybody in Chicago over the age of 12 who would like to schedule a vaccine appointment at home. We will make an appointment for you free of charge. You can call 312-746-4835. So we're doubling capacity because we've seen very good uptake, especially among both older folks and young and adolescents with their families, which is a primary area. We've also seen a majority of vaccines going to Black Chicagoans, which is a group that we've been working hard to reach. So appointments can be booked now, chicago.gov/at-home. You can do either Pfizer or Johnson & Johnson. We can vaccinate up to 10 people at a time, and we're expanding the hours as well so that there are now hours available till 6:30 p.m. On the Monday through Friday to better meet needs of working folks. And then the last thing is Grubhub had sponsored the initial expansion phase of this to everybody, and we'd been giving folks who were getting vaccinated a Grubhub gift certificate, one for the group. As we are coming to an end and expanding that, we are now providing $25 Visa gift cards. One of the reasons we're doing that is we heard that people who didn't have a phone maybe couldn't access the Grubhub app. This is literally just a card that you can use anywhere that Visa would be accepted. Again, we'll be giving one of these to anybody who is vaccinated in this group. So if you get 5 people together, each of those people will get a gift card. But we encourage you, just as we did last time, use that opportunity to celebrate vaccination. And it's to also encourage people to spread the word. We continue hyperlocal vaccination events. We've been doing really well at a number of our outside events like Swaparama and Brickyard Mall in the Northwest and Southwest continue to be very successful events for us. And so we're out there every weekend. And I just wanted to give you a flavor of last weekend alone. We were at a community health fair with the Allergy and Asthma Network. We were at the Chicago Humanities Festival. We were at vaccine pop-ups in Greater Auburn Gresham, as well as Little Village. We were at the Mason Park Block Club. We were at a fatherhood initiative summer celebration. We were at a church. We were at a laundromat. We were at another church and a jazz coalition. And we've really been working to try to make sure where we are putting our efforts, they're places where people are excited to get vaccinated and where we're seeing good numbers. And then in a lot of the larger, more fun events where we don't always find people saying, I want to get vaccinated on the spot, we're doing more of the vaccine ambassador work and helping people sign up for at home. So for example, at Lollapalooza, we're not that interested in vaccinating on the spot. We need people to already be vaccinated by the time they come in. But where people are coming with testing, our vaccine ambassadors will be on site, encouraging those people to sign up for at home. Appointments remain available, ZocDoc.com/vaccine or through that same phone number. And I just want to remind everybody that We certainly are concerned as numbers are increasing around the country. I expect to continue to see increases here. While it's summertime and we can gather out of doors, that remains the safer way to do so. And where people are feeling uncomfortable, we certainly encourage mask wearing, but we're not at a point where we're needing to recommend that for the whole population because we remain at lower risk and we've been seeing those vaccines be highly protective. With that, I'll have Dr. Luna give some comments and come back for questions. Thank you.
Sí, muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les traemos varias noticias. Primero que nada, queremos ir a las restricciones de viajero.
So again, you've been listening in to this press conference out of Chicago. Let's go out to Fox 32 in Chicago as they're speaking about security concerns for Lollapalooza as well. Let's listen in.
From Lolla, thousands will be flocking here. So getting the stages up with the proper COVID precautions is obviously going to be a big job.
Yeah, and another big job is keeping all of those music fans safe. So we are joined by former Chicago Police First Deputy Superintendent Anthony Riccio, who is now the Director of Public Safety for Monterey Security. Thank you so much for coming on. I know a lot of us have seen you at press conferences for a lot of the dealings in Chicago. You look well rested now. We can understand why. First of all, let's talk a little bit about the this show. How much of a headache is a major festival like this for people that, like you, are in charge of keeping everybody safe?
Sure. I mean, it's a huge undertaking. You look at there's going to be 100,000 people probably each day flocking to Lollapalooza, and there's a challenge within the venue itself. You know, when people come into this venue, they're going to be screened. Their bags are going to be checked. They're going to go through the metal detectors. So there's going to be a lot of work and a lot of effort to collaboration between private security like Monterey and the police department to keep the people inside the venue safe. But then there's other considerations as well. You know, you look at the Vegas incident back in 2017, where you had a gunman firing on a venue like that, very similar to a Lollapalooza type venue, through a hotel window. The area outside the venue is also a concern. Just look like last week in Washington, D.C., outside of the ballgame, where you had a gunman open fire on people outside of the ballpark. So it is a challenge. There's a lot that goes into it. There's a lot of considerations that go into the safety. But I think we're going to be ready. I think it's going to be a great event.
I'm so glad you brought up Vegas because for me, awareness, I think, is going to be one of your key challenges. And I don't need to tell you that last time Lolla was here, marijuana recreationally sold was not the law of the land. So I would imagine that a few people that are inside perhaps are going to be a bit impaired. What do you want people to know about being aware when they're, listening to their music?
Well, I think one of the things, I'm glad you bring that up. It's illegal to smoke marijuana inside, even though it's legal recreationally. It's illegal to smoke it inside of this venue. And there's going to be undercover officers, as there are every year, walking in the crowd. They're going to look like you and I. They're going to be in shorts and T-shirts, and they're going to be looking for that, and they're going to be arresting people, as they have in the past as well. So there's a lot of challenges that go into the safety, and certainly keeping the event drug-free is one of them.
You know, a lot of parents are sending their kids to this, or they're going to allow them to go. And all the while, with all of the violence that we've been seeing all around Chicago and some of it coming into the downtown area, a lot of them are very, very concerned. What are your thoughts about this right now as people head into the city from the suburbs? What do you want those parents to know about, not just what you're doing, but how about being smart when you come into the downtown area? What do they need to know?
Sure. So I think it's important to realize that there have been problems in the area. I mean, I don't think I'm saying anything that people don't already know. When the event is over, have a plan to get out, whether it's walking in groups to get on the train and head back home, or being picked up somewhere. You want to stay in groups. I wouldn't recommend going wandering around downtown or the lakefront. It's tempting to do that, but I would say go in, enjoy the event, and when it's over, safely leave the event and go back home. Definitely don't break away and be on your own, even groups of 2 and 3. Stay in large groups, stay with the crowds, and leave the event when it's over and head back home.
Also, I want to ask you, I know that you're in Monterey security right now, but because you come with such a wealth of knowledge with Chicago, how worried are you right now about the city of Chicago and our officers who are out there day in and day out? I'm sure a lot of them still keep in contact with you. What are they saying?
They do, and I hear it every day from people. The officers are tired, and they're out there working hard. These guys are just incredible. Most of them have sacrificed their entire summer, and it's plans with their families. It's vacation time. It's time that they should be able to kind of relax a little bit and enjoy their families and their lives. And they're tired, and I really feel for them. My heart goes out to them. I think there's a lot of things that need to be looked at within the department, and there's a lot of staffing issues that need to be looked at, a lot of allocation. I think there had been a move for a long time to move those officers back into the districts and let them work closer to the communities. I think maybe we have to explore that again, bringing those numbers back up. I know recruitment is difficult right now in this climate, but yeah, my heart goes out to those guys. They're working hard, and I still think, I know, there's a lot of anti-police protests and things we hear all the time, and a lot of negativity, but I think the overwhelming public really support the officers, and that's good.
Well, I'll tell you on a personal note, it's been a while since you've been in studio pre-pandemic, but civilian life, to Anita's earlier point, is doing well for you. You look 5 years younger at least since the last time we saw you. So
I feel 5 years younger.
Yeah, you look good. Anthony Riccio with Monterey Security. Thanks for your time this morning.
Take care.
Great seeing you guys. Thank you.
Again, that was Fox 32 in Chicago. Their live look from the White House. We're going to switch gears. Republican lawmakers speaking with, well, they want to meet with President Biden to discuss Cuba. The Fox 13 Tampa team has a look at their concerns and their push for change.
Let's turn our attention now to Cuba. As calls grow for freedom for the people there, Senator Marco Rubio of Florida and other Republican leaders say they can work with President Biden to help liberate the people of Cuba. Political editor Craig Patrick is joining us now with a closer look at their plans and their concerns over this. Craig?
Well, hi there, Chris. We'll start with some of the biggest concerns, one of them being the concern or fear that the Cuban regime is now planning a mass exodus to Florida and the United States, like we saw, say, in 1980, perhaps another Mariel boat lift, but maybe on a much larger scale. And the other big concern the Republicans have, and stated in this letter, is that they fear that there could be a potential massacre in the works here, a bloody crackdown, something along the lines of China's Tiananmen Square, but again on a much larger scale.
Convene the United Nations Security Council. Convene the Organization of American States. Use your diplomatic heft, the fact that America's back, and go to all these countries and say, okay, guys, we have a massacre about to happen 90 miles from our shores.
Senator Rubio, House Republican Leader McCarthy, Senator Scott, and other leading Republicans sent this letter to President Biden. They're worried and say they need to work together to address the growing crisis in Cuba.
The right thing for the President of the United States to do here is to take the meeting.
While the president has maintained restrictions on the Cuban regime and added sanctions on some Cuban officials, the Republicans like Senator Scott are pressing for more, and they would surely use a meeting to try to persuade the president.
Immediately shut down the ill-named Cuban embassy of the communist dictatorship in Washington.
But they also want to meet for two other reasons. First, to make sure they're in sync if the situation in Cuba escalates.
And I want to know what Joe Biden's going to do when 1,000 special forces from Russia arrive on Cuban territory to help the Cuban regime, because that's what's coming next.
And they also say they have common ground on ways they can work together to help free Cuba. For example, the heavily censored internet service the Cuban people have from the regime restricts the protesters' ability to communicate and organize. The Biden administration says it's already trying to find ways to beam free internet access to the Cuban people. And the Republicans say they want to help pass and fund a plan to make it happen.
We have an ability here in our country to help, to allow these Cubans to be able to communicate with each other, to communicate around the country, to communicate with the outside world.
They could try to use Guantanamo Bay to transmit free internet service, or try to deliver it through a network of transmitters we could float over Cuba on hot air balloons or through satellites. The question is which way to go and how long it would take to deliver. This would be experimental. It's something both sides want to do. Again, the question is how. Satellite technology may be the most effective, but that may take the most time. We may not have a lot of time here to support the protesters unless there are significant changes in federal regulations, which would be a possibility. The other drawback or challenge with using hot air balloons or Guantanamo Bay range. There's a limit in terms of range for a Wi-Fi signal, and if the Cuban regime sees a lot of people gathering in a certain area, it wouldn't be very difficult in a surveillance state like Cuba for them to find out what the Cuban people were up to, trace the digital signals, and then crack down on the protesters even more. Those are some of the challenges that policymakers are talking about as we speak and figuring out what the next steps should be.
So, Craig, I'm curious, do Cubans have any way right now of getting access to the internet?
Not much. They've had very censored, restricted, government-controlled access that was effectively cut off once the protests took off. Most have very little ways to evade that. There are some, a very small number, who have found ways through VPN to evade the censors, as it were. But that appears to be, based on intelligence, a very, very small number who are taking significant risk in doing that, again, due to the surveillance and their likelihood in some cases to be caught.
So really, we don't have a clear picture of what's currently going on in Cuba because this is being masked or communication is being blocked for a lot of the people there.
And what better way to support the Cuban people than to unblock it? That's where there's common ground. The question is execution.
All right, Craig Patrick with the latest on this Cuba situation. Thank you, Craig.
So again, that was Fox 13 in Tampa. We want to take you out to a story we've been tracking all day today, though. Jefferson County home explosion. One person reported dead at this time. I want to go out live to Fox 6's Jason Calvi. He's been on the scene all day today. Jason, what do we know at this point in time?
Daytona, we know there's one person dead in this house explosion. I want to show you what the scene is like here. This house completely destroyed. You can see on the street here as well as in the grass. I'm a whole half a block away, but we can see it right in front of us. You can see the insulation, you can see drywall, you can see other parts of the house that were leveled and sent spilling into the street and to the road here. We heard witnesses that said that one man told me he was 13 miles away and he was at work and he heard a big he heard a big boom. We heard somebody else that was 13 miles away as well even said they also heard a big boom. People said it in this neighborhood here that heard this explosion said it sounded like a bomb had gone off. What we do know right now, one person dead in this house explosion. We also know that the state fire marshal is investigating. The county sheriff's office told us that from what it looks like here with the destruction that you're seeing on your screen right now, that it appears to the sheriff. Of course, this is still being investigated. It looked to him like it was a gas leak that caused this home explosion. But again, the fire marshals, you can see the police, the sheriff's deputies right here inspecting the scene still. We also saw firefighters going door to door in the neighborhood to inspect damage. The gentleman here with the sheriff's office, also they're going around inspecting the area to see how much damage was caused by this explosion here in the town of Rome. It's in Jefferson County. We're about an hour, 45 minutes away from Milwaukee, just to put that in context for your viewers. And again, the witnesses describing looking at the scene, they said it looks like a tornado, sounded like a bomb went off. But again, it looks, at least the deputy here saying it looks like a gas leak caused this, but that is still being investigated right now. And one person dead here in Rome in Jefferson County, Wisconsin. Daytona.
Yeah, Jason, do we know anything else about nearby neighbors, residents' homes? How were they affected? We're hearing that there was possibly some power outages out there. I mean, you can see the debris covering almost an entire city block.
Right, yeah, so We Energies is the power company out here. They did cut the gas as well as the electricity to this home after this explosion, and we also know that the electricity is out as well for some of the residents in this community. So that's what's going on right now. We Energies, if Tim, over to the far end of the screen, there are some We Energy workers in their yellow shirts still working, still on scene here. And just about an hour ago, there were still firefighters spraying water on the home, keeping that dust down as this home, the explosion, actually, we were looking at some video from some of the witnesses here, and there was a big black plume of smoke going up into the air here in Jefferson County. Even before the firefighters arrived, some of the witnesses shared some video with us. So definitely devastating. You know, neighbors here describing that their house shook The walls were shaking. The pictures on their walls also shook, and some of them fell down even here in Jefferson County. So definitely shook the neighborhood, and now they're going to have to deal with being shaken here emotionally too, as one person is dead. And it was the only person in the home, according to the sheriff's deputy, only one person in the home, and that person has died. Talking to some of the neighbors, they did see the other resident of that home was safe. They did see her and told me that they did see her safe after this explosion. So still waiting to notify all of the family before releasing the name of the victim in this house explosion here in Wisconsin.
Again, Fox 6's Jason Calvi reporting live for us from Rome, Wisconsin. We appreciate you. We'll be following this story alongside you.
Thanks, Daytona.
And here on Live Now, we're going to take a quick break. When we come back, we're going to be getting an update about a trial that was extremely expansive, confusing, and very, very interesting. The Molly Tibbetts trial out of Des Moines, Iowa. We have more updates and details today with a live report. Welcome back here to Live Now from Fox. The man convicted of killing University of Iowa student Molly Tibbetts was back in court today. Fox's Hunter Davis joining us now live. And Hunter, today's hearing aimed to get a new trial, isn't that right?
Right. That hearing was about an hour east of here in Des Moines. The defense there today using testimony from an inmate to try to convince the judge that Christian Bahena Rivera needs a new trial. Now, Rivera would have already been sentenced by now. However, a jury found him guilty of murdering Molly Tibbetts, and that sentencing has been delayed because of new evidence. A motion for a new trial delayed the sentencing. Just momentarily, though, I want to take a step back into the initial trial that happened in May, when prosecutors showed jurors surveillance video placing Rivera's car in the area Tibbetts was last seen jogging in July of 2018. Investigators also testified that when they questioned Rivera, he gave them enough information to lead them to a cornfield to find Tibbetts' badly decomposed body. Rivera took the stand in his own defense, testifying that two masked men forced him to drive them to a rural road where the men killed Molly Tibbetts and then made Rivera bury her. But jurors didn't believe him, leading to his conviction. Now, jump to today. At least two inmates have since backed the testimony. One of the people tying all of this together, Arnie Mackey. He testified today.
I said, I don't believe you. And then he said, you know, the guy that's being charged for it right now? I said, no, I don't. He's like, reset him up. He's like, was a sex trafficking case gone wrong.
Mackey says a fellow inmate claimed to have killed Tibbetts after seeing her bound and gagged in a, quote, trap house. That inmate admitting to Mackey he and an accomplice pinned the crime on Rivera, but the investigator who oversaw Tibbetts' case battled back, not buying into any of the new names being thrown out by the defense. And it sounds like we may not have that second soundbite there, Daytona. Basically, this special agent, Trent Valletta, was asked if there was ever any developed connections between Christian Rivera and Gavin Jones and David Hansen or James Lowe. These were some of the other names the defense was trying to tie to the murder of Molly Tibbetts. In response, Valletta said, no, Christian Rivera did this all by himself. I've never heard those names before. And the judge really kind of just leaving us all wondering what he's going to do. We gave no timeline for when he may make the decision on whether or not to grant a new trial, saying only that he will get back to us as quickly as he can. Daytona.
Hunter Davis reporting live for us. Sorry about that, Hunter. We'll be following this story alongside you. Thanks for bringing us that information, details on this trial here.
Thanks, Daytona.
And we're going to go out to a 2-minute break here on Live Now as we're tracking all of these stories from across the country. Lots of coronavirus news today. Also following up on some of that news with Simone Biles stepping away, dropping out of the Olympics. Our Fox 11 Los Angeles team talking about that as an entire concept, mental health in professional athletes. We'll see you back here in 2. And welcome back here to Live Now, almost 4:30 here in Phoenix, Arizona. We've taken you to a bunch of places across the country. I want to go back to that story we brought you, though, with Simone Biles. We had a report out of Houston where our reporter spoke with local gymnasts in Houston about that shocking news of her withdrawing from the Olympics due to mental health concerns. Well, this is a problem across the board when it comes to professional athletes. Fox 11's Good Day LA show this morning breaking that down, diving a little bit deeper.
We told you earlier that the world's most dominant gymnast, Simone Biles, has dropped out of the Olympic team competition, saying that she wasn't in the right mental space to continue.
Yeah, so Biles says, you know, we have to protect our minds and our bodies and not just go out and do what the world wants us to do. She says, I think mental health is more prevalent in sports right now.
Three-time Olympic gold medalist Carrie Bates knows all about the pressure, the challenges of being an Olympian. She was only 16 years old in 1984 during the Olympics, where she won 3 gold medals. She also suffered from her own mental health and substance abuse struggles. Now Carrie is working with the Betty Ford Center to help others deal with similar issues. She joins us this morning to talk about all of this. Carrie, hi and good morning. We'll get into Simone and what happened this morning in a moment, but first let's talk about you and your own experience. Help us understand the type of pressure others placed on you and you placed on yourself and what that led to.
Yes, thank you. Good morning, ladies. Being an Olympic athlete, there's a tremendous amount of pressure, both external and I would argue that it's primarily internal as well. You know, most of us are perfectionists, which can also lead to some trouble. But for the most part, I think that the challenges and the pressures come from inside. And I think we saw that this morning with what Simone had to say about what she's experiencing over in Tokyo.
So talk to us a little bit about your reaction when you heard the news and kind of heard, you know, more of the information that it wasn't a physical injury, that she was dealing with, you know, some mental issues. She wasn't in the right frame of mind.
Right. I think the world woke up feeling a little uncomfortable this morning. You know, I think that we wanted it to probably be her ankle or something that was a little bit more tangible than her speaking about mental health. But I would argue that this morning she gave what could be one of her greatest legacies, is that she told the world, millions of people, young girls that want to be like Simone Biles, that it's okay to not be okay sometimes and to take care of yourself. Her message this morning, I thought, was beautiful, and I thought she handled it like an absolute true champion.
You know, that's interesting you say that, because I think just even in everyday life, sometimes we look for that tangible, whatever that is, because then we can point to it and say, ah, this is what's going on. This is what's wrong. When you're speaking of mental health, it's not something we can see. So it's much more difficult to understand. And I think as a society, we also have this expectation when it comes to athletes competing in the Olympics. I mean, at that level, this unrealistic expectation that they're somehow superhuman.
It's very true. And the reality of, and we've seen that not only with Simone this morning, but Michael Phelps has talked about his, Naomi Osaka, the Japanese tennis player, backing out of the French Open because of her mental health concerns. You know, people are starting to get more vocal about their challenges, which is what we need. And what we do every day at the Betty Ford Center, and what I do every day using my own platform to speak about my story, is to continue to just chip away at the stigma that still exists out there regarding mental health. And that's why we were all uncomfortable this morning, because there's still a stigma when we talk about mental health. And again, I just can't express enough the gift that Simone Biles has given the world this morning, is to say that take care of yourself, and it's okay for us to not be okay sometimes.
That's really important. You know, when you think about Olympians, obviously, if you're at that level as an athlete, you know pressure, you know hard. So when someone comes out and says, I'm struggling, it seems easy to put it in perspective and say, okay, something must really be going on. Can you talk to us a little bit about the importance to not compare a physical issue and a mental issue and say this one is worse and we should take this one more seriously?
Sure. You know, I think that regardless of if we were going to have open heart surgery or if our ankle was broken, we go to the doctor and we do what the doctor tells us to do. We have the surgery, we take medications, whatever it is that the prescribed treatment is. Same thing with mental health, but for some reason that's still somewhat stigmatized. And that's the work that we're trying to do every day at the Betty Ford Center, is to say, you don't have to hide behind the mental health issues. As a matter of fact, when we say it out loud, that's where we gain our power back. That's what Simone did this morning. I remember when I went to treatment for my own addiction the first time, which would have been the first of 4 different treatment experiences for me to get sober. I remember being so full of this toxic shame because of the fact that I was an Olympic gold medalist. And what would people think? I felt almost like a fraud. I wasn't what everyone thought I was. But that wasn't the truth. I just had to go get the appropriate treatment and help for my struggles.
Also, the fact that you probably thought, I'm supposed to be perfect, like everyone expects me to be perfect, nothing can be wrong with me. So the work that's being done there at the Betty Ford Center, as well as the Mental Health Minute, those series of videos that are being produced to raise awareness, to make it comfortable, you know, being comfortable in the uncomfortable. I think that's the takeaway that I'm getting from our conversation here. The stigma, as you said, still exists. What's it going to take, and when do you think there will be a time where that stigma will no longer exist?
The time is coming, and we're starting to see more and more people use their platforms in such a positive way when we're talking about mental health. Athletes, we're seeing people in the political world, we're seeing lots and lots of people start to advocate for mental health awareness. It's becoming more and more part of the overall wellness conversation. No longer is it just physical wellness, but mental health is becoming a part of that conversation, which is so important. We are on our way. We have a lot of work to still do. And my hope is that we will continue to use the platforms that we're given in order to spread the message that we do recover from every ailment, whether physical, mental health, substance use disorder. There is hope and there is recovery.
Carrie, thank you so much for being here with us this morning.
And a live look from the White House right there. Earlier today, a pro-Cuba protest rally with several of those familiar faces, many Republicans, lawmakers going out and voicing their support for protests that are still going on, mostly in Florida at this point in time. We're going to play some of that out for you as you're going to see what their main points are here, as the focus has pretty much been on Miami at this point in time. Some of those protests out in Cuba are settling a little bit. Here's the latest from D.C. earlier today.
Right now. Thank God the people of Cuba have stood up. They're saying enough is enough, right? So we've got to stand with them. If we don't stand with them, who will? We are the beacon of light. So I want to thank Matt Mercedes for putting this together. I want to thank Kevin for being here and all the effort he's put in to make sure we get freedom in Cuba. And what do we have to do? Our job is to let everybody know what's going on there. We know that dissidents are being arrested. We know that they're being tortured. We know that peaceful protesters are being beaten up. We know children are being taken and put in the military. We've got to get that story out. Every video, every picture we see, we've got to make sure everybody sees it. Then we have to expect the Biden administration to show up. Don't you saw Joe, right? Where is the guy? I mean, he needs to get out there and talk about what's going on. He should be the one that's doing these press conferences saying, we are the beacon of freedom. We want liberty in Cuba. Cuba is the reason for instability in Latin America. He needs to call Macron, Boris Johnson, Trudeau, all of them say, we have got to stop this. It's our time to do this. It's a historic moment. The people of Cuba have stood up. We have to stand up. And if we don't, who's going to stand up? He needs to get rid of the Cuban embassy in D.C. It's illegitimate. It should never have been here. The internet's got to get back on. You can do it. We need the Biden administration to be a partner in making that happen. So to the people of Cuba, we will stand with you. We will stand with you arm to arm and do everything we can to make sure you get the freedom you deserve. Thank you for the opportunity to be here. Fight every day. We can win. Libertad.
Okay, you heard from Florida. Now you got to hear from Texas. A great Senator, Ted Cruz.
God bless the United States of America. And God bless the people of Cuba. Right now, we are seeing incredible heroism. We're seeing courage displayed in the streets of Havana. We're seeing Cubans who are standing up and demanding to be free, and they are risking their lives. They are risking communist thugs coming with billy clubs and beating them, imprisoning them, torturing them. But let me speak right now to the people of Cuba. We hear you. The American people hear you. and the world hears you. Your courage is inspiring. Your courage is powerful, and your voice, liberty, will prevail. Over 50 years ago, my father came from Cuba. My aunt, my tia Sonia, came from Cuba. Both my father and my tia Sonia had been thrown in prison. Both my father and my tia Sonia were tortured in prison. And for both my father and my tia Sonia, America was a beacon of freedom and hope that they could escape and live free. When it comes to the communist dictatorships, whether in Cuba or Venezuela, they are evil, they are repressive, they are illegitimate, and they will fall. 16 blocks away is the President of the United States. I call on Joe Biden to take up the mantle of leadership expected from an American president, to speak unequivocally and say, America stands with the people of Cuba. The communist regime is evil, it is oppressive, it is illegitimate, and it must fall. The people of Cuba deserve what they're demanding in the streets. They deserve libertad. They deserve liberty. They deserve freedom. And we will see a Cuba Libre. Together, America stands with the people of Cuba.
Okay. There's somebody in the House of Representatives who's led on this issue since the time I think he was born. And he's the voice we need to hear now. He was out of the streets with you yesterday, and he's really shaking things down today in the House. Mario Diaz-Balart, would you please come up?
Good afternoon, American patriots. Let me first thank each and every one of you. At a time when the White House decides that the issue afflicting the Cuban people who are demanding freedom, what does he do? He gets together a group to talk about remittances. Remittances. Well, let's be very clear. And don't take my word for it, Mr. President. Listen to the Cuban people in the streets. They're not saying we need aspirin. They're not saying we need remittances. They are saying we need freedom. Libertad. Libertad. And I want to be very brief because you have a lot of folks here that you're going to listen to. But I have a message to what then Jeane Kirkpatrick called the Blame America First crowd. You've heard them. You've heard the apologists of the regime blame the United States of America for the repression. You've heard the apologists for the regime say that the answer to the Cuban people is doing business with the regime, i.e. lift the sanctions unilaterally. One message. It's not the sanctions that's murdering Cubans on the street. It's not the sanctions that's bludgeoning them in their homes. It's not the sanctions, and it's not the United States of America that has deprived them of their freedom for 62 years. It is an illegitimate, murderous, terrorist regime. And the message to all of those apologists of the regime that think that that communist, socialist country is the panacea. Listen to the Cuban people. They're not carrying British flags in their demonstrations. They're not carrying Swedish flags in their demonstrations. They're carrying the American flag along with the Cuban flag, because America is and will always stand for freedom. And let's make no mistake about it, they call themselves a socialist panacea. The regime in Cuba. Call it socialism, call it communism. It will fall because of the heroism of the Cuban people. It will fall because the American people understand freedom. It will fall despite a president who is totally asleep and clueless. And so, to CPAC, to all of you, mantengan la presión. El cubano lo está sacrificando todo y tiene que saber que no están solos, que el pueblo de los Estados Unidos está con ellos. Y a pesar de los que quieren ayudar al régimen, el mundo pronto va a ver la realidad que existe en esa isla. El socialismo y el comunismo va a ser derrotado de una vez y por todas. Y cuando Cuba sea libre, que lo va a hacer, lo va a seguir Venezuela y Nicaragua. Gracias, mantenemos la presión. And I end by thanking the most noble people in the history of humanity, the great freedom-loving people in the United States. Us, for one, are not apologetic about the greatness of the United States. We will never apologize for the greatness of the United States and for the freedoms that so many take for granted. Thank you. God bless the United States. Y Cuba va a ser libre por los esfuerzos de todos ustedes y el valiente pueblo cubano. Muchísimas gracias. God bless you all. Thank you.
Thank you, Mario. Thank you. And now I would like to bring on stage Pastor Mario Felix Leonard Barroso, a Cuban dissident, and he's coming up to speak with you all and share his story.
Another Mario. Thank you for your presence today. I am a pastor. I only a refugee from Cuba. 5 years ago, I arrived to the United States because the government in Cuba imprisoned me for many times. In the day that Barack Obama arrived to Cuba, the government imprisoned me. I am in the street and my petition was freedom, freedom, but the government arrested me. And for 3 days that Obama visited Cuba, I was in the prison. Thank you for your presence today. Many pastors and many friends, many brothers and sisters now in Cuba are in prison too. 5 years ago, my boys were very little. But now, the difference that July 11, many Cubans in the street and the petition are the same petition than me. Freedom, freedom. No, not medicine only, no food only, but freedom. Because with freedom, our food, our medicine, our internet, are all things. The Cubans lack freedom, freedom. And we need your help. We need your help. United States and Cuba for many years in the history, our histories are very near. And in this moment, the battle for Cuba is the battle for the United States too. Because the communist is neighbor. And the communists in Cuba look United States and is the enemy from Latin America and from the United States. And in this moment, if Cuba continues the communists, maybe in 10 years, the United States too is coming. Then it's the time for the freedom to the Cubans and all Latin Americans and for the United States. Thank you for your presence and pray because another pastor, another friends, Jose Daniel Ferrer is my friend, the father, is for 10 days. I don't know what is the situation. Is his dad, is his life? I don't know. Another friends, one pastor, Lorenzo Rosales, the wife, I told with the wife yesterday, the wife of pastor, I don't know. It's the pastor. Then pray, please, pray. Thanks God for this day and thanks for these people. Thanks for the love to the freedom. The Cubans are need freedom, but this battle is for the United States too. Please God, it's the time. Thanks for your presence and help us in the name of Jesus. Amen and amen. Thank you.
Thank you, Pastor. And for so many reasons, it's my great honor to introduce our next speaker. And I love saying what her title is. Our House Republican Conference Chair, Elise Stefanik.
Thank you to CPAC. Thank you to all of you for being here today. House Republicans proudly stand with the Cuban people in their fight for freedom. Right now, today, in the streets of Cuba, the Cuban people are shouting liberty, waving the American flag, praying for even an ounce of the freedom that we have in this country here. They're doing this with no power, no internet access. There are food shortages across the country. And yet these brave, patriotic Cuban activists, protesters, priests, journalists, women, children, they are being kidnapped, jailed, beaten, and murdered. And yet they press on, raising their voices for freedom against a dictatorship known for their abuse of power and human rights violation. The Cuban people are taking bold and fearless steps to make their voices heard. And it should be met with a bold response and actions by this administration. And instead, it has been met by deafening silence from the President and House Democrats and weak gestures from the White House. But I am here today to tell you, to tell those Cuban freedom fighters, we hear your cries, and House Republicans and the American people will continue to proudly support your fight for freedom. I've heard these personal stories of my colleagues and my constituents. They have shared how their families who left everything behind in Cuba, they were the lucky ones, despite having to start over with nothing but their freedom. Every Cuban should be free. Now is the time to take a stand with the Cuban people. Every American stands with the Cuban people fighting for freedom, and House Republicans will always stand in support of freedom and against socialism and communism. Thank you very much.
Can we take a brief moment? I see some Capitol Hill policemen here. Will you all tell them what you think of them and thank them for the job they do, keeping everyone safe? We have elected officials here. We have people who have experienced the persecution in communist Cuba, and we have great grassroots leaders. It is my great honor to give you the head of the Tea Party Patriots, Jenny Beth Martin. Jenny Beth, would you come up?
Thank you. Thank you so much for being here today. It was 40 years ago, 6 months and 7 days, that President Reagan gave his inaugural address from the West Lawn of the United States Capitol. It was significant because that was the first time a president had given an address from this side of the Capitol rather than the east side facing the Supreme Court. He did it because he wanted to see the pantheon of American heroes behind us. And you'll notice, if you look back and you think about what is behind you and in front of me and what President Reagan saw that day, we have the people who fought and died for our liberty, who are buried in Arlington Cemetery. We have the great leaders who created our country and held it together as a United States of America in the Lincoln Memorial, the Washington Monument, and off in the distance, the Jefferson Memorial. We have others who died, who fought and died and gave everything for our liberties, so we can stand here today exercising our God-given rights, names listed on the Vietnam Memorial Wall and honored at the World War II Memorial. President Reagan was the president who said, freedom is never more than one generation from extinction. The people of Cuba understand what it's like when freedom is extinguished. They've been living without freedom for 6 decades. And they're standing up in the streets today, exercising their God-given right to free speech, calling for freedom, calling for an end of the communist regime that has held them oppressed, and demanding freedom today, using their voices, which we often take for granted here in America. And as they do that, they're flying the American flag, the same flag that's flying out here with many of you today and on the Capitol right behind us. And they understand that that flag, the American flag, the flag of the United States of America, stands for freedom, not just here, but across the entire world. They don't fly the Russian flag, they don't fly the Chinese flag, they fly the flag of the United States of America. They're asking for our help. They want us to stand with them as they call for freedom. They need our country to stand with them and help them in their quest for liberty. Anyone who flies the American flag is a friend of mine, and I'm proud to be here standing with the people of Cuba today. Cuba Libre!
Thank you, Jenny Beth. Now joining us on stage is another great congressman from South Florida, Congressman Carlos Jimenez.
Thank you very much. And I have a little bit different story because when I was a young boy of about 6 years old, I actually lived in Cuba. I was born in Cuba. And as a 6-year-old boy, I remember being indoctrinated. Yes, at 6 years old, they start to indoctrinate you. And my father found out that they were trying to indoctrinate me and brought me and my sister and our family to this great country. And I was lucky. I was lucky to be brought here by my parents. 11 million people in Cuba are not so lucky. They're still there. They're being indoctrinated. Their political persecution. They have no food. They have no vaccines. They have no health care. They have political prisoners, thousands of them, and now they're rounding up even more. But that's not what the Cuban people are saying. They're not saying give us food, though. They're not saying give us vaccines. What they're saying is we want freedom. Freedom. That's all they want. And you know what? What can President Biden do? Yes, we can do everything in our power to restore the internet so the Cuban people can start to communicate amongst themselves, but also show images around the world of exactly what's going on in Cuba, how they're being repressed, how they're being beaten, how kids are being taken out of their homes and thrown in jail, or actually put into service in defense of the indefensible, which is the regime. All we ask, maybe the president can do this. Why doesn't he go on national TV and say, President Diaz-Canel, will you just leave? If you just leave, then all of those problems are resolved. The Cuban people will have food. The Cuban people will have vaccines. They'll have health care. All the political prisoners will be freed. There'll be freedom of the press, freedom of expression, the liberties that we enjoy here in America. That's all you have to do. Just leave. But they won't. They won't because they want power. They want to continue to oppress the Cuban people. And so, you know, for me as an immigrant from Cuba who saw firsthand what they do, who saw the evils of socialism, who saw the evils of communism, I'm asking for the president to take action now, because the Cuban people want freedom, and the Cuban people want freedom now. We will not go away. You know, time is not going to diminish our wants, our desire to see a free Cuba. That's what I want to see. I know that that's all my compatriots down in South Florida, all the Cuban Americans that are all over this country, all over the world, they want to see a free Cuba. And again, President Diaz-Canel, and I'm sorry I have to call you president because you're not, you're just a crook, all right? Please just leave. If you leave, everything will be fine in Cuba. And by the way, a lot of things will be much better in Central and South America too. All right? So thank you all. God bless you. Unas palabras en español. Simplemente lo que quiere el pueblo cubano es la libertad. No es comida, no es remesas, no son vacunas, es la libertad. Y es muy simple, es muy simple. La cosa que tiene que hacer Diaz-Canel es que se tiene que ir. Y si se va, todos los problemas del pueblo cubano se van a resolver. ¿Okay? Y con eso, muchas gracias a todos, que Dios los bendiga y que viva Cuba libre.
Up next, Congresswoman Nicole Maliotakis. Come on up from New Jersey. New York.
How's everyone doing? I'm Congresswoman Nicole Maliotakis. I am from the state of New York, and I'm a freshman member, and my mom is also a Cuban refugee. She came to this country in 1959 to escape the Castro regime. She loves this country. She is so patriotic about the United States of America, and she wants to preserve our freedoms and liberties, as do I, and I know as you do as well. I will say that it's important for all Americans to care about what's going on in Cuba. Because what's happening in Cuba is something that is spreading throughout Western Hemisphere. And that is socialism and communism, and even here in the United States, we see individuals who want to move us towards socialism and communism, and we cannot never allow them to take our freedoms, our liberties, or control. I'm from New York City. I'm telling you firsthand. When we had protests in the streets last summer, I saw the communist hammer and sickle spray painted on our government buildings, and there is this Marxist movement. So what's happening in Cuba is directly related to the people who are freedom-loving Americans here in the United States. And as Carlos said, it's gone to Venezuela, Nicaragua, Bolivia. Venezuela, the richest country in South America, destroyed and propped by the Castro regime. And who is siding with the communist dictators? Our adversaries, okay? North Korea, Iran, China, Russia. That's who's propping up the regime in communist Cuba and allowing people to continue to lose their human rights, being beaten and jailed, killed if they just speak out against their government because they want freedom. They want what we have here in the United States of America. So my question for President Biden is, are you with the dictators of Cuba, Venezuela, Iran, North Korea, China? Or are you with the American people who want freedom and the Cuban people who are dying for freedom literally as we speak? Thank you and God bless America. Viva Cuba Libre, estamos contigo. Espero que van a tener libertad muy pronto.
Thank you, Congresswoman. Now I'd like to bring up Marta Beatriz Ferrer. She'll tell her story and the story of her father.
Bueno, muchísimas gracias a todos por estar aquí y gracias por la invitación. Mi nombre es Marta Ferrer, soy la hija de José Daniel Ferrer. Mi padre hoy lleva 17 días desaparecido, él y cientos de cubanos que salieron a exigir la libertad de Cuba y el fin de la tiranía en Cuba. Hoy no sabemos
to support the Cuban people and finally bring an end to the decades-long regime of Castro. So the question is, where's Joe? That's a good question. And I must tell you, too, I'm a former professional baseball player with the Atlanta Braves. And I got to tell you all something. We need some home run hitters. So we are not going to rest until the Cuban people are liberated from their government. And I appreciate my colleagues here today who are joining on this fight and demonstrating our support for the Cuban people. So may God bless America, and may God bless Cuba. Thank you.
Congressman Williams isn't even sweating. I don't know how that's possible. Baseball training. Have you guys ever heard of this great crusader for freedom, Gordon Chang, a wonderful board member of CPAC, and his hard-charging, freedom-loving wife, Lydia? Will Gordon and Lydia please come up to the stage?
Today we stand on the grounds of the Capitol, the heart of the greatest nation in the world. We stand with people who are fighting for their dignity, for their freedom, and for their lives. The oppressors of Cuba are especially arrogant because they know that China stands behind them. China's giving them money, giving them technology, giving them propaganda. Right now, there's a big struggle in the world. Dictatorships versus democracy. And democracies are under fierce attack. But sometimes as bleak as it appears, there's hope. There's hope because the people of Cuba are taking to the streets. The people of Cuba are sending a message, not just to the people in Havana, but also to the people of China. And that's why Beijing knows that everything is at stake. Unfortunately, there's an occupant of the White House who is not standing with the Cuban people. So it is up to us, you and me, to say to Havana, no more. It is up to us to say to Beijing, no more. Let me hear you say it. No more. No more. No more. More. The people in Cuba, they know what America stands for. When they take to the streets, they fly our flag. Our flag stands for freedom. Fly it, honor it, defend it. Cuba will be free.
Do we need internet service back in Cuba? Do people need to be able to communicate with each other? We have a great member of the Federal Communications Commission here, a Trump appointee, Brendan Carr. Would you come up and talk to us about how we solve the technology problem?
Good to see you all. This is a moment in history that we simply cannot let pass. 2 weeks ago, the great people of Cuba took to the streets to fight for their God-given right to liberty. They have been stuck under the yoke of communism for 60 years, holding back their freedoms, their opportunity, their prosperity. The very first thing that people do when they take to the streets right now, they take out their smartphone. They take pictures. They take videos. They let the world see exactly what is going on inside that brutal dictatorship. And what's the very first thing that brutal dictators around the world do as soon as people start to see what's taking place inside their regime? They shut down connectivity. They block access to the internet because the thing that they hate the most is the spotlight of the world seeing what they're doing. Because that attention, that spotlight, will change the arc of history in any brutal regime. They're all going to end eventually. People are going to be free eventually. But with the spotlight and the power of internet connectivity, it will accelerate the day that that freedom finally comes. We see it in Venezuela, Iran, Myanmar, and we're seeing it right now in Cuba with the digital fingerprints of the communist regime of China backing up their censorship efforts. The U.S. invented the internet. It's the greatest driver for freedom and opportunity history has ever known. Just 90 miles from U.S. shores, we have the technological capability to support internet connectivity for the people of Cuba. We can stand with them. We can beam in new internet services from off-island. We can support circumvention tools that allow the people of Cuba to get around the blocking and the filtering of the internet connections that exist right there. We've done this before around the globe. This is not a technological challenge. This is a political challenge. Will the Biden administration stand for freedom and stand with the people of Cuba and give the green light so that American enterprise can get around the internet blockade, deliver internet services to the people of Cuba, and help them right now in their time of need? That's the question, and it's simply a matter of political will. It's been 2 weeks, and I hope we get there. Thanks.
All right, we have some other great members. Mark Green, come on up. Come on up. Your colleagues from Congress, come up. Stand up here. And we're going to... We want to thank all of you for what you're doing to keep the pressure on the regime. And Congressman Green, why don't you get started?
Thanks, Matt. Who here loves freedom? Let me hear you if you love freedom. In the heart of every American, and in the heart of every Cuban, in the heart of every human being is a desire, a yearning for freedom. It is awe-inspiring to see the thousands of people in the streets in Cuba risking their very lives to fight for freedom, just as so many Americans have done so for decades. There is light at the end of the tunnel, though, for the Cuban people. They have never been closer as long as we stand with them. And what would a free Cuba look like? When people of faith are no longer afraid of harassment from a communist regime, that is liberty. When artists can freely express their political opinions without harassment and jail time, that is liberty. When parents don't have to wait hours in line for rice and beans to feed their starving children, that is liberty. When the dying communist regime breathes its last breath, that is liberty for the Cuban people. My fellow citizens, to Americans out there, it is our duty. We have a duty to help our neighbors. Our honor is at stake. It is our country that must come to their aid. Duty,
honor, country, 3 words that frame our freedom, gives hope to the people of Cuba. God bless this great country, and God bless the Cuban people.
Amen. Good job, Doc.
Thank you. Thank you to all of you. You know, I'm Maria Salazar. I represent the city of Miami, the heart of the Cuban exile community. I thank all of you. If you come from my district, I thank my fellow congressmen and congresswomen who have been here with all of you. And this is a fight that we will win. And I'm going to repeat the same thing that I have said over and over again, which has been echoed by my friends here, my colleagues in Congress. We need 2 things. We need leadership from the Biden administration, and we need connectivity. Cuba needs internet. And why? This doesn't cost anything. Leadership and connectivity doesn't cost anything. Leadership is for the Biden administration to prove to the rest of the world that they can lead this charge and they can rally the international community around something that is decent, that is noble, that is correct, to help the Cuban people obtain their freedom. And number 2, connectivity, internet. And why this is so important? Because everything in July 11th started because someone in a remote town in Cuba was doing a Facebook Live. And then the rest of the island saw it, and then it spread like wildfire. The Cuban people need to communicate among themselves, A, and B, rally others to go into the streets. Let's help them have their future in their own hands. Let them decide if they want to go out on the street and be butchered and to be beaten and to be tortured. That's their decision. But we need to help them. And the Biden administration, as a commissioner for the FCC just said, only needs to say yes, give the green light to connectivity. We, the United States, we have the technology. All we need is the political willingness from the White House. And that's it. That doesn't cost money. That doesn't cost anything. That only costs. So I am once again sending a message to President Biden. In the name of God, the God that you believe in, we ask you to just say yes to that technology coming from the DOD, coming from the private sector. It doesn't matter. We just need the Cubans to know that they are not alone, that they can go out into the streets and the rest of the world will see how they're being butchered. But it doesn't matter. It's their decision. We only need to support them, and they will write their own history. So it's in Biden's hand. And we thank you if you do it, because history will reward you. We do not want this to be another Bay of Pigs. This Democratic administration has the possibility of redressing that horrible moment in history by now giving the Cubans what they want, which is what they wanted, freedom. Thank you.
Oh, my name is Alex. That's right. That's right. Well, my name is Alex Mooney. I represent West Virginia's 2nd District. My mother, Lala Suarez, came from Cuba when she was 20 years old. Mom's sitting over there right now, joining us in this rally. She did spend 7 weeks in prison, in a communist prison in 1961. So, as you know, I'm not going to repeat what my colleagues have said. Obviously, freedom is important. What many people don't realize in this country and around the world is that we have freedoms that they don't enjoy in these communist countries. The freedom right here to have a rally, the freedom to protest, freedom of speech, even the freedom to vote with more than one candidate who doesn't get 100% of the vote. They don't enjoy those freedoms in Cuba. Right now, these brave people who have protested in Cuba have been generally arrested and put in jail for a year, and then when Cuba hopes the world's not looking, they'll add another 5 years to the prison sentence. So we are watching, and we need to do everything within our power here. I agree with a lot of Biden's words, but what we need to see from President Biden is some really concrete actions to help the people of Cuba become free. So with that, God bless you for coming, and let's keep this fight up.
You know, thanks, Matt. My name is Pat Fallon. I represent the 4th District of Texas. And I grew up in the People's Republic of Massachusetts. I sought political asylum in the Lone Star State. So you may ask yourself, and it's a fair question, a lot of people up here either represent Miami or have Cuban ancestry. So what does this Irish, Italian, conservative who grew up in Massachusetts, now represents Texas, here right now, because I speak freedom. Because freedom is a concept that is universal. Because it's a gift from God, the Almighty, life. It's a gift not to a government, not to a group or any other person. It's a gift that the Almighty gave to you and to great Americans like Mercedes and Matt Slapp, who organize this, who are literally doing God's work here on earth. Free will. 11 million souls for 62 years have been denied free will and choice. If you look that way, about 7,920 feet, that's where Joe Biden lives right now. And there's words and there's no actions. The Cuban regime is evil, it's corrupt, and it's oppressive. And we know this, and it's time for change. Many of us were alive and remember when the Berlin Wall fell. We need to get rid of the last vestiges of tyranny and bondage in this hemisphere while we still have air in our lungs. And the way to do that is together. As my mother used to say, Italian mother, insieme. Together, we can do this. So we all here stand with the Cuban people. We stand for freedom, we stand for justice, and we stand for their free lives so they can enjoy what we do. Life, liberty, and the pursuit of happiness. Cuba Libre!
We're wrapping up very soon, and you all have been incredible to stay here with us. I know it's muy caliente aquí in Washington, but I have some dynamic leaders, young leaders, who have helped put this whole event together. Let me bring onto the stage Santiago Avila, Abraham Enriquez, Morgan Zegers, and John Pence.
Ladies and gentlemen, if you love freedom and liberty, let me hear you. It is great to be here. When we started Bienvenido 2 years ago, I could not imagine us joining forces with such a powerful organization like CPAC and conservative leaders to stand united for Patria y Libertad and demanding that we see a Cuba libre. Listen, everyone, at Bienvenido, we are the home of the young Hispanic voices and young Hispanics in general all over the country. For 60 years, Cuba has been under brutal dictatorship. Communism has killed Cuba's economy, and it has stripped the individual's personal liberties. So here, we are here to demand the Biden administration understands and sees what is going on. Women are crying out in the streets, not understanding when their child are going to be let out of prison simply for demanding and taking to the streets for freedom. It's unfortunate that Biden took 12 days to announce our unity for the people of Cuba. And today we're demanding and we're asking that America shows our unity towards our brothers and sisters in Cuba, because without Cuba, the American dream can not prosper correctly. We stand with our Cuban brothers and sisters, and we want to see a Cuba libre. I want to thank you for coming out today, and I appreciate all the support. Let's continue fighting.
All right, I'm a little short, but hi, you guys. My name's Morgan Zegers. I run a nonprofit called Young Americans Against Socialism. What we do is we interview survivors from socialist countries, because right now 70% of young Americans would vote for a socialist. Do you ever wonder why that is? Probably because when we are in history class in America, young people learn about Stalin and Lenin and Castro and Maduro, but we just learn that they're bad guys and that they got too much power and people suffered because of it. We do not learn that they came to power like Castro did, calling themselves democratic humanitarians and democratic socialists and promising justice and progress. So when we hear in America from AOC and the Squad the same false promises that every socialist says throughout history, What do you know? No red flags go off in young people's minds in America because they cannot connect the dots. I have two asks. Go to fightsocialism.org if you're a survivor and want to tell your story to help young people learn. Second, stop relying on the government schools to teach your kids about government being bad. Stop relying on government schools to teach your kids about history and economics. Do it yourself. If you see a broken family and kids that need learning, take them on as a role model. I really appreciate you guys giving me the time. Thank you so much. We will keep fighting those commies, and we'll stand with Cuba. Thank you.
¿A dónde está mi gente cubana? My name is Santiago Avila. I'm with the Republican National Hispanic Assembly. I'm here to tell you a very, very super quick story. You see, my grandfather was a political prisoner in Cuba for over 10 years. The people in Cuba right now are not asking for COVID vaccines. They're not asking for a lot of things. They're asking for one simple thing: freedom. They're asking for freedom. You see, my grandfather traveled the seas through El Mariel when Fidel thought that it was okay to just release all these prisoners. And he traveled with 3 young kids, one of them being my mother, and his wife, through treacherous waters. You don't do that because America is a racist country. You don't do that because, oh my God, you know, people in America are woke. America is that light, that shining city on a hill that Ronald Reagan spoke about. And for the people that keep saying, well, we got to do this America first is about being that shining city on a hill. I want to ask you really quick, how many of you here were born in America? Raise your hand for me, please. You see, how many of you here have descendants that were born in Cuba? Raise your hand, please. You see, there's a story behind that. There's a story behind that, and I want to ask you this question because I think this is the most important question you have to ask yourself. If the United States falls to the likes of AOC, Bernie Sanders, and all these people, because let me tell you something, freedom is not about a Republican or Democrat issue. Freedom is freedom, and that's it. Where do other people, not only from Cuba, but from Venezuela, from Ecuador, from Nicaragua, where do they go if there is no America? We are the last stand on this planet. And it takes people like you right here to help us fight. And I will end it with this. My grandfather, I lost him about 2.5 years ago to cancer. But I learned a very important lesson from him. You see, my grandfather was born an enslaved man who was given rights by his government. He taught me that the United States of America is so special because our rights are granted by our Creator. We're endowed with certain unalienable rights amongst these are life, liberty, and the pursuit of happiness. Meaning that the government didn't give us these rights. Help us fight. Help us send a message to Joe Biden that we need the people of Cuba to have internet so they can continue to communicate, so there can pretty soon be a free Cuba. Patria y vida.
Well, thank you everyone for coming out. We need to remind President Biden that este Partido Republicano es el Partido de la Libertad. Why are we the party of freedom? Because we stand for the first of our freedoms, freedom of religion. We stand for freedom
twice impeached
of speech, the right
President.
to peacefully assemble, freedom for the unborn, freedom of commerce, of free, fair, and reciprocal trade. But remember, we always stand for freedom at home and abroad. We stand with those who are fighting for patria y vida, not patria y muerte. We stand for those who are fighting for their freedoms, their God-given rights. Thank you all. Thank you to the Schlapp family for bringing this together. Let's remember, vamos por la libertad juntos en el porvenir. Thank you, everyone.
Libertad! 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 This fight has only begun. We got to keep talking about it. We got to keep putting pressure on Joe Biden and these Democrats. Let's pray for a free Cuba. Cuba Libre! God bless you all and God bless America. Thank you for joining us.
So that was a shot earlier today outside of the Capitol there, speaking about those Cuba protests and the freedom that Cubans are crying out for at this moment in time. Speaking of the Capitol, more news to come after the break as we are talking about that January 6th committee hearing today. We'll hear from House Democrats ahead of the hearing. We're also going to give you the details on what happened today at the hearing itself, and also some reaction from lawmakers on Capitol Hill. A lot more to get to here on Live Now. See you back in 2 minutes. Welcome back here live to Live Now from Fox. Live look from the Capitol right there as we are heading into the nighttime hours, although it is just 5:30 here in Phoenix, Arizona, so we have a lot more coverage we want to bring to you. House Democrats kicked off their first hearing today as part of their probe into the January 6th Capitol riot with 4 law enforcement officers, including 2 Capitol police officers testifying about their experiences. That wasn't without, of course, a briefing from House Democrats ahead of the big day. So we want to play some of that out for you, and then we'll go out to the hearing itself as we brought it to you as it was happening earlier today.
Twice impeached President of the United States, Donald Trump, who incited that riot, urged people to march on the Capitol, whipped them up by perpetrating the big lie, which, by the way, he still hasn't walked away from. And the notion that Speaker Pelosi is concerned about what a few crackpots might have endeavored to contribute to the seriousness of the inquiry because she's concerned about what it may reveal about herself is ludicrous. It makes no sense. Those rioters, those protesters were there in part to assassinate Nancy Pelosi. What does Kevin McCarthy not get about that? And so, you know, it's a diversion, it's a distraction. They don't want to talk about what happened on January 6th, but America saw what happened on January 6th, and we're going to get to the bottom of the facts as it relates to everything that unfolded that day, unfolded prior to January 6th, and those who continue to perpetrate the big lie as well, which is bad for our democracy. Heather?
Hello. So on the 5th negotiations, the White House has told Democrats privately they don't want to go to conference. I know some of your members feel very strongly about that. But it seems like if they come to an agreement over on the Senate side, you guys are just going to have to accept and pass whatever they pull together over here? Are you prepared to do that, and are you okay with that?
Well, first of all, let's see what is actually negotiated in terms of the bipartisan agreement. Nothing is agreed upon until everything is agreed upon in both the House and in the Senate. So it's impossible for us to take a position until we have some clarity as it relates to what that bipartisan group of senators intend to do in terms of investing in our crumbling infrastructure. And it is crumbling, and we do need to invest in our bridges, our roads, our tunnels, our airports, our mass transit system. I think we need to do it in a green and a sustainable and a resilient way. I think we need to invest in access to broadband so that there's universal access in this country, in the inner city, in rural America, in small town America, in Appalachia. I think we need to invest in the creation and preservation of affordable housing. And we've got some ideas as to how to do that in the House. We'll see what comes out of the Senate. And so we anxiously await the results of the bipartisan negotiations. But I think our posture is always on any piece of legislation that nothing is agreed upon until everything is agreed upon. I'll go to this side? No? Okay. Sir?
Chairman Jeffries, what do you expect to hear from Capitol Police officers and from people in the beginning of the committee hearings today? And what are your expectations for how Democrats can work with Republicans on the January 6th hearing?
Well, it's very important to begin with the police officers who are on the front lines defending our democracy at great risk to themselves in terms of loss of life and serious bodily injury. And by the way, more than 140 police officers were seriously injured on January 6th, fighting to defend us. And I think it was important to respect that struggle and that sacrifice by hearing from them first. And I expect the testimony is going to be powerful and personal and gripping for the American people. And I think for many members who will live through that day once again as the police officers tell the story of January 6th.
Mr. Chairman, do you have any concerns that the way that Republicans are, making accusations that this committee's work is going to be politicized? Do you have any worries that that's going to affect the way that the American people view it? And do you think the Speaker will add any more Republicans to the committee?
Well, take the second part of your question first. I do think that the Speaker promised that there would be a bipartisan committee, and she's delivered on the fact that there is a bipartisan committee. That is going to undertake its work in a nonpartisan fashion, which is what is appropriate, because the January 6th insurrection wasn't an attack on Democrats alone or Republicans alone. They wanted to assassinate Nancy Pelosi and hang Mike Pence. It was an attack on the entire Capitol, the Constitution, the Congress, and the country. That's why it's important that the committee proceed in a thoughtful and solemn and sober way, and that's what I expect to see, led by Chairman Benny Thompson and Ranking Member Liz Cheney.
Since the Senate is so behind schedule, is the House going to depart as scheduled for its August recess? Do you envision you guys needing to come back in August to do the budget resolution, or can that wait until you guys are back in December?
Well, I think we're planning to proceed throughout the week, take care of the appropriations bills that are going to be before the House over the next few days, and we'll see what comes out of the Senate. The schedule will ultimately be determined by Speaker Pelosi and Majority Leader Hoyer. Majority Leader Hoyer this morning indicated that basically things remain fluid. The most important fact, however, that will determine the schedule is that we remain committed to building back better to making sure the American Jobs Plan and the American Families Plan put forth by President Joe Biden get over the finish line sooner rather than later, because every day Americans need the help. This is a deadly pandemic that was both a public health crisis and an economic crisis, and there's a lot of pain and suffering and death that the American people have experienced. President Biden has done a tremendous job over the first 6.5 months or so. 3 million plus jobs have been created. That's a record in the first 200 or so days of any American presidency, but there's a lot more work that needs to be done. And we're going to be here as long as it takes to get that work done, even if that means extending into the August district work period or coming back at some point next month. Final question?
Back to the committee, what role do you see Representatives Cheney and Kinzinger ultimately playing in this investigation? And do you think that with their names on the report, is that going to be enough for some people who are skeptical that, you know, this is going to be a bipartisan endeavor and have an air of legitimacy?
Well, you know, it's important for all of us to make a decision as to whether we're going to stand on the side of the rule of law or stand on the side of the big lie. Are we going to stand on the side of the Constitution, or are we going to stand on the side of crackpot conspiracy theories? Are we going to stand on the side of democracy, or are we going to stand on the side of autocracy? And Liz Cheney and Adam Kinzinger have clearly made the choice that they're going to stand on the side of the rule of law, the Constitution, and democracy. And they should be commended for that. And they're leading by example. And hopefully other Republicans within the Congress will join them. The American people saw what happened on January 6th. They know who incited that insurrection. But just like in the aftermath of Pearl Harbor, an attack on the country, and in the aftermath of September 11th, an attack on the country, there has to be an inquiry that undertakes in a comprehensive fashion an examination of what happened, how do we prevent it from happening again, and tells the full story to the American people. And I'm confident that the Democrats who are on the committee, led by Chairman Thompson, and the Republicans who are on the committee are going to do just that, as great Americans should. Thank you.
So what do you think it says about the Republican Party that faced with such a stark choice, only 2 of their members were willing to join the committee?
Speaks for itself.
What does that
Thank
mean?
you, everyone.
What does that
Thank
mean?
you, everyone.
So there we just heard from Democratic Congressman Hakeem Jeffries talking ahead of the hearing today, the House Select Committee hearing on the January 6th riot. It had its first hearing today. We're going to give you kind of a recap and a summary from one of our correspondents, and then we're going to show you highlights from it today in case you might have missed it. It lasted 3.5 hours. It was very emotionally gripping. Several of the Capitol police officers testified about their experiences that day. And so you also saw lawmakers on the panel itself, Liz Cheney, Adam Kinzinger, some of the other Democrats as well, really getting upset about having to relive January 6th all over again. And so we want to show you, this is for more than 3 hours today, police officers testified, the same complex that they helped defend more than 6 months ago. It was an emotional hearing. Several shared that they are still recovering from their injuries, and others recalled the emotional trauma that they still endure. But some Republicans say the panel is not truly bipartisan, given Speaker Pelosi rejected 2 of the 5 Republicans that House Minority Leader Kevin McCarthy had tapped for the panel. Fox News correspondent Lauren Blanchard has this story from Washington.
To hell and back to protect them and the people in this room. But too many are now telling me that hell doesn't exist, or that hell actually wasn't that bad.
Officer Michael Fanon was beaten unconscious during the Capitol attack.
The indifference shown to my colleagues is disgraceful.
4 officers testifying in the first hearing of the House January 6th Select Committee.
You guys won. You guys held.
The men detailing what they went through that day.
If that turned into a firefight, we would have lost. And this was a fight we couldn't afford to lose.
Clearly still angry today, especially toward lawmakers who have since downplayed the violence.
The same people who we helped, the same people who we gave them the borrowed time to get to safety, now they're attacking us.
I need you guys to address if anyone in power had a role in this.
Across town in D.C., a handful of Republican lawmakers speaking outside the Justice Department. They want answers on the treatment of incarcerated insurrectionists.
Due process must be afforded to all Americans, period.
Minority Leader Kevin McCarthy pulled his nominations for the committee, calling the panel partisan. Currently, it's made up of 7 Democrats and 2 Republicans appointed by Speaker Nancy Pelosi.
Why is telling the truth hard? I guess in this America, it is.
The officer said they want the lawmakers to improve safety at the Capitol, saying when the fencing came down earlier this month, they lost a layer of protection. In Washington, Lauren Blanchard, Fox News.
And Lauren, thank you so much for that update there. Like I said, we're going to just take a very quick 2-minute commercial break. When we come back, though, we'll be showing highlights from the hearing itself and then showing you a little bit longer portions of it later tonight. This was a huge story today, and we want to make sure, just in case you might have missed it, that you get to see some of this testimony. So I'm Andrew Kraft. We'll see you back after the break. And welcome back here to Live Now from Fox. I'm Andrew Kraft. We do want to play out just some highlights from today at the House Select Committee hearing on the January 6th Capitol riot. We'll be hearing from Capitol Police Officer Michael Fanon, as well as Republican Congressman Adam Kinzinger. Kinzinger got visibly emotional, kind of recounting his experience that day, along as showing gratitude to the Capitol Police officers who held the Capitol, defended it that day. So let's play out that conversation right now.
Gentleman from Illinois, Mr. Kinzinger, or however long he chooses.
Thank you, Mr. Chairman, and thank you to my colleagues on the committee. Thank you to our witnesses. I never expected today to be quite as emotional for me as it has been. I've talked to a number of you and gotten to know you. I think it's important to tell you right now, though, you guys may individually feel a little broken. You guys all talk about the effects you have to deal with, and You know, you talk about the impact of that day. But you guys won. You guys held. You know, democracies are not defined by our bad days. We're defined by how we come back from bad days, how we take accountability for that. And for all the overheated rhetoric surrounding this committee, our mission is very simple. It's to find the truth, and it's to ensure accountability. Like most Americans, I'm frustrated that 6 months after a deadly insurrection breached the United States Capitol for several hours on live television, we still don't know exactly what happened. Why? Because many in my party have treated this as just another partisan fight. It's toxic, and it's a disservice to the officers and their families, to the staff and the employees on the Capitol complex, to the American people who deserve the truth, and to those generations before us who went to war to defend self-governance, because self-governance is at stake. And it's why I agreed to serve on this committee. I want to know what happened that day, but more importantly, I want all Americans to be able to trust the work this committee does and get the facts out there free of conspiracy. This cannot continue to be a partisan fight. I'm a Republican, I'm a conservative. But in order to heal from the damage caused that day, we need to call out the facts. It's time to stop the outrage and the conspiracies that fuel the violence and division in this country. And most importantly, we need to reject those that promote it. As a country, it's time to learn from our past mistakes, rebuild stronger so this never happens again, and then we can move onward. And serving on this committee, I'm here to investigate January 6th, not in spite of my membership in the Republican Party, but because of it. Not to win a political fight, but to learn the facts and defend our democracy. Here's what we know. Congress was not prepared on January 6th. We weren't prepared because we never imagined that this could happen. An attack by our own people, fostered and encouraged by those granted power through the very system they sought to overturn. That is a lesson. That is not a conspiracy theory or a counter-narrative. We don't blame victims. We go after the criminals. Some have concocted a counter-narrative to discredit this process on the grounds that we didn't launch a similar investigation into the urban riots and looting last summer. Mr. Chairman, I was called on to serve during the summer riots as an Air National Guardsman. I condemn those riots and the destruction of property that resulted. But not once did I ever feel that the future of self-governance was threatened like I did on January 6th. There is a difference between breaking the law and rejecting the rule of law, between a crime, even grave crimes, and a coup. As we begin our work today, I want to call this committee's attention to the oath of office, an oath not to a party, not to an individual, but to the Constitution that represents all Americans. Everyone in elected office knows how hard it can be sometimes to keep that oath, to preserve, protect, and defend the Constitution of the United States in the forefront of our minds, what with the political pressures and re-elections always around the corner. But Mr. Chairman, our witnesses today, like every law enforcement officer across the country, took the same oath we did. And on January 6th, the temptation to compromise their oaths didn't come in the form of a campaign check or a threat from leadership or an all-caps tweet. It came in the form of a violent mob. While we on this dais were whisked away from the danger, heroes like those here stood their post before it and paid the price. And we are only here now because you guys were here then. Therefore, it's altogether fitting that we begin our investigation of January's lawless attack against the Constitution with these four men who made sure that the attack did not succeed, with those who helped to ensure that democracy held. And I think it's important to remember that you are four with stories, but there are hundreds with stories as well that you represent where you sit. Officer Fanon, I know your passion is to make sure that DC Metro gets the credit it's due. And I thank you for I know that you represent the hundreds of officers like Officer Hodges, that responded to that call. What I want to ask, does this feel like old history to any of the four of you? Sometimes I get, we hear out there, it's time to move on, right? It's been 6 whole months, time to move on. Does this feel like old history and time to move on? You can just say yes or no.
No, sir.
Nope.
There can be no moving on without accountability. There can be no healing until we make sure this can't happen again.
I echo that. How do you move on without correcting what happened?
Let me ask you all, one of the narratives out there, and Officer Fanon, it triggered something in your testimony when you said it. So there's been this idea that this was not an armed insurrection, and as if somehow that is justification for what happened. We know the hugs and kisses. We know it was BLM and Antifa, right? Of course, then you would, I'm sure, want to investigate that if that's the case. Now we've heard, it was BLM and Antifa, right? Of course, then you would, I'm sure, want to investigate that if that's the case. Now we've heard maybe the FBI actually started this, but one of the ones that has always held was that this was not an armed insurrection. Officer Dunn, you mentioned that those that stormed the Capitol were very well organized and trained, and let me ask you, and I'll ask actually to all four of you, and Officer Hodges, I know this was part of your job initially before you responded to the Capitol. If in the middle of all that melee, you see somebody with a gun in that crowd, would you be able to go out, apprehend, arrest them, read them their rights, and go through that process? Or was the mission at the moment survival and defense of the Capitol? So I'm asking, is it possible that people maybe had guns, and we've seen that actually there were, but this idea that, well, people weren't arrested with guns, at the time it was raw survival. I'll start with, we can just start on the left. Let me ask you, what's your response to that?
For those people who continue to downplay this violent attack on our democracy and our officers, I suggest them to look at the videos and the footage for now, because common things were used as weapons, like a baseball bat, a hockey stick, a rebar, a flagpole, including the American flag, pepper spray, bear spray. So you name it. You have all these items and things that were thrown at us and used to attack us. Those are weapons. No matter if it is a pen, the way they were using these items, it was to hurt officers. It was to hurt police officers. Their intent was not to say, hey, let me go and find the Republicans or the Democrats in there or the independents. It was every single body that was here in this building, in the Capitol, that their intent was to get them out and hurt them. It would have been a much different outcome had we not stopped them, especially at the lower West Terrace entrance. Even though at that time, we didn't know that that there were other breaches in the Capitol. Our intent was to stop whoever was trying to come in through that door. And those weapons that were used, those were common items. The way they were using it was as weapons.
Let me ask too, in kind of my final moments. Sergeant Cannell, Officer Hodges, you were Virginia Guardsman, I believe, fellow Guardsman?
Yes, sir.
At any time in your service in the military, as you know, I'm an Air Guardsman. And Sergeant Cannell, you specifically mentioned your time in Iraq. At any time in your military service, did you change how you defended the person to your left or right, or how you trained with them based on their political affiliation?
No,
whether it was in war or anything?
No.
No, sir. The way I view it at that time, it was, I'm an American, and the person right next to me is an American, and I would do everything possibly for me to defend him and the country at that time.
You guys did that? You guys did that in the blue?
Yes, sir.
And I want to say that is the mission of this committee. We may have our deep differences on other policy issues, but we are all Americans today. And we thank you for holding that line.
Congressman, if I may respond to Congressman, when you asked about the armed part, when the assumed officers showed me their what appeared to be a police badge, I don't know too many police officers, and this is just me being a police officer for 13 years, that carry their badge and don't carry a gun with them. So we look on their hips, you see a print. I didn't see that it was a gun, but a reasonable police officer will believe that that's a gun on their hip. So.
And just to quickly be specific, a print is basically what looks like the outline of a gun.
That's correct.
All right, we're just going to move away from this at the moment here because we do have some breaking news out of San Jose, California. We're going to come back, though, to get more highlights from that hearing earlier today. But let's go out there as a brush fire at the moment. We want to just show you some of these live pictures that we have. You can see there, we're getting this. This is from our chopper there on the ground, or excuse me, in the air. So we are just monitoring this scene while they're off the fire at the moment, but hopefully they do go back. We apologize, it went to black there. Wildfire season is quite out of control this year, and you can see there the extent of the smoke. So we just got this live picture into us right now at the moment, and we wanted to take it right away, but you can see the smoke is just really rising high over San Jose, California at the moment. It's almost 6 p.m. here on the West Coast, and so we're working to get more details on this particular fire. This is known as a vegetation fire or brush fire. It was reported just after 4 p.m. today, and so this is coming to us from one of our affiliates in the area. San Jose Fire Department, though, said no structures are threatened at this time, and there are no reports of any injuries. But you can see, though, this could be quite startling for some residents in the area who are seeing these images on their commute home from work and the like. Emergency responders are on the scene as well. Firefighters from San Jose and Milpitas are battling flames on its side. San Jose residents apparently who live near a particular street called Mill River Lane are advised to shelter in place and close all doors and windows to prevent smoke from entering their homes. But no evacuation orders have been issued. That's just the guidance right now to those residents who might live in this area. So this right now is burning approximately 50 to 75 acres. You can see some of the flames right there. Most of this is just smoke rising up above this vegetation fire, but when they zoomed in there, you could see some of the flames. And you can see also some of these fire trucks on the ground there trying to respond to this. Apparently, we're learning, though, that no structures are threatened by this. That's what official sources are saying, but you can see it's quite close to some of those structures in view. We're watching this live, so. It remains to be seen on if this is a large enough blaze that, requires some type of, update on camera from fire officials on the ground. It doesn't look to be the case so far. No evacuation orders in place, but just got these live pictures in. It's almost 6 o'clock on the dot here on the West Coast. And this relatively small brush fire is burning at this hour, 50 to about 75 acres approximately are impacted and have burned so far. It has been a very dangerous, very active wildfire season. Also, from those that we've talked to here, experts on Live Now from Fox, started much earlier than usual. Not only there in Northern California, but also Oregon, the bootleg fire, Washington State, and Arizona here this season. I believe the 5th most active and largest fire season so far already. So at the moment, let's go out to the Bay Area because they are also watching this. Let's hear from them and see if they have any more details to show.
That firefighters are beginning to get a handle on that fire. Good evening, everyone. I'm Alex Savage, in tonight for Frank Somerville.
And I'm Julie Hayner. It was first reported just after 4 o'clock this afternoon in the Coyote Creek riverbed near Mill River Lane. Here's some video now of the flames and smoke in that area. San Jose firefighters say so far this fire is burning in an area of vegetation measuring between 50 and 75 acres. The brush fire jumped the Coyote Creek from Milpitas into San Jose. Authorities are now asking people who live in that area to shelter in place. No evacuation orders have been issued. This is pretty much an industrial area, and there doesn't appear to be any homes in the path of this fire. Again, we have been watching the fire since it broke out around 4 this afternoon. And again, as Alex mentioned, crews appear to be getting a good handle on this fire, making a lot of progress. We are working to bring you a live report coming up in just a little bit later on in this newscast.
All right, now to Danville, and a 2-alarm fire damaged a home and burned vegetation before crews were able to get the upper hand on it. The San Ramon Valley Fire Protection District responded around 1:50 this afternoon to reports of flames in a yard at a home on Valley Vista Drive. Skyfox flew above the neighborhood, and you can see the charred hillside there. There were no injuries reported with this fire, and the cause is being investigated.
In Rohnert Park, investigators have exhausted all leads into a trash.
All right, so we just wanted to show you the top of their 6 p.m. newscast in the Bay Area. That's Fox 2 KTVU, our affiliate up there in Northern California, with an update on that brush fire in San Jose at the moment. We have more pictures to show you. There it is from a kind of higher vantage point, about 50 to 75 acres, burning at this hour. No evacuation orders in place. But we do want to get into some of these other stories as well here on Live Now from Fox on your Tuesday night. Thanks for being with us. Let's go back, though, out to Washington. We're just showing you a couple of highlights from that hearing today on the January 6th insurrection. And so we've been showing you testimony from several of the Capitol police officers who were there that day, who defended the Capitol, recounting and reliving the horrors that they experienced. So let's listen into one more.
His testimony.
Thank you, Mr. Chairman, and members of this committee, for inviting me to provide my eyewitness testimony of the violent assault on our nation's Capitol on January 6, 2021. My name, for those of you who don't know, is Michael Fanon. And while I've been a sworn officer with the Metropolitan Police Department in Washington, D.C. for almost 2 decades, my law enforcement career actually began here in this building as a United States Capitol Police officer shortly after 9/11. In part because of the 2001 attack on our country by terrorists, I felt called to serve. As a Capitol Police officer, I was proud to protect this institution and dedicated members of Congress and their staff who work hard each day to uphold our American democracy. I remain proud of the work of the United States Capitol Police and MPD officers who literally commit their lives to protecting the safety of each of you and all of us in this room in our nation's capital. After leaving the United States Capitol Police, I became an MPD officer serving the residents of Washington, D.C. I have spent the majority of my nearly 20 years as a Metropolitan Police officer working in special mission units whose responsibilities include the investigation and arrest of narcotics traffickers and violent criminals. I've worked both as an undercover officer and a lead case officer in many of these investigations. In this line of work, it probably won't shock you to know that I've dealt with some dicey situations. I thought I had seen it all, many times over. Yet what I witnessed and experienced on January 6, 2021 was unlike anything I had ever seen, anything I had ever experienced or could have imagined in my country. On that day, I participated in the defense of the United States Capitol from an armed mob of thousands determined to get inside, because I was among the vastly outnumbered group of law enforcement officers protecting the Capitol and the people inside it. I was grabbed, beaten, tased, all while being called a traitor to my country. I was at risk of being stripped of and killed with my own firearm, as I heard chants of kill him with his own gun. I could still hear those words in my head today. Although I regularly deal with risky situations on the job, nowhere in my wildest imagination did I ever expect to be in that situation or sitting here before you talking about it. That experience and its aftermath were something that not even my extensive law enforcement training could prepare me for. I was just one of hundreds of local police who lined up to protect Congress, even though I had not been assigned to do that. Some had asked why we ran to help when we didn't have to. I did that because I simply could not ignore what was happening. Like many other officers, I could not ignore the numerous calls for help coming from the Capitol complex. I'm a plainclothes officer assigned to the 1st District's crime suppression team. But for the first time in nearly a decade, I put on my uniform. When my partner, Jimmy Albright, and I arrived at the Capitol around 3 that afternoon, it was like it was unlike any scene I had ever witnessed. Jimmy parked our police vehicle near the intersection of South Capitol Street and D Street in Southeast, and we walked to the Capitol, from there passing the Longworth House Office building. It was eerily quiet, and the sidewalks, usually filled with pedestrians, were empty. As we made our way to Independence Avenue, I could see dozens of empty police vehicles that filled the street, police barricades which had been abandoned, and hundreds of angry protesters, many of whom taunted us as we walked towards the Capitol building. Jimmy and I immediately began to search for an area where we could be of most assistance. We made our way through a door on the south side of the Capitol, walking then to the crypt and finally down to the lower West Terrace tunnel. It was there that I observed a police commander struggling to breathe as he dealt with the effects of CS gas that lingered in the air. Then I watched him collect himself, straighten his cap and trench coat adorned with its silver eagles, and return to the line. That commander was Ramey Kyle of the Metropolitan Police Department, and those images are etched into my memory, never to be forgotten. In the midst of that intense and chaotic scene, Commander Kyle remained cool, calm, and collected as he gave commands to his officers. "Hold the line," he shouted over the roar. Of course, that day, the line was the seat of our American government. Despite the confusion and stress of the situation, observing Ray's leadership, protecting a place I cared so much about, was the most inspirational moment of my life. The bravery he and others showed that day are the best examples of duty, honor, and service. Each of us who carries a badge should bring those core values to our work every day. The fighting in the lower West Terrace tunnel was nothing short of brutal. Here I observed approximately 30 police officers standing shoulder to shoulder, maybe 4 or 5 abreast, using the weight of their bodies to hold back the onslaught of violent attackers. Many of these officers were injured, bleeding, and fatigued, but they continued to hold the line. As I don't have to tell the members in this room, the tunnel is a narrow and long hallway. It is not the sort of space anyone would want to be pulled into hand-to-hand combat with an angry mob. Although the narrowness of the hallway provided what was probably the only chance of holding back the crowd from entering your personal offices, the House, and Senate chambers. In an attempt to assist injured officers, Jimmy and I asked them if they needed a break. There were no volunteers. Selflessly, those officers only identified other colleagues who may be in need of assistance. The fighting dragged on. I eventually joined the tactical line at the tunnel's entrance. I can remember looking around and being shocked by the sheer number of people fighting us. As my police body-worn camera shows, thousands upon thousands of people seemingly determined to get past us by any means necessary. At some point during the fighting, I was dragged from the line of officers and into the crowd. I heard someone scream, "I got one!" As I was swarmed by a violent mob, they ripped off my badge. They grabbed and stripped me of my radio. They seized ammunition that was secured to my body. They began to beat me with their fists and with what felt like hard metal objects. At one point, I came face to face with an attacker who repeatedly lunged for me and attempted to remove my firearm. I heard chanting from some in the crowd, "Get his gun," and "Kill him with his own gun." I was aware enough to recognize I was at risk of being stripped of and killed with my own firearm. I was electrocuted again and again and again with a taser. I'm sure I was screaming, but I don't think I could even hear my own voice. My body camera captured the violence of the crowd directed toward me during those very frightening moments. It's an important part of the record for this committee's investigation and for the country's understanding of how I was assaulted and nearly killed as the mob attacked the Capitol that day. And I hope that everyone will be able to watch it. The portions of the video I've seen remain extremely painful for me to watch at times, but it is essential that everyone understands what really happened that tragic day. During those moments, I remember thinking there was a very good chance I would be torn apart or shot to death with my own weapon. I thought of my 4 daughters who might lose their dad. I remain grateful that no member of Congress had to go through the violent assault that I experienced that day. During the assault, I thought about using my firearm on my attackers, but I knew that if I did, I would be quickly overwhelmed. And that, in their minds, would provide them with the justification for killing me. So I instead decided to appeal to any humanity they might have. I said as loud as I could manage, "I've got kids." Thankfully, some in the crowd stepped in and assisted me. Those few individuals protected me from a crowd and inched me toward the Capitol until my fellow officers could rescue me. I was carried back inside. What happened afterwards is much less vivid. I had been beaten unconscious and remained so for more than 4 minutes. I know that Jimmy helped to evacuate me from the building and drove me to MedStar Washington Hospital Center, despite suffering significant injuries himself. At the hospital, doctors told me that I had suffered a heart attack, and I was later diagnosed with a concussion, a traumatic brain injury, and post-traumatic stress disorder. As my physical injuries gradually subsided and the adrenaline that had stayed with me for weeks waned, I've been left with the psychological trauma and the emotional anxiety of having survived such a horrific event. And my children continue to deal with the trauma of nearly losing their dad that day. What makes the struggle harder and more painful is to know so many of my fellow citizens including so many of the people I put my life at risk to defend, are downplaying or outright denying what happened. I feel like I went to hell and back to protect them and the people in this room. But too many are now telling me that hell doesn't exist, or that hell actually wasn't that bad. The indifference shown to my colleagues is disgraceful. My law enforcement career prepared me to cope with some of the aspects of this experience. Being an officer, you know your life is at risk whenever you walk out the door, even if you don't expect otherwise law-abiding citizens to take up arms against you. But nothing, truly nothing, has prepared me to address those elected members of our government who continue to deny the events of that day, and in doing so, betray their oath of office. Those very members whose lives, offices, staff members I was fighting so desperately to defend. I agreed to speak here today and have talked publicly about what happened, because I don't think our response to the insurrection should have anything to do with political parties. I know that what my partner Jimmy and I suited up for on January 6th didn't have anything to do with political parties or about politics or what political party any of you public servants belong to. I've worked in this city for 2 decades, and I've never cared about those things, no matter who was in office. All I've ever cared about is protecting you and the public, so you can do your job in service to this country and for those whom you represent. I appreciate your time and attention. I look forward to the committee's investigation, and I am hopeful with your commitment, we as a country will confront the truth of what happened on January 6th and do what is necessary to make sure this institution of our democracy never falls into the hands of a violent and angry mob. We must also recognize the officers who responded that day, many unsolicited, and their countless acts of bravery and selflessness. It has been 202 days since 850 MPD officers responded to the Capitol and helped stop a violent insurrection from taking over this Capitol complex, which almost certainly saved countless members of Congress and their staff from injury and possibly death. The time to fully recognize these officers is now. Thank you again for the opportunity to provide my testimony here today.
I now recognize Officer Fanon.
All right, we just wanted to keep showing you some of those highlights. Those were kind of 2 of the really, really viral moments that a lot of people are talking about. And so there you saw members on the panel itself get emotional, recounting what they witnessed that day, but also the several Capitol police officers who were there that day on the front lines defending the building from those rioters. And so we just want to now show you some of the reaction after the hearing wrapped up. It was about 3.5 hours from earlier this morning. And so some of the members on the panel came up in the Capitol to the podium to reporters to kind of get their thoughts. They answered some questions, so we're going to take that right now.
Thank all of you for being here today. We have assembled members of the Select Committee. We've conducted our first hearing for the committee. We heard from 4 law enforcement people who put their lives on the line in defense of the United States Capitol, the men and women who worked there. It was riveting testimony, as you can possibly imagine. We're thankful for their testimony. It sets the right tone for the work of this committee, but it also says that there's significant work that we have to do over the next few months. Again, let me thank the 4 officers who committed themselves to testimony. It was important that we talk to the rank and file officers. As you know, several committees has had opportunities to talk to leadership in the Capitol Police and the Metropolitan Police, but this was an opportunity we felt necessary in order to find out what those individuals who had to fight the rioters on January 6th had to endure. So we're happy to have heard the testimony. We're disappointed in so many of the challenges they've had to endure during and after from a health standpoint, family standpoint. But in addition to that, I want to thank the members of the committee for their participation. Their questioning and everything was on point. I'd like to offer Congresswoman Cheney an opportunity to make a statement.
Thank you. Thank you very much, Mr. Chairman. I echo everything the chairman has said. I think this was a really important opportunity to get some facts on the table and to hear directly from heroes who defended us that day. Also to begin to set out the task ahead of us and to really be able to do this in a nonpartisan fashion, which is clearly the spirit that every member of this committee has and with which we'll do our job. So thank you very much.
Thank you very much.
Councilwoman Cheney, something you said
hold on. We will entertain questions.
Councilwoman Cheney, it's something you said at the onset of this hearing. You said we must also know what happened every minute of that day in the White House, referring to the Trump White House. He said every phone call, every conversation, every meeting leading up to, during, and after the attack. Why, first of all, why do you think that is so central to this investigation? And is there agreement among the chairman to go down this road?
The chairman has said, everyone has said very clearly the investigation is going to go wherever it may lead. And obviously the events of that day at the White House are a focus, and making sure that we get to the bottom of everything that went on every minute of the day is something the American people deserve.
The 4 officers, if you heard my last question, we asked them what would they like to see from this hearing. And they, without exception, said we'd like to know who participated in it, who financed it, who encouraged it, who orchestrated it. And part of that is the challenge of this committee. And so we will follow the facts. And as I look at the committee, and I said to them earlier, I don't see one shrieking Violet, although we have one member who has a daughter named Violet. But other than that, we'll follow the facts.
To that end, Mr. Chairman, you guys are about, the House is supposed to go home for 7 weeks after this week. How do you build on this? What do you do next?
Well, we now have a body of testimony that we will review. We are in the process of putting that together. I've put some of the members on notice that they won't enjoy the entire August recess, but we will give them time to work in their districts, but conceivably we could come back before the end of the August recess and do some additional work. Yes.
Congressman Cheney and Congressman Kinzinger, what do you say to Republicans who are now calling for you to be stripped of your committee assignments as a result of you serving on this committee through an appointment by Speaker Pelosi?
All I have to say to that is we had a big attack on January 6th. We heard very emotional testimony today. And that's what's on the forefront of my mind. And if people want to get petty, that's fine. I think that reflects more on people than it does on the situation at hand. This is a historic moment, and this is a democracy-defending moment. And no matter the consequences, me and I know Liz will stand and defend democracy.
Last question. This morning, Leader McCarthy and some of your colleagues were out in front of the Capitol. Their basic message, and I'm boiling it down, was what did Nancy Pelosi know and when did she know it? Some of your other colleagues were down at the Justice Department or will be defending January 6th prisoners. What's your read on what other members of your conference are doing with their messaging today?
Look, almost every member of the Republican conference understood in days immediately after January 6th what had actually happened, and many of them said so publicly. And the fact that so many members of our leadership and others, the fact that they've gone from recognizing what happened on the 6th to protesting in front of the Justice Department on behalf of those who were part of the insurrection is something that I can't explain. I think it's a disgrace, and I know that this committee will be focused on getting to the truth of what happened in a non-political, non-partisan way. This is not a political campaign. This is deadly serious, and we'll investigate. We'll investigate every aspect.
Should Leader McConnell also testify?
What was your next hearing?
Well, we've not set any additional hearings. We will be discussing over the next several days about what our August recess will look like, and at that point, we'll announce it to the public.
Should Leader McConnell testify in front of your committee?
You.
Chairman Thompson, do you want former Trump administration Justice Department officials to testify?
All right, so we just wanted to give you some of those highlights from earlier today. You heard there from the chair of the House Select Committee, that was Representative Benny Thompson. He's a Democrat from Mississippi. He said, at this point, no other hearings have yet been scheduled for this Select Committee. Today was the first one. It went for about 3.5 hours. And so they said they kind of have to contend with their August recess. That's kind of like summer break for some of these members of Congress and lawmakers. Anyway, we are going to be moving on to some other big stories, top headlines on this Tuesday. Thanks for being with us. I'm Andrew Kraft. This is Live Now from Fox. What we want to do now is just take a quick 2-minute commercial break. When we come back, a lot of news from the CDC today. We'll have some updates on that and also what President Biden was up to today as well. We'll see you in 2 minutes. And welcome back here to Live Now from Fox. I'm Andrew Kraft. Now, as you know, the CDC issued a reversal on mask wearing across the nation, and it's raising some eyebrows. Fox News White House correspondent Peter Ducey has this story from today.
or CDC have made lightly. This weighs heavily on me.
President Biden says more vaccinations and mask wearing in the areas most impacted by the Delta variant will enable us to avoid the kind of lockdowns, shutdowns, school closures, and disruptions we faced in 2020. Unlike 2020, we have both the scientific knowledge and the tools to prevent the spread of this disease. We are not going back to that, but he's still searching for ways to reach the unvaccinated.
If those other 100 million people got vaccinated, we'd be in a very different world. So get vaccinated. If you haven't, you're not nearly as smart as I said you were.
And if people who work for this country's largest employer, the federal government, aren't vaxxed, that may soon be required.
That's under consideration right now.
This map shows areas most immediately affected by today's masking update. Counties with substantial or high COVID-19 transmission.
Substantial is orange and high is red.
And when it's time to go back to school,
CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status.
that's going to be a tough sell in some states.
I can tell you the folks back home are done with masks. If you've been vaccinated or you've had the virus, I really don't see the science behind insisting people wear masks.
The CDC argues the vaccinated may not get sick, but they can spread.
Some vaccinated people infected with the Delta variant after vaccination may be contagious and spread the virus to others.
And with that, today's guidance represents another step backwards.
Why did the president say, if you've been fully vaccinated, you no longer need to wear a mask? Let me repeat.
Let me repeat. If you are fully vaccinated, you no longer need to wear a mask.
If it was possible that that was going to turn out not to be true.
Well, Peter, I think we're all dealing with an evolving virus where there's no playbook and no historic precedent.
This new guidance amounts to the Biden administration realizing too many unvaccinated people are still getting sick, and then admitting that even if you got vaccinated and did everything else that they asked you to do for the last 6 months since they got here so that you could someday ditch the mask, it wasn't enough. At the White House, Peter Doocy, Fox News.
Peter, thank you for that update there. We're going to go out now to the president's remarks. He was speaking at the headquarters of the Office of the Director of National Intelligence in McLean, Virginia. He was asked about this new updated guidance from the CDC as well. And so we'll hear from the president from earlier today.
The American people about the nature of the threats we face and just how serious they are and they aren't. Every one of you joined up because you believe in being part of something that's bigger than yourself, especially you guys and women in uniform, bigger than yourself. You're patriots. It's a word that we use lightly, but I mean it. It's not, I don't use it lightly. I really don't. My son who spent a year in Iraq and died was a patriot. He wasn't just somebody else. You all are patriots. You risk your lives and your sacred honor for all that we need to have done for us. And you believe in the American idea, and living up to that idea is embracing democratic values that are our greatest strength at the end of the day. Leading not just by the example of our power, but by the power of your example. The power of your example. In addition to thanking you for your bravery, integrity, and your sacrifices, I want to make it clear to everyone here today, and to the members of the intelligence community working around the globe, that you have my full confidence. It doesn't mean I don't question what you send me. That doesn't mean it's not that I'm not a new guy on the block in terms of these issues. But one of the reasons I question is to push you to the limits to determine just how certain you are about what you do. And lots of times, the only honest answer, we're not certain. We're not certain, but this is what our best judgment is. I really do know how hard the work you do is. I've been doing this for a long, long time before I became president. I know there's no such thing as 100% certainty in the intelligence world. Occasionally that happens, but rarely, rarely, rarely. But I also know that your work is invaluable to our ability to make informed, strategic national security decisions. And I just had an interesting meeting, as you all know, with my very close friend Vladimir Putin. I can tell. The one thing, I've been dealing with world leaders a long, long time. And just like all of you women and men, you can sort of sense somebody else after a while. He knows
that you're better than his team. And it bothers the hell out of him. Not a joke. Not a joke. And he, as a consequence of you, thinks we have capacities he may even exaggerate. But that's a good thing. That's a good thing. You know, one of the things I miss most during the 4 years between my time serving as vice president and being a professor at a college, and I mean this sincerely, from the time I was 31 years old, every morning I woke up and got in a train to come to, I commuted every day from Delaware after my wife and daughter were killed. And I'd come every day, and one of the things I'd get a brief in the morning. I was more informed than 99% of the American people. You know what I miss most, for real, in those 4 years of being a professor? The PDB. Or you think I'm joking? I am not. A sense of knowing where all the pieces were. Whether we had it all down, we knew where all the pieces were. Knew where the pieces were. And so now I have access again, and as to the chagrin of many of you, I read it in detail. And I ask questions of my briefers and follow up with my team. And I ask each of you the same thing. I asked Director Haynes, just give it to me straight. I'm not looking for pablum. I'm looking for straight from the shoulder assessments. And when you're not sure, say you're not sure. But give me your best judgment of what you think is. Your best judgment is better than almost anybody else's judgment in the whole world. Even if the news is hard, even if the news is bad. I can't make the decisions I need to make if I'm not getting the best unvarnished, unbiased judgments you can give me. I'm not looking to hear nice things. I'm looking to hear what you think to be the truth. I greatly appreciate just how much work goes into the analysis that the IC produces and the tactical intelligence supporting your warfighters and the superb effort to ensure our IT, our human capital, and the facilities are the best in the world. Because again, without knowing what you not while you telling me, I don't know enough to know what to ask for from the Congress, how much money we need, what we need to focus on. It's a massive coordinated global effort to pull together reliable intelligence in a timely way. And all of you, no matter which agency you work for, are part of one team with one shared mission, keeping America strong and secure in the world, or simply making sure your families are safe. It gets down to basic things, just really basic things. You know, for most of the last 20 years, much of the work has been focused on counterterrorism, making sure the United States doesn't experience another horror like occurred on September the 11th. And that work has to continue and evolve to address the changing shape of terrorism as we find it today. And it's no great insight on my part, it's going to change significantly more. It's going to change significantly more. I always get kidded by my colleagues when I served in the Senate for 36 years for quoting Irish poets. They think I quoted Irish poets because I'm Irish. That's not the reason. I quote them. They're simply the best poets in the world. And there's a famous poem written by them that says, all's changed, changed utterly. A terrible beauty has been born. The world is changing so rapidly, technologically, and in terms of alliances and human intercourse, that more is going to change across the board in the next 10 years than the last 50 years. That's not hyperbole. That's a fact. If I talked to you 15 years ago about hypersonic flight, you'd look at me like I was crazy. So much is going to change. And that's going to put an enormous burden on you to stay ahead of the curve. It's really going to get tougher. But we have the best folks in the world. And one of the things that I think, and I don't want to get off too far afield here, but one of the things that's really important is our greatest strength, in fact, is our diversity, bringing completely different perspectives to it. And I really mean that. That's not hyperbole. I'm not trying to be kumbaya, everybody get along. It's just a fact. It's a fact. And so threats that are more geographically dispersed than they were 20 years ago are going to continue to require our vigilance. We have to continue efforts to better understand some of the hardest and most important intelligence targets we face as a nation. But, we also need to make sure we're positioning ourselves to stay ahead of the security challenges that will stretch the IC in new ways that have never been stretched before. We've seen how cyber threats, including ransomware attacks, increasingly are able to cause damage and disruption in the real world. I can't guarantee this, and you're as informed as I am, but I think it's more likely we're going to end up, if we end up in a war, a real shooting war with a major power, it's going to be as a consequence of a cyber breach of great consequence. And it's increasing exponentially, the capabilities. When I was with Mr. Putin, who has a real problem, he's sitting on top of an economy that has nuclear weapons and oil wells and nothing else. Nothing else. Their economy is, what, the 8th smallest in the world now? Largest in the world? He knows he's in real trouble, which makes him even more dangerous in my view. Take a look at China. I've spent more time with Xi Jinping as a world leader than anyone else has. I spent 25 hours alone with him when I was vice president because it was important that, according to President Obama, that someone knew who the new guy coming on board was, and it couldn't be the president. Travel 17,000 miles with him. I've sat with him, with me, and just an interpreter. Each of us have a simultaneous interpreter. He is deadly earnest about becoming the most powerful military force in the world, as well as the largest and most prominent economy in the world by the mid-40s, 2040s. It's real. I don't know, we probably have some people aren't totally cleared, I don't know, but you saw just what we found out about hypersonic. Anyway, as they say in Southern Dole, this boy's got a plan. And, we better figure out how we're going to keep pace without exacerbating and moving us in a position where we increase the hostilities unnecessarily. I think we also need to take on the rampant disinformation that is making it harder and harder for people to assess the facts, be able to make decisions. In today's PDB, you all prepared for me. Look what Russia is doing already about the 2022 elections and misinformation. It's a pure violation of our sovereignty. Now you see what's happening. More people get their information from the internet than they do from any other outlet. What's all the disinformation that's having real consequences in terms of people's access? And so there's so much that you all, particularly those of you who are new and coming along, are going to have to keep up with and ahead of in ways that are not even happening now, as good as everything is. As we compete for the future of the 21st century with China and other nations, we have to stay on top of the cutting-edge developments of science and technology. If you'd hold for a second here, I want to point out something. We used to be, when I first got here as a U.S. Senator, actually 3.5 decades ago, we invested more money in R&D as a percent of our GDP than any nation in the world. We're now number 8. China was number 9. They're now number 2. It matters. It matters. Look where we are in things that intelligence communities and others don't even think very often about how educated the public is. We're coming around right now. This doesn't relate to the intelligence community per se, but it does. Think about it. If we were having a debate that was taking place in the United States in the late 1890s and the early 1900s about public education, do you think any of us would say 12 years of free public education was enough to compete in the 21st century? Not a joke. Think about it. What do you think? I don't think there's a shot if we were doing that today. So the fact we have the best educated public in the world, that that's our objective, will matter a great deal. Matter a great deal. It is as much a part of national defense, in my view, as anything else is. So I think we have to think differently. I don't expect you to agree with me. I expect you to at least understand where I'm coming from. Because the world is changing so significantly. And it's especially important that we work closely with our partners and allies to maintain our technological edge, shore up supply chains, ensure that the rules that govern technology support democracies, not autocracies. You know, at the same time, we have to work in cooperation with nations like China and Russia that are competitors and possibly mortal competitors down the road in the context of to meet the existential threats, for example, of climate change. There's certain things that are in mutual interest. But we can't be lulled into thinking that that's enough, and that we don't have to really keep a watchful eye on what the ultimate objective of the other team is. But there are things where we should be cooperating. This shared danger impacts all nations. Climate challenge is already accelerating instability in our own country and around the world. Extreme weather events that are more common and more deadly. Food and water insecurity. Sea levels rising, resulting in changing climate, driving greater migration, and posing fundamental risk to most vulnerable communities. We could hold for just a second again. We're in a situation where, think about this. Think about this. I'll never forget the first time I went down in the tank as vice president after I got elected. The Defense Department said, what's the greatest threat facing America? Climate change. If in fact the sea level rises another 2.5 feet, you're going to have millions of people migrating, fighting over arable land. You saw what happened in North Africa. What makes us think this doesn't matter? It's not your responsibility, but it's something you're watching because you know what's going to happen. People who were Muslim and the only difference was black and or Arab, killing each other by the thousands for a piece of arable land in North Central Africa. Well, what happens? What happens in Indonesia, if the projections are correct, that in the next 10 years they may have to move their capital because they're going to be underwater? It matters. It's a strategic question as well as an environmental question. The dramatically warming Arctic is opening up competition for resources that once were hard to access. I had, as they say in Southern Delaware, that talk at you like this, you know what I mean? I had a come to Jesus meeting, an altar call with Mr. Putin about what he thinks is what Russia's property is in the Arctic. China looking very closely at that as well, where they are. That's what I mean about the world changing. What is that going to do to our strategic doctrine in the next 2, 5, 10, 12 years when you can circumvent the Arctic without icebreakers? So look, we need your insight. We need your expertise on all these issues. The one thing you all have in common is you all have high IQs. You're all smart. You have significant intelligence quotients. And you're put into use to help the elected leaders of this country decide what the best route to go is. So just as you've always been essential as we've sought to counter traditional threats, the intelligence community is going to be critical to America's strength as we take on these new challenges and hybrid threats. Finally, I've laid out a broad agenda that's just a fraction of it. But we can't do any of this without taking care of our best and most important asset, the American people. I know the intelligence community is already one of the best places to work in the federal government. I asked my staff when I found out you came in second just after NASA, I said, don't tell me what the White House is ranked. It will hurt my feelings. And they assured me, no, you didn't rank them. That was a good thing. We don't rank the Oval Office. But all kidding aside, it's about the camaraderie you have. And most of all, it's about being able to trust one another. To trust one another. My highest priority as president is the safety and security of all Americans. And that includes those who serve in our intelligence community. You take on unique risks in these jobs. And we're taking the cases of anomalous health incidences that are affecting intelligence officers, government officials, and their families very seriously, for example. My administration is coordinating a government-wide effort to respond to these incidents because this challenge demands that departments and agencies, including the entire intelligence community, work together with urgency. Talked about changes. What's going to happen as we move on and we're able to develop around the world pathogens that can be transmitted to societies and communities? It may not be a nuclear weapon. It may not be a hypersonic missile. It may not be any of the things we think of. But think about it. Just think about what's happened with one. I'm not suggesting it was intended. A lot more need to know. But think what's happened. More people have been killed in the United States of America because of COVID than in every single major war we fought. Combined. Every single one. What's next? What is intended? There's a lot of research going on. You're going to find you're going to have to increase your ranks with people with significant scientific capacity relative to pathogens. So my point is, your value is going to increase and increase and increase and increase in terms of security. You know, from the CIA to all the agencies, there's a lot going to happen. And to all of you who've been affected, we recognize how important it is to make sure that they have the best possible care at the time of figuring out how to deal with what's happening to not only some of those who've been stationed abroad, but their families. Look, this is a priority for our entire leadership team. So let me just close by saying how much I value the work you do. That's why I wanted to come here today. So much of the work you do is in secret. That means many, many times you don't get credit, the credit you deserve, and the things you prevented from happening, the catastrophes you've enabled us to avoid, the judgments you provided us to make our people safer. And America probably never going to learn about the life you've saved or the disasters that never come to pass because of your diligent professional intelligence work. But I want you to know, I know. For the time being, at least as long as I'm around, I know. And on behalf of the American people, thank you all for what you do every single day. And we're grateful. We're grateful that you're there for us. We're safer because of your dedication, your honesty, your integrity, and your significant intellectual capacity to act in our interest. We're stronger because of your insight. We're a more noble nation because of your insight. And American lives have been saved repeatedly because of your insight. I know it may sound like hyperbole, but from the bottom of my heart, I thank you. I thank you for all you do and continue to do. And may God bless you all, and may God protect our troops and all those patriots serving in harm's way, because a lot's still there. Thank you, thank you, thank you. to seek permission to leave. I have to check, you notice. Thank you again.
President Biden, will you require federal employees to get vaccinated?
Beg your pardon?
Will you require all federal employees to get vaccinated?
That's under consideration right now, but if you're not vaccinated, you're not nearly as smart as I thought you were.
Are you concerned that the CDC's new mask guidance could sow confusion?
We have a pandemic because of the unvaccinated. There's so many enormous confusion. The more we learn about this virus and the development severity, the more we have to be worried and concerned. And there's only one thing we know for sure. If those other 100 million people got vaccinated, we'd be in a very different world. Get vaccinated if you haven't, and I'm really as smart as I said you are. Thank you.
All right, there's President Biden speaking to members of the intelligence community today at the headquarters there in McLean, Virginia. And he got asked as well about the new CDC guidance, going and backtracking on mask wearing, mask guidelines for the vaccinated, saying regardless of your vaccination status, you should probably wear a mask in spaces that are likely vectors for high transmission of the virus, especially the Delta variant of the coronavirus. And so we'll be monitoring all those developments, especially the news that could come a little later this week that the White House will mandate all federal workers to be vaccinated if anyone works at the federal government, for the federal government, to be vaccinated unless they can provide a specific reason why not? And if they are not, then they have to get tested twice weekly and et cetera. So very interesting and very timely news today about the coronavirus that's affecting millions of Americans. When we come back, though, we're going to see how cities and states are approaching this new guidance. Remember, just last week, LA County said that they were re-implementing their mask recommendation, mask mandate for even the vaccinated. And right now we're going to, well, not now, but after the break, we're going to hear from LA Mayor Eric Garcetti, because he is going to be requiring city employees to do the same, to mask up yet again. We'll have that and more in 2 minutes here on Live Now from Fox. Thanks for being with us. Welcome back here to Live Now from Fox. It's just a live picture that you're looking at of New York City, the Manhattan skyline. It's almost 10 p.m. there on the East Coast, almost 7 p.m. here on the West Coast. We're going to Stay on the West Coast because we want to show you an event from moments ago from LA Mayor Eric Garcetti announcing some new guidelines and requirements for city employees in Los Angeles. We're learning that both Mayor Garcetti and the City Council President Martinez announcing today that they would push for mandatory COVID-19 vaccines for city employees, beginning with a requirement that workers either submit proof of vaccination or a weekly negative test. So let's go out to Mayor Eric Garcetti from earlier in Los Angeles.
95 times I've come before you to give you life-saving information during this pandemic, to reassure you, to mourn with you, to mobilize the spirit of our city to face the greatest challenge that our town has ever seen, and to get through the past 16 months as we fought COVID-19. We've made so much progress, and that's why you haven't heard from me for a while. But I said I would return to brief you if there was information that you needed to know, something important to share. So I'm here tonight for a 96th time. I'm joined by our City Council President, Nuri Martinez, because this is one of those moments. To put it bluntly, we are facing a surge of COVID-19 here in Los Angeles once again. Our cases are up, our test positivity is up, our hospitals are admitting a growing number of our friends, our neighbors, and our family members. So we have to act again to save lives, to do the necessary work that I have witnessed. I trust you and I believe in you because I've seen you act over these last 16 months to take heroic actions that save the lives of the people that we love. And I know that you can summon that brilliance, that determination to once again do the same. I want to be clear. The number of cases that we face is not as high as the surge in the winter. On Friday, though, we had more than 3,000 new cases here in LA County. The last time that happened was February. In just 1 month, we've seen our total cases more than triple from June. And our incredible vaccination work this spring helped us flatten the curve and then push it down by 99% at our lowest. But as fewer people get vaccinated, and as the world waits to be vaccinated in large numbers, the Delta variant has spread. Now the dominant variant here, making itself at home in our city. It's highly contagious. It spreads about twice as easily as the original virus, and now accounts for the overwhelming majority of cases here in LA County. The surge is not just happening here. This country and the world is experiencing a fourth wave of COVID. Our country has seen a fourfold increase in new cases per day over just the last month alone. And this variant is spreading throughout the world, filling hospitals and spreading suffering and loss once again. We're facing a real threat, and the only way we'll gain the upper hand is by fighting back. The good news, so different than almost every other time I had a briefing, is that we have a vaccine. We have a safe and effective vaccine, something unthinkable a year ago, and it couldn't be easier for you to get. And if you have any doubt whether it offers you protection, consider this. Right now, over 90% of the people who are currently hospitalized with COVID, over 90% are unvaccinated. And more than 97% of the people dying from COVID are unvaccinated. As I've said many times before, you'll either get the vaccine or COVID, and I'll tell you which one of those can kill you. Tonight, I'll talk to you about what you can do to help us turn this tide, and share with you what your city is doing to help support you every step of the way, to continue this road to recovery, which you fought so hard for and which we have to protect. But first, I want to share with you an announcement. I and the City Council President, together with her colleagues on our City Council, are moving forward with requiring city employees to be vaccinated, starting with a requirement that they report their vaccination status or submit weekly proof of a negative COVID-19 test. No one is immune from the dangers of this virus. As mayor of this city, I've talked to too many widows, too many brothers and sisters, sons and daughters who have lost the people they love the most. And we're seeing an alarming spike in cases among our city workforce, 110 new cases in the past week alone, as compared to 34 in the prior week. This policy is about protecting the health of not just those who provide essential services to keep our city running, but protecting all Angelenos. We're taking this step in close consultation with our labor partners, and will continue to engage our employees, many of whom have reached out to us asking for protections, all who share, I know, a deep concern about the safety of their fellow workers, their families, and the public. In Los Angeles, we are fortunate to have what is probably the most hardworking and dedicated municipal employees anywhere in the world. Women and men who stepped up to challenges, new jobs and new places, who didn't ask whether something we were asking them to do fit into their job description, but who stepped up as heroes throughout this pandemic. They never lost sight of providing those core city services. When I promised your city would never stop working for you, it was those men and women who proved that true. I could not be more proud of our city workers, could not be more grateful for their commitment to public service, or concerned about their health and their well-being. That's what's at the heart of this announcement today, but that we're announcing today require folks to report their vaccination status. So let me turn it over now to our Council President, Nury Martinez, to say a few more things, then I'll come back to share some other important announcements and the numbers for today. Council President Martinez.
Thank you, Mr. Mayor. Angelenos have stayed home for over a year to protect themselves and each other. And quite frankly, I think it's safe to say that we're getting tired of protecting people who don't want to protect themselves or get vaccinated. We have 3 vaccines readily available that are effective. We have vaccine events across our city. We have accessible vaccine centers, and even we've gone door to door offering the vaccine shots. Yet we still have people endangering themselves and others. This is truly a pandemic of the unvaccinated. 99% of the COVID-19 cases, hospitalizations, and deaths we are seeing are among the unvaccinated individuals in LA County. For those of you who are hearing this and have not yet been vaccinated, what is it going to take to get vaccinated? For you to get sick? For you to be hospitalized and put in a ventilator? For maybe a loved one to have died of the virus? What will it take for you to realize that you should have gotten your vaccination? While this vaccine will not 100% guarantee you won't get COVID, it will reduce your chances of you getting the virus, and it absolutely will reduce the severity should you get it. Yes, there are breakthrough cases that occur in vaccinated individuals, but their symptoms and experiences are significantly less severe than those who have been unvaccinated. This past year, you've heard us say over and over again that we're in this together. Well, now it's time for those who are resisting the vaccine to do their part if we're truly in this together. Those resisting the vaccine need to think about the children who are not eligible for the vaccine yet and they can still get sick. And think about those who are not eligible to receive the vaccine. Kids have given up an entire school year. Moms have given up their careers, and some have even lost their jobs this past year. And we're going to continue to take it away from them if you do not do your part. I'm vaccinated, my family is vaccinated, my entire staff is vaccinated. We are doing what we can to help end this pandemic. We are asking you to do your part. Now it's time for those unvaccinated folks to do theirs. I have called for the city's Executive Employee Relations Committee to meet tomorrow to discuss a vaccine mandate for all city employees. How can the city ask Angelenos to get vaccinated if we're not doing it ourselves? Because as a city employee, we need to set the example and we need to hold each other accountable. And by requiring all city employees to be vaccinated, we can help not spread the virus when we are providing neighborhood services and working within our communities. We can also be sure that city employees who are vaccinated are less likely to bring the virus into their homes and to their families. This is necessary. This is a necessary step in returning back to normalcy and lifting the pandemic restrictions. For those who still have questions and concerns about the vaccine, please feel free to ask all your questions. We are now half a year into our vaccination campaign, and we need the unvaccinated Angelenos to stop dragging their feet. As the largest employer in the city of Los Angeles, this is us doing our part. This virus will be with us for a while, but Los Angeles is ready to put the restrictions, the closures, and mass hospitalizations behind us. I'm asking you, get vaccinated today. Do you want to do
We'll do
Spanish?
Yeah, we'll do Spanish. Thank you very much, Council President.
All right, so we just wanted to show you some of this press conference just happening within the last hour from Mayor Eric Garcetti. And you can see there he was being joined by the City Council President Martinez, talking about why they think this is necessary. They're urging the unvaccinated to get vaccinated. They say the unvaccinated have had plenty of time and resources to heed their call. And this is why they are requiring the largest employer in the city, that's the city itself, Los Angeles, to require their employees to show proof of vaccination. Anyway, we're going to be moving on to some of these other stories we have yet to get to, including on the southern border. We'll have an update on the surge down there and an update from officials in La Jolla, Texas. All that and more in 2 minutes here on Live Now from Fox. Welcome back here to Live Now from Fox. You can see we're just taking a live look at the Manhattan skyline there in New York City. We also have another cool live picture. I know we show this to you guys a lot. This is right outside Fox News World Headquarters in Midtown Manhattan. And of course, we have these live shots out of Washington every single night, of the U.S. Capitol, and of course the White House. And so, always love showing you these live pictures from cities from all across the country. That's what we do here on Live Now from Fox. We show you raw and unfiltered events and feeds from across the country and around the world with the top headlines and the biggest stories of the day. And so we're going to stay on one of the biggest stories of the day, and that was this hearing that happened, the first hearing for the House Select Committee on January the 6th, looking into what exactly went wrong and how that happened, the Capitol riot. So I want to show you some of the more reaction from Senate Democrats and Senate Republicans earlier today. And then within this hour, we also have an update from the southern border itself. So all that in store in this hour. But first, let's hear from Senate Democrats earlier this morning.
But wear the masks. So I am now without mask, which means I'm about to speak. All right. First, I'm glad, as usual, to be joined by Senators Durbin and Murray and Stabenow. So, as you can imagine, we have another very busy week in the Senate. This morning, the House began its inquiry into the events of January 6th. The special committee in the House was forced into existence because Senate Republicans and Leader McConnell blocked the formation of an independent commission like the 9/11 Commission. That's a fact. The reason they had to do what they did in the House is because McConnell said no. The testimony America heard from our brave Capitol police officers was extremely... Hey, can we have it quiet, please? Thank you. The testimony we heard from our brave Capitol police officers was powerful, harrowing, and necessary for the country to hear. In fact, I don't want to play favorites, but the New York Times did a video of the Capitol invasion about 3 weeks ago. I really commend it. It's 40 minutes. It's no editorializing. It's so powerful. I would urge, how many of you promised to watch it? You're not allowed to do that as journalists? Okay. One. Oh, he's from... He had to watch it to keep his job, I suppose. Okay. All right. It's really a great video. I shouldn't have asked you to raise your hands. But now I won't answer any questions. No, that's a joke. It's very important, as I said, we do this. January 6th was one of the darkest episodes in the history of our democracy, the first time the Capitol was breached since the War of 1812. And we have to get to the truth of what transpired. What and who caused it? Not just the people in the building, but many others who have been involved as well. And I'm hopeful that this inquiry will get to the bottom of that. We have to do this to ensure, make as certain as possible that this never happens again. Now, in large part, because of the horrific events of January the 6th, the Capitol Police is running out of funding. Senate Appropriations Chairman Leahy has put together a necessary security supplemental to ensure the Capitol Police don't run out of money and reimburse the National Guard for their support. A months-long mission to keep the Capitol secure on Inauguration Day and after the insurrection. We are now seeking a time agreement to put this important legislation on the floor and pass it this week. These brave officers put their lives on the line. They put their lives on the line defending the Capitol and each and every one of us. And they are heroes, plain and simple. And they ought to get the funding they need. There is no reason for Senate Republicans to oppose funding the police and funding the National Guard. Now, briefly on infrastructure. On infrastructure, we're making good progress on both tracks. The bipartisan infrastructure bill and the budget resolution with reconciliation instructions. We had a good discussion at lunch. We're doing all we can as a caucus to quickly achieve both tracks. If an agreement can be reached, and I'm very optimistic and hopeful it will be, senators should prepare to work through the weekend in order to finish the bipartisan infrastructure bill. As I've said from the beginning, we got a lot of work to do, but it's my intention to get both the bipartisan infrastructure bill and the budget resolution in the Senate passed before the conclusion of the work period. Senator Durbin.
Thanks, Senator Schumer. This is an historic moment. This special committee in the House of Representatives investigating January 6th is long overdue. It should have started with a bipartisan commission. That was proposed in the Senate. It was killed by Senator Mitch McConnell of the Commonwealth of Kentucky. He decided that we would not make that investigation on a bipartisan basis. I salute Speaker Pelosi for moving forward, and I give a special salute to my colleague from Illinois, Congressman Kinzinger, who at some political peril has joined this bipartisan effort. I thank him for doing that, and I hope that it all ends well and soon. But I do want to say this too. We are at an historic moment in the Senate. We know this economy is starting to show signs of real life. In just 6 months, we've gone from creating 60,000 jobs a month to creating 60,000 jobs every 3 days under the Biden administration. America is opening for business. But our effort on infrastructure is to make sure that that continues, that the momentum continues forward, creating new jobs and new opportunities for people across America. I salute the bipartisan group, but it's time to close the deal. I hope they can get it done soon. As Senator Schumer has said, we're going to stay until it is done, and I heartily support that statement on his part. We have work to do, but if we do it together, it'll be in the best interest of this country, and we can move forward to the budget resolution.
Thank you, Senator Durbin. I have heard nonstop from families and communities in my home state about the long list of challenges they are dealing with during this pandemic and coming out of it. The costs of basic like child care and health care and higher education. The need for policies like paid leave to support workers and pre-K for every young student. For many of my constituents, the long fight for a fair pathway to citizenship. And across our state, I'm hearing about and seeing for myself the effects of the climate crisis and the urgent need to act on 21st century infrastructure, on electrification, on reducing emissions, all of which help create good-paying union jobs and make our country more competitive in today's changing economy. And of course, we are still not out of the woods when it comes to COVID-19. And we have to make a real investment in public health so we are better prepared next time. And I know Democrat or Republican, other senators are getting the same kinds of questions. These are issues just about every American is dealing with in some way. So my hope for the coming days is that each senator tunes out the noise, listens to their constituents, and comes together to work on both the bipartisan infrastructure package and also the Build Back Better plan, which helps us not just get back to normal, but to ensure our country can come back stronger and fairer from this crisis. Senator Stabenow.
Thank you. As Senator Schumer indicated, we are here to get the people's business done, and however long it takes. At this point, we all know it's time to invest in the future of American families and American communities, and that's what the two bills that are in front of us do, and we are committed to getting those done. It's very exciting when you look at the opportunity to create millions of good-paying jobs, rebuilding our roads and bridges and water systems, and I certainly know how important that is to the people I represent in Michigan as well as across the country. And we also need a national strategy to bring jobs home. And that's what the President's talking about. That's what we are talking about. Create American supply chains in clean energy that will create jobs, create it in other technologies. It not only helps the economy, it's about our national security. So this is really important. We also know that investing in our country is more than roads and bridges and water systems and broadband, as important as they are. It's about the future for our families. So for us, we want to cut taxes for the majority of Americans, working Americans, and make sure the wealthy pay their fair share, period. And it's about lowering costs for the things that keep families up at night, whether it's child care, elder care, the cost of preschool or college, or the cost of medicine. It's time to invest in America, our places, our people, and our future.
Thanks, Deb. Questions? Yes. I'm not supposed to get, well, go ahead.
How long can you actually let these bipartisan talks go on? It's been more than a month since they...
I know, and as you know, I've been doing everything to speed them along. First, with the motion to proceed on Wednesday, and second, with the global offer that we made Sunday night. We're getting close, and I'm hopeful we can get this done soon. Yes?
Can you talk us through that in the last 24 to 48 hours, the progress made on the infrastructure bill and what issues are still outstanding?
There are a bunch of issues still outstanding. I mentioned them on the floor and yesterday, but we're making progress. We're not there yet, but we're making progress. The number of issues has been narrowed significantly. Yes?
Senator Manchin told us that if the bipartisan bill falls apart, the reconciliation bill then falls apart. Your reaction to that?
Look, I'm working on getting both bills done. We need to get both bills done for the good of the country. They're both very good bills. They're both important. What one bill has, basic infrastructure, the other bill doesn't, and what the other bill has, the one bill doesn't. So we got to get both done. Go ahead, Burgess.
Are you saying you will keep at the bipartisan talks until you get something, like there is no...
There's got to be some kind, as I said, I think we're close. I also said we're going to get this done by, through the August recess if we have to stay, period. Okay? Last one, then we got to take the picture.
What about pacing reform?
Senator Booker, I had a nice talk with Senator Booker, and he's continuing to work at it, but they're not in an agreement yet. Thank you, everybody. We got to take the picture. We're waiting. We're going to on the masks. We're waiting for the guidance to come out from CDC, and we will then come up with what the caucus recommendations would be. Okay? I want to wait and see exactly what she says before going forward. So right now, you have to do what you think is best. For myself, I'm going to put on the mask until I go in to take the picture. And okay. Okay. Thank you, everybody. Sorry, got to take the picture.
Are you considering a mandate?
All right, thanks so much for being with us here on Live Now. We were just watching Senate Democrats, including Senate Majority Leader McConnell, talk about the business of the day there, talking about mask wearing, etc. We do want to show you, though, the other side of the aisle, because Senate Republicans came up to the very same podium and answered questions and gave an update about what they wanted to, kind of talking about the infrastructure negotiations at the moment, the new CDC guidance, and the January 6th Select House Committee hearing. So let's hear from Senate Republicans from earlier.
Well, the whole Senate is somewhat sad today, and particularly the Republican conference, over the loss of our friend and colleague, Mike Enzi. He was a remarkable individual, smart, quiet, effective, the best kind of United States senator, and we look forward to honoring him further when we find the funeral arrangements are announced. With regard to where we are, we had an extensive discussion about infrastructure in our conference at lunch, but one thing we know beyond the infrastructure package is the reckless tax and spending spree is headed our way. And I can predict confidently again there'll be no Republican support for this. The country does not need this. In fact, we're playing with our economy by continuing to pour trillions of dollars into our economy. So that will be an extraordinary debate of enormous dimensions. I can't think of a single issue that underscores the difference between the two parties more than the reckless tax and spending spree that we'll be dealing with here in the next week or two.
Let me just echo what the leader said about our colleague Senator Enzi, and I'm sure Senator Brasso, you've heard him speak to this already, but he was the consummate professional. He was the kind of guy that what you see is what you get. There weren't any pretensions there. Hardworking, principled, and just as genuinely good a human being as they come. So a real loss for obviously his family, Wyoming, and his family here in the Senate and in our country. Just let me say about the tax and spend proposal, the tax and spend spree that's been outlined by the Democrats, that I was happy last week that every Republican senator here sent a letter to the President outlining something that we will never vote for, and that is the proposal to raise taxes on small business people and family farms and ranches that the President has laid out, I should say, in their $3.5 trillion tax and spend proposal. And part of that, I think, harkens back to the fact that a lot of our farmers and ranchers throughout the pandemic, as they always do, showed up day in and day out. And one of the real silver linings, I think you could say, about the pandemic is we never had a food shortage. And we owe that to the people who are out there every day working hard to make sure that we have a stable and affordable food supply. And they shouldn't be rewarded by their government with a big fat tax increase as a result of that. And so our members weighed in with the White House, made it very clear that that was something that we're not going to tolerate. And I'll say one other issue about our farmers and ranchers. I had been requesting for some time a hearing to take a look at the potential manipulation in the meatpacking industry. Meat packers have been reaping big profits. Those profits have not been seen by producers across this country. And we had an Ag Committee hearing a few weeks ago that examined that. And now the Judiciary Committee is also going to take a look because one thing we know is that the livestock producers in this country deserve fair, transparent markets. We owe that to them, and I'm going to work as hard as I possibly can to see that we get them some answers as to what's happening in the markets out there that are seeing the meat packers continue to do well, ranchers continue to struggle, and consumers continue to pay skyrocketing meat prices at the supermarket. That is an unacceptable situation.
Well, thanks to all of you for the condolences that we've been receiving about our friend and colleague Mike Enzi. A number of you went to his Christmas cookie party every year. As you know, his wife Diana would bake hundreds of dozens of cookies and invite everybody. The press would be invited, the police would be invited, the plumbers would be invited, everybody on Capitol Hill, all part of his family. Truly beloved in Wyoming. People really, they knew Mike and they understood that he respected them, that he understood their problems and he believed in them. And for that reason, he continued to get elected and reelected through 4 terms in the United States Senate. To the issue before us now in the Senate. This past weekend, Nancy Pelosi demonstrated who is truly running the Democrat Party. It's not Joe Biden, certainly not Chuck Schumer. Nancy Pelosi went on national television and she made very clear that any bipartisan infrastructure bill passed here would not see the light of day in the House unless and until the Senate sent her a $3.5 trillion reckless tax and spending bill. This wasn't a negotiation, this was a hijacking. What she's proposing is bad for the economy and bad for the country. So she's not only a hijacker, she's also an arsonist, because what she is proposing is going to put jet fuel on the flame of inflation that is hitting this country today. You say, who are going to be the victims of this? Well, the victims of this inflation and taxes, it's going to be certainly people on fixed incomes, seniors, young families starting out. The victims are also going to be every middle-class American who's going to be paying more in taxes and more when they go to buy things. I'm sure you've seen, if you fill up a vehicle, that you're paying $25 more for filling up the tank now than you were when Joe Biden took office. If you go to a weekly grocery shopping, you're paying about $25 more for groceries than you did when Joe Biden took office. That is what we're looking at. And it does seem the Democrats want to drag us back into the age of Jimmy Carter inflation. And you remember they talked about the misery index back then, the impact of the economy of these policies. So Nancy Pelosi has said basically there will not be a penny for roads, not a penny for bridges, not a penny for ports, not a penny for airports, unless and until the Senate passes increase in taxes and spending on the American people. There is not a single Republican in the House or the Senate who is going to support this tax and spending spree, which is clearly irresponsible.
Well, COVID continues to be a problem, obviously. I think the Center for Disease Control is going to make some announcements on that later today. I hope that they'll be more forthcoming with information than we've had up till now during this pandemic. I don't know of any reason not to share the information that the Center for Disease Control has. For instance, a lot of talk about people who've been vaccinated but then got COVID-19, the Delta variant, or some other kind of COVID-19. If you share those facts and figures right, that shouldn't be a big shock. As I recall, one of the vaccines had an 85% or so effectiveness rate. Another one had a 95% effectiveness rate. That would mean, you know, somewhere between 5 and 10 and 15 of every 100 people that get the vaccine are going to get COVID. But the good news is the people that got the vaccine that got COVID have a very different circumstance than the people who didn't get the vaccine and got COVID. I had 3 stories I thought I'd share with you today. One in Monette, Missouri, near my hometown of Springfield. A guy named Cole, who was married, 26-year-old, father of 2 young children. His symptoms got really bad. He thought his family was losing him. It didn't work out that way, but here's what he said. He said, quote, "I just remember sitting in the hospital and just thinking to myself, you could have avoided this. I just don't want anyone to feel the way that I felt." That was Cole's quote. And then I saw in the Columbia, Missouri News report, a person who lost her youngest sister and her brother's wife to COVID, and having other family members battling that illness in the hospital. Marlene asked everyone to get a vaccine. Here's what Marlene said about her sister. This is her quote. "She didn't know what the long-term effects of the vaccine would be. Well, COVID-19 was her long-term effect, and she's gone." Today in the St. Louis report on a national news network, Kimberly Jones in St. Louis talked about her daughter, Erica Thompson, who had died, leaving behind a husband and 3 sons, age 8, 11, and 12. Her mother, Kimberly Jones, speaking for the family, said, as she prepared for her daughter's funeral, she hoped others would be convinced that they need to do the right thing for themselves and their family so that other people aren't preparing for their family's funeral.
President Biden's political advisor is now very, very concerned about inflation. And the demographic that it's hitting the hardest, those that are the most concerned right now, are women. The price of goods and services for nearly everything has gone up because of Bidenomics. And with this $3.5 trillion package, what do we see? We see middle America being hit the hardest with the inclusion of things like the Green New Deal and with new taxes on our farmers and ranchers and small businesses. This has got to stop. Middle Americans are the ones that are paying for Bidenomics. We simply can't afford $3.5 trillion. And folks, I think that's a low estimate for what the Democrats want to pass. They need to stop this reckless tax and spending spree. And I do hope that there are some common sense Democrats that will put an end to this.
I hope everybody's following what's going on in Cuba right now. We have the Cuban population has finally said enough is enough. They've shown up, they've gotten on the streets. They have, unfortunately, the Castro regime is beating peaceful protesters. We have over 500 dissidents. Some of the dissidents I've talked to over the years. We don't know where they are. We do know some of them are being tortured, if not all of them. You can see the pictures of young boys being taken from their homes, being forced to serve in the military because they can't get enough people to serve right now. So this is our opportunity. This is our best chance. But Joe Biden's got to stand up. And by the way, you know, if you look at Latin America, Cuba's the problem. Cuba defends Maduro in Venezuela. He supports Ortega in Nicaragua. So a lot of the unrest we see in Latin America is caused by the illegitimate Cuban regime. So what does the Biden administration, what should they do? They should shut down the embassy, the Cuban embassy here in D.C. The Cuban government's an illegitimate government. That's number one. Number two is you know, to use all the resources to make sure whether they do it or the private sector, we get the internet on the island. You can do that. I've been talking to technology providers. It is doable. On top of that, they ought to show the pictures, show the videos of what's happening. Jose Daniel Ferrer's family's here today. His daughter's here today. His sister's here today. His brother was here yesterday. I mean, where is he? Our understanding is being tortured right now, only because he believes in what we all believe in is freedom. So Joe Biden's got to stand up, start talking about this, and talk to world leaders. Where's Macron? Where's Boris Johnson? Where's Merkel? Where's Trudeau? They shouldn't be supporting an illegitimate government in Cuba.
Peter McConnell. Referring the message at the hearing today over on the House side on the January 6th attacks was a frustration from the officers who were responding with those who were downplaying the significance of the attack on January 6th. As somebody who were here on that day, what is your message to those who have been downplaying the severity and the significance of the attack on the Capitol on January 6th?
I had a good deal to say about that, not once, but twice, on January 6th and again on February the 13th. I don't see how I could have expressed myself more forthrightly than I did on that occasion, and I stand by everything I said on January 6th and February 13th.
Why not, Peter McConnell? Did you watch any of the hearings today?
No, I didn't.
Why not?
I was busy doing work. I serve in the Senate.
Leader McConnell,
Yeah.
Just before you Democrats were here with masks on, I'm just wondering, all of you made the decision not to have them on. You can imagine, it's almost like the confusion that Americans are experiencing today. We don't know whether to wear them or not if we're vaccinated.
Yeah.
What should be done? And also, the CDC says vaccinated people should wear them. Will you get the takers back on?
Well, this particular environment here in Capitol Hill is extremely well vaccinated. And we just got the report from CDC, and I think we'll all be thinking about the way forward. But it's pretty clear that if you're vaccinated, as Senator Blunt pointed out, your chances of having the disease are pretty small, and almost everybody in the Capitol complex is vaccinated. So this environment right here is pretty safe. But we'll have to see what the reaction is to their announcement.
Leader McConnell.
All right, so there you heard from Senate Republicans speaking today about a number of different issues earlier. Senator McConnell was asked if he had watched any of the hearing on January 6th on the House side. He said no. You heard from Senator Rick Scott urging the Biden administration to do more on Cuba. You heard from Senator Joni Ernst talking about the fears of rising inflation. But you also heard from almost every member there who was speaking at the podium, offering their condolences to their former colleague, Republican Senator Mike Enzi from the state of Wyoming, who unfortunately passed away today. He was known as a consensus builder in an increasingly polarized Washington. He died today after he broke his neck in a bicycle accident. He was 77 years old. He fell near his home Friday night, according to family and friends. Police said they've seen no indication that anybody else was nearby or involved in the accident. And so he was elected to the Senate back in 1996. And so you heard there from his former Republican colleagues memorializing him and eulogizing a heavy loss for the Senate body there. So we're going to be moving on to some of these other stories. I'm going to bring in my colleague and friend, Fox's Daytona Everett, just to kind of preview what we have in store for the rest of the evening here. Daytona, so good to see you.
Yeah, Andy, so good to see you too. You had a couple days off, so happy to have you back for the rest of the week here. We're going to dive into some border news. I want to play out a story for you from Fox's Rich Edson as we are still dealing with a surge at the border right now following that. The latest from the city of La Jolla, as this is kind of turning into two different storylines right now, the border surge, but also coronavirus concerns.
Agents say they're running out of water and have to buy cases themselves. They've encountered hundreds of migrants today around La Jolla, Texas. That's on top of the 20,000 Border Patrol agents say they apprehended last week alone in the broader Rio Grande Valley. Officials in nearby McAllen say they've never seen this many migrants travel through their city. With COVID rates rising, they say they're urging the Biden administration to maintain a policy that denies certain migrants entry into the United States because of the pandemic, an authority known as Title 42.
We just know that if it goes away, we can expect our numbers most likely to increase dramatically.
Administration officials have considered terminating Title 42 as early as this month. The White House says the authority will remain in place as long as health officials recommend it. Customs and Border Protection says it has expelled more than 750,000 migrants under Title 42 since October. In the Rio Grande Valley sector, about 70 Border Patrol agents have tested positive for COVID-19. More than a quarter of the unaccompanied children deported this week have also tested positive. That's according to Congressman Henry Cuellar. He represents this area. The Department of Homeland Security has just announced several new initiatives designed to address this border surge, including an expedited removal process for families that have no valid claim to enter the United States. Texas officials say that falls short.
It won't make a difference. We have to close the border.
The Biden administration says it will also accelerate rulings on asylum applications.
We are making reforms to increase the efficiency and expedition of that process that have never been made before and that are long overdue.
Border Patrol agents tell us they are just overwhelmed with processing and paperwork, given the number of migrants who are passing through here. Many are then released into the country with notices to appear at a court date later. In La Jolla, Texas, Rich Edson, Fox News.
So as you heard from Rich Edson right there, the majority of this attention and focus is on the city of La Jolla, and they're getting extra focus right now because of a post that went viral from the La Jolla Police Department. This post said that officers with the police department went inside a local Whataburger yesterday where officers were informed of a migrant family in the restaurant that were apparently disregarding other people's health. The family told the officer they had been released by Border Patrol because they were sick with COVID-19. You're taking a look at a response post from Hidalgo County Judge Richard Cortez. He released a statement saying that due to multiple reports of migrants being released with COVID-19, he's calling on federal immigration officials to stop releasing them into the community. Judge Cortez also calling on Governor Greg Abbott to restore the county's ability to implement safety measures like mask mandates to contain the surge of COVID-19 infections. Obviously, this was a huge deal out in the city of La Jolla, and today the police department actually came together announcing that they would have a large press conference to kind of walk back what was said during that post there. But you know, you see from those videos, from those pictures, the great reporting done by our Fox reporters down on the ground, this is a problem, and the coronavirus is just causing more complications.
Yeah, Daytona, definitely, because we also heard from Governor Greg Abbott today. He has no intention of restoring any type of what we would call mask mandate in Texas due to these rising case numbers. But you also, on the other side of that coin, you're hearing from many Republicans that are saying one of the main causes of this recent surge in the Delta variant in cases is a lot of these migrants crossing the border. We saw those numbers there in Rich Edson's story. And so that is going to kind of segue into our next story with that press conference you mentioned in La Jolla, Texas. Can you give us some details of what exactly they're updating us about?
Yeah, so basically just following up on what they need from the state of Texas, calling again on Governor Abbott. As we said, so many of these other states are taking steps forward, reinitiating mask mandates. But I guess the main point of this is trying to get that that surge under control. We know that this migrant family was being housed at a local church there, a Catholic church, and the church unfortunately did not report it to the police department, did not report it to the city. So there's a lot of miscommunication that's going on right now through the city of La Jolla, and they're saying that that needs to be fixed.
All right, Fox's Daytona Everett, thanks for joining me in the newsroom. We're going to play out that press conference from officials there in La Jolla on a number of these topics and stories that we've discussed. Thanks so much.
Tell me when you're rolling. Okay. Well, I'm Sergeant Casas with La Jolla Police Department. I'm one of the spokespersons for the department. And I welcome everybody, and I thank you for being here. We want to first start by letting everybody know that this is to bring awareness as to an incident that occurred in our city, and it's probably occurring in other cities. And we want the community to know that that the police department in the city of La Jolla is doing everything that they need to do to keep the community safe. That is our main goal here. We do know that we have a large influx of undocumented immigrants coming into the country, and because of that, there's an overwhelming amount of work that is put on the police department and the Border Patrol, who are the ones who are out there and doing our task for this job, and we know that they're overwhelmed. I'm not going to speak for them, they'll speak for themselves. But since all of this is connected, it's always good to bring out what is going on here. And I want to start by telling you that on July 26th, during the early afternoon hours, one of our officers was on patrol on Expressway 83 near a restaurant and was weighed down. The officer stopped to make contact with the individual and was advised that there were some people in the restaurant that appeared to be very sick. The officer did not at that point know the extent of what she meant by them being sick, so she made contact and walked into the restaurant and made contact and found a family there. A lady with her teenage daughters, and I believe some toddlers were there also. According to the officer, everybody that was in there as part of that group of the family appeared to be ill. She didn't know exactly what they had, but they did appear to have runny nose. They were sneezing, they were coughing. The children had like mucus on their face and different things that alerted the officer that something was wrong. So the officer made contact with the manager, and the manager made a decision that it was better that that family would leave because it was making everybody else uneasy. And when the officer found out that they were staying at a hotel adjacent to the restaurant, they produced a paper to the officer and said, "We are here because we crossed the river, but we have proper documentation that allows us to be here, and we're staying in a hotel, and we are sick." The officer asked what was the problem, and they told the officer that they all were had the COVID-19. That, of course, alarmed everybody, including the lady that called, and that waved down the officer. It alarmed her. So the officer had to take action and try to find out a little bit more about what was happening. The people that were in that restaurant had a form that is called the I-385. It's an alien booking record from the United States Department of Homeland Security. They carry it with them because that shows that they've been processed. According to the information we have, is that once these individuals are processed, they are no longer to be detained by Border Patrol, and they won't be detained by Border Patrol. And that is the reason why these people were there. The only problem is that they were, what they told the officers that they were infected with the COVID-19 virus. And they moved on from there, and we had to get a supervisor involved immediately. A supervisor made it to the scene to verify that this was going on. The supervisor also and one of the officers went to the hotel to verify if it was true that they were staying there at that hotel that's here in the city of La Jolla. And it was verified that they were staying there. And not only that, there was other family units that had the same form, the I-385, the alien booking record, and they were all there. We have an understanding, based on what was told to us, that the hotel in totality has already been rented out, and everybody that lives there or is staying there temporarily has these forms to be there. And from there, they're allowed to move to their destination, wherever that destination may be at. It could be anywhere in our nation. But for now, they're staying in our city. We did not know this. No one told the city of La Jolla, no one told the police department that these people were here. And no one told us that these people were possibly ill. They themselves said it to the police department or the police officers that they were sick and that they were there. And that they were put there by a Catholic charity who was helping them find a place to live. We also have an understanding that they had food inside of the hotel to maintain themselves, but some of them did get out. They did not wear any face covering. We have to understand that it's not mandated that they wear it, but if you're sick, it's recommended that you do. But they were not wearing it, and of course that's what sparked everybody to get concerned about the situation. From that point on, the police department made contact with the U.S. Border Patrol to find out what the form I-385 was and what it meant for the carrier, the person that was carrying that form. And we were informed, and we have this understanding that that form is so that they can go to their destination. And this form does say that when they reach their destination, wherever it may be in the nation, they are to report to the nearest ICE office within 60 days or face removal. That's what this form is for. So these individuals can be picked up at any time by any family member and taken anywhere in the nation, as far as we know. I'm sure that Border Patrol will probably be better able to answer that and anything dealing with that matter. Once our officers made contact with Border Patrol to verify that these forms were legitimate and what the people that were carrying them could do, they moved on and made contact with the Hidalgo County Health and Human Services to get more information about what we could do as a city because we knew that this was becoming dangerous, and we know that COVID-19 does spread, and it spreads quickly. And we had these people in our city that were supposedly sick with COVID-19. So we made contact with the Hidalgo County Health and Human Services to verify what we could do about the situation at hand. I do want to say that they did reach out to us, and they explained to us that due to not having a shelter-at-home mandate, there was not a lot they could do. But I want to say this, and I think this was already due, and I got to give a lot of credit to Hidalgo County Judge Richard Cortez, because as soon as he was notified about this, he immediately moved on it. And he did do a news release immediately about the situation and what he's doing about it. And he made those calls, and about these nonprofit agencies assisting with these people that are overwhelming Border Patrol. Because you have to understand, some of these places are so full, they don't have nowhere else to put them, so they have to release them. And again, I go back to, they were released, but they were released into our city and no one told us. So the next thing is for us now to continue with what we started, and we are continually staying in contact with Homeland Security, of course, with Border Patrol. We're going to be staying in touch with the judge, Judge Cortez, to see what the next step is going to be that we're going to be taking. And our officers are using the face covering when we're making contact with anybody, because you have to understand that the La Jolla Police Department does assist Border Patrol on a daily basis. Sometimes we find people walking along the expressway at night. People call us through 911 to tell us, I almost ran over some people that are walking along the expressway. We have to get out there, and we have to get these people safely off the expressway to the staging area where Border Patrol begins the process to put them and take them where they need to take them. So we do assist, and our officers need to be protected from that, because we do know that we don't only have people coming in from El Salvador, Guatemala, Honduras, now we have people from Venezuela and Nicaragua, and we do have an understanding that from some of these countries there is a lot of COVID, and our officers need to be protected. The La Jolla City Manager has also made a memo out to the police officers and to the police chief that our officers need to protect themselves and city workers because of this incident that occurred. We don't know how long this has happened. We found out only because one concerned citizen decided that she needed to do something because she saw something was not right. And that's what led us to where we're at now. There's a lot of more information out there, but what we're going to do is we're going to continue with an investigation and finding out what's going on, and then we'll continue to let you guys know what is going on with what we're doing. I don't know if there's anybody out there that has any questions, and if we can answer them, we'll answer.
So you've been listening in to that press conference out of La Jolla, Texas. We want to break in for some news that we're getting in. Emergency crews on the scene of a deadly chemical release at a plant in LaPorte, Texas. According to Lee Woodward, who's the city secretary and public information officer for the city of LaPorte, emergency officials responded to a mass casualty event, an incident at the LyondellBasell facility located in LaPorte there. Woodward also reported that 2 people were killed as a result of the incident. The leak had apparently been isolated, and air monitoring at the facility indicates no off-site impact at this time. Harris County Pollution Control is also on the scene to conduct air monitoring as well. There's currently no shelter in place or other protective actions that are being recommended for the LaPorte community at this time. We know that this has been an issue in the past for the city of LaPorte, so I'm sure we'll be hearing more from officials pretty soon here. And if we get anything, you know, we'll bring it to you live here on Live Now from Fox. But again, just wanted to report to you 2 people dead following this chemical release in LaPorte, Texas tonight. We're going to go back into that update from La Jolla Police Department as they are talking about this influx of migrants across the border and an influx of COVID cases as well. We're going to keep up this shot so we can keep our eyes on this into the night here, as they are also experiencing, looks like, some interesting weather too. More to come in just minutes.
Out there, but what we're going to do is we're going to continue with an investigation and finding out what's going on, and then we'll continue to let you guys know what is going on with what we're doing. I don't know if there's anybody out there that has any questions, and if we can answer them, we'll answer them. Yes.
Thanks, sir. Do you know that if they actually tested positive for COVID, did you confirm a positive test for them? And do you have any idea of when they did cross over into the United States?
The information we have from this family in particular, they had been processed just a few days prior to them being encountered by the police. Now, they didn't have any documentation to show that they did test positive for COVID. Mm-hmm. They themselves told the police officer that they were positive for the COVID-19 virus, including all of the family.
And is it your sense that that hotel is largely for people who are COVID positive?
The information we have is that everybody that is staying in that hotel is COVID-19 positive because it's been rented out for them.
You all said. Hasta que sabemos si cuando llegaron al hotel vieron si alguien estaba supervisando o evitando quién, monitoreando quién entraba, quién salía, había alguien de alguna organización.
Nosotros, la policía fue para el hotel para poder tratar de verificar a ver si había más personas ahí. No había guardia, no, de ninguna manera había eso. Si habían otras personas con la misma forma, la I-385, que ya han sido procesados por el gobierno federal, que viene siendo Border Patrol, y ellos pueden moverse en cualquier parte de la nación con esta forma. Pero no, que nosotros sepamos, nadie nos estaba guardando.
You said you all were taking the steps to protect the city. Are you all going to follow in behind Judge Cortez and call on federal officials and Governor Abbott to make changes as far as requiring mask mandates or allowing you all to have the option, or the mayor to have the option to require a mask mandate for the city of La Jolla? Are you all going to call on federal officials and say stop releasing them since NGOs are full?
One thing I can tell you that the city of La Jolla, from the mayor and everybody that's in charge of doing that, are working with them. And we are seeking that because that's the only way that we can keep the community safe, keep our first responders safe, so we can be out there and be able to help. So of course, we're going to continue reaching out to them. And we continually stay in contact since the day that it happened. We have not stopped. Sergeant Villarreal has been in contact with them and has continually been in contact up to the minute that we walked in here. So we will continue.
Do you have a number of individuals or how many individuals are at the hotel that are tested positive?
We don't have a number. And again, I don't have no way, we do not have a way of verifying if they are positive for the COVID. It's just their word. They're the ones who said we tested positive for COVID. We do know that the people that the officer encountered showed signs, what you look for, you know, the sneezing, the coughing, the runny nose, all of those things, they were present in these people. And it's alarming, so we do have reason to believe that it is true that they are positive for COVID.
What has been the reaction from the residents in your city once they came to find out that this was happening?
It's been a mix of reactions. Some are very upset because they were never told. And some are grateful that the city of La Jolla moved forward and put this information out. Because people will get sick. If you don't let them know that this is happening, people are going to get sick.
Would you say that the police department also feels somewhat upset that they didn't know this was happening?
I wouldn't necessarily say that the police department is upset. The police department, what that did is just triggered us to move faster, to put a stop to this and make sure that the proper authorities up to the federal government do the job they need to do so we can curb this and not allow people to get sick. That's our main goal right there.
Do you all know if the migrants are still there? And if so, what are you all doing? Are you all doing any kind of surveillance in that area? Or
As far as we know, the migrants are still there. We do know they're there. The management of the establishment has told them that not to get out anymore. Again, you know, us as police officers, with this I-385 form that they have, if they want to leave and get in a car, we cannot stop them. We don't have no proof that they are positive for the COVID-19. And until there's a mandate that gives us the authority to do that, we cannot stop these people from moving wherever they're going to move. And no, we're not putting surveillance on them. No, we're not. But we are, of course, keeping track of phone calls. When people have concerns, we try to answer their questions. That's what we're doing right now.
Were there any laws that were broken or any kind of violations, any citations that were issued?
No. Again, if we look back at this, you know, if there's no mandate that say that you have to wear a mask, what law have they broken? None. And no citations were put out there. Now, the police department did speak to the manager of that hotel. And, you know, you also have to remember that the people that took him there are these charities that are there trying to help. That's what they're trying to do. They're trying to help. They're so overwhelmed, they're just putting them in different hotels. We don't know what hotels. We know that there's some in McAllen, maybe even Westlaco. We did not know that they were in La Jolla until this occurred.
Does the police department encourage, you know, the public to report whenever any member of society is exhibiting signs of possibly COVID? And you know, are you encouraging them to call, like in this situation?
We don't necessarily, that's something that we won't necessarily be focusing on. But if a call comes in, we answer a call just like any other call. If there's a concern, we look into it. But we don't go around looking to see if anybody appears to be sick and then ask them, are they sick? We're not doing that. I don't think any police department is doing that.
Would you say that the factor that made the situation rise to the level of a news conference and law enforcement involvement was the confusion initially with the migration status?
Well, the thing is, if you're not informed, that causes confusion. La Jolla, the city of La Jolla was never informed that that a hotel in the city was housing these undocumented immigrants. We had no knowledge of that. And furthermore, when they told us that they were COVID positive and that everybody in there was, that caused a concern. And we had to move fast. And that's what was done. Like I said, it reached all the way to our Hidalgo County Judge, Richard Cortez. And of course he did his release. And I'm sure that this is getting to where it needs to get, all the way to the governor.
What is your advisement for the local public in terms of keeping themselves safe and keeping the community safe?
Our advice is always this: you got to protect yourself. You got to wear that face covering. You have to continue with the social distancing. That is so important. I know that right now, because it's not in place, it's not being enforced necessarily, but it's recommended that you do that to keep yourself safe. We do recommend that, and us as police officers, we encounter different situations where it's hard for us to maintain that distance because we have to sometimes arrest people and we have to go hands-on with these people. But in saying that, our officers do wear their masks and do wear their gloves to try to keep themselves safe. They have families that they have to go home to. Certainly we don't want to take that COVID home. So it is recommended that the public maintain themselves and continue with their social distancing.
Sergeant, beyond COVID, what's been the impact here in La Jolla due to the border surge? Compare that to previous years. The numbers are pretty historic in the Rio Grande Valley sector. So beyond the COVID issues that you had here, what's the experience been like here?
Well, there has been a change because of the surge. It's just, the numbers are staggering. We know that Border Patrol does the best they can. You know, if you really look at it, probably more than half of them are processing people instead of trying to catch the bad guys. And that in turn makes the police department, which is, this is the city we work for, and the police force has officers that are off duty working overtime under federal and state grants to assist Border Patrol. And that has brought a change as far as what we do, and we just try to make a difference. We know they need the help, and we're out there to help them. We're trying to curb that. It's just too much. It's overwhelming.
What percentage of your police force are vaccinated, and if they're unvaccinated, are they on patrol?
I don't have all those the names or numbers, but I can tell you that when that vaccination started, officers got the opportunity to go out there and get vaccinated. We know that that's a very important factor for us as police officers, because we are in the front lines. We are dealing with people, and we don't know who we're dealing with, and they could be sick. So we do take the measures to protect every employee, and so that we can be able to help others.
Well, what do those measures look like? Is it wearing gloves, or is there more?
It just depends. Depends what we're doing. If there's an arrest, they wear gloves, of course, they wear their mask. Sometimes things happen, those masks will come off, but that's out of our control. Not everybody is going to let you just put handcuffs on. Some people want to fight. But we do take the measures to protect our officers, and the officers take the measures to protect themselves from anything that's out there.
Edgar Camargo, Univision. Do you speak Spanish?
I do.
¿Nos podría decir algo para nuestra audiencia en español, por favor,
Claro que sí.
de esta situación que aconteció?
Seguro. I guess I'm going to switch to Spanish, guys. Is there anybody else in English that has a question? Nobody else? So that I can now switch to Spanish. Okay. El día 26 de julio, durante la tarde, uno de los oficiales de la policía de La Joya, una persona que estaba fuera del restaurante, le llamó al policía para que le ayudara. El policía paró, asistió, preguntó qué es lo que estaba pasando y la persona le dijo que había unas personas adentro de un restaurante aquí en La Joya que se miraban muy enfermos, era una familia entera.
So as they go into Spanish right there, we want to just pop in and give you an update on what we're following out of LaPorte, Texas right now. Staying in Texas, that was just out of La Jolla, so La Jolla to LaPorte. Tragic scene out there, emergency crews on the scene of a deadly chemical release at a plant in LaPorte. Here you're taking a live look at one of our cameras down on the ground. They've been moving around a little bit. Hopefully we'll be getting an update from officials soon. But they did hear from the city secretary and public information officer for the city of LaPorte, saying that emergency officials responded to what they're calling a mass casualty incident at the Lyondell-Basell facility. The city official reporting that 2 people were killed as a result of the incident, also saying that the leak had been isolated and air monitoring at the facility is indicating that there's no off-site impact, so good news right there. Harris County Pollution Control also on the scene conducting air monitoring. There's currently no shelter in place for other people who are in the area. No other protective actions being recommended for the LaPorte community at this time. So again, 2 people dead, multiple people reported injured as well. So we'll be keeping our eyes on this shot here on the ground from Fox 26 in Houston. As we know, this is a developing breaking news story. So more to come through the night. We're going to take a 2-minute break. We'll be right back here on Live Now from Fox. Welcome back here to Live Now from Fox. We are continuing to monitor this breaking news situation out of LaPorte, Texas, where 2 people have died following a chemical release at this facility there. We'll be keeping our eyes on this. But until then, we want to go out to a press conference with prominent civil rights attorney Ben Crump. He's filed a lawsuit against Johnson & Johnson, you know, J&J, the vaccine company, alleging the pharmaceutical giant marketed talcum-based baby powder specifically to Black women, despite links to ovarian cancers. So we'll be hearing from him along with some of those women from earlier today here on Live Now. We have a lot more that we want to be showing you throughout the night. It is almost 8:30 here in Phoenix, Arizona.
Is it afternoon yet?
Yes. Do you have your picture?
No, I don't have my phone.
Wanda, do you want to move up a little?
Yeah.
I'll look at pictures.
Maybe you stand behind me. We don't need about the same side. Closer.
Okay.
Good morning, ladies and gentlemen. My name is Janice Mathis. I am Executive Director of the National Council of Negro Women. Welcome to our national headquarters. This is the Dorothy Irene Height building. If you look behind you, you'll see a portrait of Dr. Height. She was president of this organization for more than 50 years and was known as the godmother of the civil rights movement. We're here today to explore and to talk about a very significant lawsuit that has been filed, and you'll hear more about that a little bit later. So welcome.
Turn you up when they bring you up. Bring you up.
Bring you up?
Yes, ma'am.
There's somebody here who needs no introduction because he gets more television time than anybody other than the President and the Vice President of the United States. But he is our champion. I asked my President, Dr. Janetta Cole, what she thought of Benjamin Crump, and she said he is one of the most authentic persons I have ever known. He reminds me of Superman. He goes wherever there is trouble and delivers people out of it. He's my friend. He's a great lawyer, and we're pleased to have him here today, Mr. Benjamin Crump.
Thank you so much, Janice Mathis, and to the National Council of Negro Women. Thank you for your great leadership. It is not an accident that we're here talking about this landmark lawsuit in the National Council of Negro Women building. The National Council of Negro Women that was started by the civil rights, educational, African-American icon, Mary Bacloud Bethune. She had a great board of women with her when she started this august organization that included First Lady Eleanor Roosevelt. I will pause for a second as we have other family members coming in as well.
Ladies, why don't you come up here, ladies? Come on right up.
Thank you so much. Constance?
Yes.
And you can look for the pictures and get ones for you. The National Council of Negro Women has been advocates for over 85 years for women of African descent, their families, and their communities. And so it would be logical that they, with their great resources all over America, will sought to try to prevent further injustice to those who they advocate for. I am proud to stand with my law partner, Attorney Paul Napoli from Napoli Skolnick Law Firm, in bringing this lawsuit. Also with him is Chris LaPorte, as well as we have Attorney Monique Presley, who works with me. We have also present Rosalind Hannibal Booker, who is the Director of Philanthropy for the National Council of Negro Women. But most importantly, we have the victims of this corporate greed. the faces, the real faces of the people who have been taken from us because of Johnson & Johnson's deceptive marketing to black women. We have Miss Lydia Houston. We have Miss Wanda Tidline. We have Miss Gloria Lassiter. We have Miss Constance Sessler. We have Miss Cornelia Hobbs. We have Miss Brenda Hobbs. And we have Mr. Samuel Hobbs. Before I let Miss Mathis speak directly to you about the mission of why the National Council of Negro Women exists and how it is connected to this cause in particular, and before Attorney Paul Napoli tells you about this thought-provoking lawsuit, I would be remiss if I did not say exactly what this lawsuit is about. It is about the lives of our grandmothers, our mothers, our sisters, our daughters, our nieces, and our wives, and how they were sinisterly targeted by Johnson & Johnson, this multi-billion-dollar corporation, who their corporate executives knew about the link between talcum baby powder and ovarian cancer. And you see in the 1990s, when they started to write in the newspapers about this connection, there are internal documents that talk about there was a drop-off between white women using the baby powder. But they observed that there was no drop-off between black women and Hispanic women using the baby powder. And so, Paul, they doubled their efforts in marketing to black women. And that is what is so sinister about it. And that's why we cannot let them get away with this injustice. Our mothers, many who have been lost to this, would have never let them get away with it. So we owe it to our mothers not to let Johnson & Johnson get away with this. When you think about it, Johnson & Johnson is trying to victimize these women, these black women, even now. It wasn't enough, Wanda, for them to victimize our black women while they were living or battling cancer. But now they are trying to limit the liability of trying to make black women whole. It speaks to me as I stand in this historic building, it speaks to me, Janice Mathis, that even in the death of many of our black women who succumbed to this ovarian cancer, they are still trying to marginalize them and not make them whole. It harkens back to when black people were counted as 3/5 of a human being, not as a whole person. Where Johnson & Johnson, we declare with this lawsuit that we are going to make you acknowledge black women as whole persons, not 3/5 of a person. And so we have all the conviction in the world. Attorney Paul Napoli and our law firm and Jim Monder and many other lawyers around the country have taken up the stand with these black women and say your voice will be heard. And you will hear their voices today. Because black women have always been the backbone of this country, standing up for everyone, but receiving the least amount of respect, including substandard health care, lower wages, and being targeted, Paul Napoli, by multi-billion-dollar corporations like Johnson & Johnson for profit. Well, it is time that we stand up for black women, and that's why we're proud to stand up with the National Council of Negro Women, Dr. Jaeda B. Cole, and Executive Director Janice Mathis, on behalf of black women all over America. We can never thank you enough for bringing this lawsuit to try to prevent us losing more black women. Ms. Mathis and my law partner are going to talk about how important it is for early detection. You're going to hear from Wanda Tidline how important it is that we make black women aware that they are some of the most susceptible people in America to contract this ovarian cancer because of the baby powder usage. My heart is awfully heavy as I introduce this champion for justice, a proud black woman, a great black woman, a leader for black women, my dear friend Janice Mathis.
Thank you, Mr. Crump. Before I get started, I want to say, first of all, to these families and members of NCNW who are gathered here today, my heart goes out. I know what it's like to lose a mother to cancer. I know what it's like to lose a grandmother to cancer. I was only a young child, but I believe that my grandmother succumbed to ovarian cancer. That was way back in 1962, so I won't prove it now. But I can't help but think about Kitty Mae Brock as I stand here today, because that's a large part of why I am here. Like black women everywhere, I have a story. Yes, I have a job with a prestigious organization, and we have a mission to lead, advocate for, and empower women of African descent, their families, and communities. Yes, we have more than 2 million members. Yes, we have 350 chapters in 32 states, but that's not the real reason that we're here, because
So we want to go out live to LaPorte, Texas, as we're seeing law enforcement head up to the microphone right now to give us an update again on this chemical plant release. 2 people dead at this time, multiple people injured. Here's the latest.
Oh, yeah.
Ready?
Yeah, we're ready. All right,
Hi, good evening. I'm Laurie Christensen. I'm the Harris County Fire Marshal. Tonight, approximately 7:35 p.m., there was an emergency that occurred at Lyondale Basel, located here in LaPorte, Texas, right off of Miller Cutoff Road. What occurred was a chemical type explosion release, very small in the scale of it was just in plant. That being said, the chemicals were methyl iodide, hydrogen iodide, and methyl acetate. It is a chemical acid used in food grade vinegar. The issues that occur is severe burns, harmful if swallowed, toxic if inhaled, and harmful to the skin. Unfortunately, there were several patients. We have 31 that are considered green, which means they're walking, but we're still being deconned and reviewed for any other symptoms. We have 5 that are yellow, which means they're being treated here on scene. We had 2 that were red, 1 was life flighted, and 1 was sent to the hospital via ambulance. And unfortunately, we have 2 that have passed away here on scene. We do know that the impact was contained here to the plant. Harris County Pollution Control has been out doing monitor outside the plant. We also have been doing monitoring inside the plant, and there are no impacts to outside or inside the plant. In addition, LaPorte Fire Department is out here. We have members of the SEMA, Channel Industries Mutual Aid. As far as the emergency responders that work here, they are also here. And we have the Harris County Hazmat team that will be deconning and actually going into the scene, performing additional reviews and surveys to ensure everybody is out, and then also working with the medical examiner once they get here. We also know that the Precinct 2 Commissioner Garcia's office and Judge Hidalgo's office has been notified. They're putting out information on their social media, as well as Lyondell-Basell and as well as the Harris County Fire Marshals is as well. I think the main thing I want to say is please keep the families of these victims and those that are injured in your prayers, the staff that is out here, and the first responders that are out here. This is going to be a very long night. The investigation is just starting. At this time, it appears that the Harris County Fire Marshal's Office will be doing an investigation. We'll also be working with our Harris County Sheriff's Department, as well as the Harris County Pollution Control, and we'll be also working with the Harris County Medical Examiner. But again, the investigation's just starting. We don't really know much about it. We don't know how this occurred, but we do know we have injuries. We do know we have fatalities. And what we'd like to say is we can give you more information. We're hoping by 6 a.m. We do know that Lyondell-Basell has released a statement. So if you will follow them at Lyondell-Basell, and as well the Harris County Fire Marshal's Office will be sending out information on social media.
Ma'am, do you know, we heard that it was acidic acid. Are those 3 chemicals that you mentioned what's in acidic acid, or are those individual?
So those are the chemicals. Those are acidic acid type chemicals, but they're used to make products that we use, whether in medical supplies and vinegar, but obviously very diluted. So this is a chemical processing plant. So what you're going to find is they're going to have these type of chemicals.
You had mentioned that there was some sort of explosion. Lyondell-Basell statement called it a leak. What actually happened? Was it an explosion, or what actually happened?
So what we know, again, we're going to be doing the investigation, but sometimes the terminology in these situations, when there's a leak, you think of something pouring out. A leak can also be something exploded off the top and the chemical came out. So once we get into the investigation, we'll be able to specifically detail that out. But when that came out, obviously it impacted a lot of people. So at this point, we, the Fire Marshal's Office, are calling it a chemical explosion until we know more.
The people who were injured, what type of injuries did they sustain?
So you're going to have irritants to the skin, you're going to have burns to the skins, difficulty breathing and swallowing.
Do you know anything about what their jobs entailed or what their job description
Again, we're just now, because this is such an active scene, we're taking care of those that have been injured. We haven't been able to get involved and look into that just yet. Main thing right now we're doing is we want to take care of those individuals that have been affected and make sure that we're talking to the families. And I think that's what our focus needs to be at this point. I'm sorry?
Can you tell us a little bit more about that decon process that you mentioned and what that entails for people?
So the decon process, and y'all may have heard recently we had some other things that we do. What happens is we have to ensure all the people's clothing is taken off. We put them through a rinsing solution, then a drying solution, and we have by 6 a.m. I'm going to get Lyondell-Basell. We'll also have a rep from there. We should know more at that time, and more about maybe will have gone in there and be able to give you more information.
Just one more question. At what point, I know you said the call came around 7:35, but what point was this declared a mass casualty event, and were authorities immediately notified as such?
What I can tell you, the call came in, they made the calls to the fire department, they made calls to Channel Industries Mutual Aid and local law enforcement. So when you start calling it a mass casualty is when they start determining how many victims. So I would tell you, and injuries they have. So I can tell you that occurred very quickly. I don't have the times with me though. Okay, thank y'all so much.
Do we know which hospital and which hospitals any of these injured people have been transported to?
At this time, I don't have that information. Thank you.
And so everybody's been accounted for, right? You don't have anyone who's not accounted for?
So at this time, we do have our hazmat team going in. Harris County Fire Marshal's Office hazmat team is going in to start doing secondary searches to confirm that everybody's accounted for.
Do you have any reports that there may be some people missing?
There's PAR being taken. There could be some possible that some people are unaccounted for, but again, the plant is trying to make sure everybody's where they're supposed to be so they can check that. But I don't want to tell you that there's actually people missing because they don't know that at this time. I haven't been given that confirmation.
Okay. This is the facility right back here.
So you're just listening in down there to the Harris County Fire Marshal official giving us the very latest on this chemical release. We are getting that statement from LyondellBasell as they release this following the incident. They say at approximately 7:35 p.m. on Tuesday, July 27th, today, our LaPorte complex located on this cutoff road here experienced an acetic acid leak. They say on our on-site incident response team responded quickly and the leak is stopped. Emergency responders from the city of LaPorte and Channel Industries Mutual Aid are on scene. 2 individuals sustained fatal injuries in this incident. 4 individuals sustained burns and are being transported to receive medical treatment. We are working closely with responders to confirm all employees are accounted for. So that's the latest tonight as they are monitoring the situation. The investigation still underway, saying that they'll give an update early tomorrow morning. If we see that, we'll of course bring it to you live here on LiveNOW. But just wanted to cut in really quickly and follow this story. It doesn't look like we'll be hearing from officials into the night here, but that was just the latest that we know at this time. We're going to take a 2-minute break here on LiveNOW. We'll be right back with more news. Welcome back here to Live Now from Fox 7 Daytona Everett. Almost 9 o'clock here in Phoenix, Arizona. We want to go back out to that press conference with civil rights attorney Ben Crump as he is announcing a lawsuit on behalf of several black women who say they were affected by Johnson & Johnson's baby powder, saying it was talcum-based and that it had links to ovarian cancer. You're going to hear from some of those women right now who lost loved ones to what they say is something of the doing of Johnson & Johnson. Let's listen.
Your husband.
Hi, my name is Lydia Houston. This is my mother, Valerie Renee Pye Swan. She was a mother of 2, a grandmother of 8. She was married and a great-grandmother as well. She worked in a factory her entire life. She was a phenomenal cook. She loved to crochet. She loved to take care of the people that she loved. She was a jewel, and in my eyes, an angel here on earth. We had a routine, and it involved hygiene, a very clean home, and a very clean body. And just like deodorant, soap, lotion, and toothpaste, talcum powder was a part of the daily routine that she had for over 35 years. In October 31st, 2014, we lost my mother to ovarian cancer. And it had not only spread to her rectum, her pancreas, as well as her lungs. And I miss her dearly, and I want justice for her. Thank you.
Thank you, Ms. Houston. Now we will hear from Ms. Constance Seltzer, and she's going to tell you about her mother.
Good afternoon.
Is someone with you? You want to stand with you? You can get on this side. One of y'all on either side.
My name is Constance Seltzer, and Goldie Hose was my grandmother, and my mom's mother, and my grandmother. She passed away in May the 2nd, 2018 from ovarian cancer. And as a little girl, she taught us to use talcum powder. You know, she would put it down on like I said, from a baby. Everybody in the family used it. And she was the matriarch of this family. She was my glue. She held this family together. And there's not a day that go by that I don't miss my grandmother. I just want justice for my grandmother.
Thank you, Ms. Lassiter. And next, we will have Ms. Gloria Lassiter and Cornelia Hobbs, Brenda Hobbs, and Samuel Hobbs Jr. come and tell you about their sister.
Good evening. My name is Gloria Lassiter, and Gertrude Walker was my sister. And I loved her very dearly. And I used to tell her every day before I go to work, I love you. She said, I love you too. And I took care of her real good. I was at the hospital. I slept there all night long. Got up in the morning, went to get us coffee. And then before I got ready to go to work, I went home, got ready to go to work. And then after I left from work, I went straight back to the hospital and stayed with her all night long because she had to have oxygen, and most of the time it would slip out her nose. And I would wake up in the middle of the night and put the oxygen back in her nose and everything. And I took care real good of my sister, and I love her dearly. We was only a year apart. And after our mother died and everything, she was like a mother to all of us, and all of us really loved her. And she really took good care of her niece, her nephew, and she loved everybody, and the kids in the neighborhood and everything. They love her. Everybody saying, Aunt Dee Dee, even though she wasn't their aunt. But she just loved everybody, and I loved her so much, and I miss her so much. Because even when I was living upstairs in an apartment, I moved downstairs on the floor so that I could push her back and forth to the door so she can look out. Because that ovarian cancer, it really ate my sister up. Ate up to nothing but skin and bones. But I never messed with the ovarian cancer, but she always liked to be clean. So that's the reason why she always used that powder. And I miss her so much. I really do. You want to say something?
Say what your name is.
My name is Cornelia Hobbs, and this is my sister Deanna. Well, we call her Deanna. Her name is Gertrude Walker, and she has babysat. She babysat for every. She has babysat for the whole family, and everybody. Like my sister said, everybody loved her, even the neighbors. And you know, we didn't live no, but across the street from each other. But every day she was at my house, and I was at her house, and she was the mother hen to my baby sister children. She took them in when my baby sister couldn't take care of her kids herself, and she died before she could see them all grown, and but oh Lord, excuse me, but it's hurting, and you know it's a terrible thing that what had happened to her, because like I said, everybody loved her. I mean, if you all got to know her, you all would love her, because I mean she just was that kind of person. She would bring sunshine to everybody, even if it was a dull rainy day or whatever, and just as sweet as she could be. And like I said, she mothered my children because I worked. She mothered my sister's children, our neighbors' children, everybody. And like, I just can't go on, and you know, I miss her dearly. I really do, because she was the apple of my eye, and my bigger sister, as I call her, my little big sister, but oh Lord, I loved her to death. I mean, well, more than like, put it like that, because she brought me up and taught me a lot of things, you know, too, when my mother was living and when my mother passed. And we all used that Johnson & Johnson talcum powder. And, but when she came down with the ovarian, I mean, I was so sad. And, you know, because then I had to just cut it loose, because I said, you know, I don't know what was wrong. But, I mean, I just couldn't deal with it. Like this young lady was saying earlier about they was bred up on it and, you know, used it every day and all. And so did our family, because that's what we was taught, you know, how to be clean and to keep from perspiring, you know, keeping everything nice and clean below. But I really miss my sister. That's all I can say. I really, truly, it broke my heart when she died. Oh. I'm going to go ahead and turn it over to one of the sisters.
Good evening. My name is Brenda Hobbs, and I was with my sister. I used to live with her back in 1973 when I came back from overseas. And as I know, she had the Johnson & Johnson product. It was one in a white bottle and one was in a blue. And so I guess one was scented and one was unscented, but she used them, like they say, sometimes twice a day, if not 3, because she wanted to make sure that she was clean at all times. And because of her, I got to use it a little, but I didn't stay with it like she did. She was using it clean up to 1999, the last time that I know that she had. And then that's when, a little bit after that, she went to Richmond, Virginia, and then they diagnosed her with the ovarian cancer. And it's hard for, you know, my family, even now, because all my nieces, my nephews, my grandchildren, they are still asking for her today. And all I can tell them, I say, she's going to be with Jesus, because we don't know nothing else, to comfort their hearts. So it kind of, wears on you after a while. And me, I was with her on the day she died, and it did something to me, because this is one sister that we all expected to be around a long time, and for her life to be shortened because of the ovarian cancer. It just took a toll. It took a deep toll on the whole family. So yes, I too would like to see Johnson & Johnson, do their part on getting things straight, you know, because so many black families are suffering because of it.
Thank you, Ms. Hobbs. Mr. Hobbs.
My name is Samuel Hobbs, and I'm here on behalf of my sister, Gertrude Walker, better known as Dee Dee, or Deanna. Ovarian cancer ended her life, and I knew little about talcum powder and everything else, but after finding out about what it does and what it can do and did do, I have to make a stand with these ladies. So I'm just here to say my sister's gone too soon behind Johnson & Johnson.
Yes, she is.
Thank you, Mr. Hobbs. Thank you all very much, Hobbs family. And finally, before we take a few of your questions, is a young lady who is here to be able to speak for herself. Everybody else was speaking for their lost loved ones. But Ms. Wanda Tidline is here today to speak for herself and talk about the false sense of security that the advertisement, the marketing from Johnson & Johnson gave her, and the reality of the medical diagnosis that it was not safe, as Johnson & Johnson alleged. Ms. Wanda Tidline.
Good afternoon. First, I want to thank the National Council of Negro Women for this platform. My name is Wanda Tidline. I was diagnosed with ovarian cancer in 2012. I'm a survivor twice of this awful disease. There's no history of ovarian cancer in my family, and I have to deduce that it developed because of the many, many years that I used Johnson & Johnson baby powder. Because of the advertising, I felt it was safe. It was something that was used in my family by women mainly from birth till, I believe, my early 20s possibly. But I felt confident in the product because where it was advertised on television, in the literature that I read. And all these years later, my life has been adversely affected. It's been very traumatic. It's been very scary. It's been very painful. And I'm still dealing with it to this day because I still have to have treatment to fight the disease. I'm very lucky. I feel very blessed to stand here with these families that they can identify, but I'm here to be a voice because I'm alive. I'm very blessed.
Amen.
Amen. I am blessed. Amen. And I stand here with these families to fight this. This is a multi-billion-dollar corporation who advertised that their product was safe. And we've all been impacted in a negative way. And I want to be here to let people know that this could be a possibility for them. And I don't want anybody else to experience the trauma that I've been through and I'm currently going through. So if I'm here to be a champion for that, to keep women safe, and particularly black women, which I am one, that I'm here to be that voice. And I think that, you know, I'm grateful for the attorneys and everybody fighting for this. Yeah. And I pray that Johnson & Johnson does the right thing to make everyone whole, at least do that much. Thank you.
And Wanda is prima facie evidence that it can happen to anyone. She is a college-educated black woman at Howard University. Hampton University. She is a member of Alpha Kappa Alpha, the same sorority that our Vice President Kamala Harris is a member of. And she is intelligent as anybody else. But she believed Johnson & Johnson's advertisement. She had no reason not to believe them until she got the medical diagnosis that they were lying to her. And thank God she's here to give a voice for all of those that are not here to tell about how they were lied to as well. So thank you, Wanda Tibbetts.
No, thank you, sir. Thank you.
Thank you.
Thank you to all these families. Thank you. You too. Thank you.
So, Janice, do you want to say one more thing about the age?
Well, yeah, I was thinking about NCNW was formed in 1935, and we've got members who've been members of NCNW 50 years or more, some of them. If we did a cross-section of our membership, you would find that many of our members fit squarely in the demographic of people who were using the talcum powder at the height of the advertisement that was going on while the product was still on the market. Probably half our members are over the age of 50. And so you're talking about a targeted population of folk who are right in that age range where they need to be warned and advised. And we urge Johnson & Johnson to join us in this education and humanitarian effort to do so.
Thank you so much, Janice. And again, I want to give a big round of applause to the National Council of Negro Women for your great leadership. So Attorney Paul Napoli and Ms. Mathis and I will try to answer some of your questions if you have any. The families, obviously, it's emotional. They will try to answer some of them, but just like we did with the children of Flint, Paul, we stand ready again to fight for marginalized citizens of color. Yes, sir.
I have a question. It really is more for Ms. Wanda. What
Ms. Wanda.
message would you have for people like my own mother who use these products that they're in that 50 plus age range, who may not know that they were exposed to this? How can people catch it early?
Well, I guess we need media, all forms of media, to let people know. Money for advertising to say, hey, if you use these products between this time and this time, you could be susceptible to this. So we need powerful arms, information. We know what information can do. We know what misinformation can do.
But
So
what advice do you have for people who are going to be watching this story? How can
go get tested. Go to the doctor. If you think that, you could have been subjected to this, see your doctor. That's how I went to the doctor. And I, was lucky enough to find out, and I'm standing here. By the grace of God and medicine and prayers, I'm here. But unfortunately, there are many women that aren't here. So I say, if you hear about this thing, please go see your doctor. Go get tested. Early detection is the best medicine to help you, really. That's what I would say.
All right. Did your doctors tell you how big a difference it made that it was able to be caught early?
Yes. Early, because if it had been any later, I, more than likely wouldn't be here. So I was very lucky that it was early, So that's what I would say. Early detection for anything. Any kind of disease is always, more than likely treatable.
But especially for ovarian cancer.
Yes.
Yeah. And Paul and Janice, will y'all speak to that? Because I know that's the basis of this lawsuit. Janice will go first and then Paul.
Well, there's one other fact, too, and that is that most women get a routine pap smear ever so often. But a routine pap smear will not, most times, reveal early stage ovarian cancer. So you have to say to your doctor, I use talcum powder, Johnson & Johnson baby powder, and I need to be checked for ovarian cancer. You have to be very specific. One of the things we do at NCNW is try to make sure our members are savvy consumers of health information. You got to know your own body. Tell them what you suspect and that you want to have it ruled out.
Yeah. And that's the perfect reason why we partner with NCNW. Paul, I think isn't that the whole basis for the lawsuit?
Absolutely. Community outreach is the most important aspect of this lawsuit.
getting out the word, using the resources of the National Council, giving the right message. That's what this lawsuit is seeking. Undo the years and years of lies that this was safe products to be used over and over again. Get out the message of why you withdrew the product from the market. Get out the message that you've known about this problem for 20, 30, 40 years. Get out the message that you need to tell your healthcare provider that you were exposed and to look for these potential problems early, because we know if you catch it early, you're going to have a greater a greater health outcome if you catch it early.
Yeah. And not just the NCNW, but because they have such a large organ, we can go into the black churches, the black sororities and fraternities, the different Jack and Jill organizations, everywhere we can to try to combat 50 years of misinformation. That's what we're fighting. 50 years of misinformation. And it's not going to happen overnight. And this multi-billion-dollar company, as we talk about in the lawsuit, should dedicate as many resources as they did and giving warning to these women as they did trying to target these women.
And one of the things we did not talk about, but has been out there in the press in recent days, is Johnson & Johnson has been saying that they are looking to take the liabilities from talc and move them to a separate company which they intend to bankrupt. And what does that mean? That means that Johnson & Johnson's going to get off scot-free. And these women and the deceased are not going to be made whole. They're going to get away with paying part of the debt, and they should be responsible for paying full debt. So we're hoping that some bills that are being introduced, hopefully in the Senate, will prevent Johnson & Johnson from utilizing what's known as the Texas two-step to evade liability and responsibility. And we're hoping that what happened in opioids, where the Sacklers got away with tens of billions of dollars hidden and secreted away after killing hundreds of thousands of people, does not happen with talc. Johnson & Johnson should be responsible not only for the victims in the past, but also for the victims in the future, because as I said earlier, there's a long latency period for these products, 20, 30, 40, 50 years. And if they're going to be the responsible company that they say they are, then they should pay those people into the future and not try to skirt that responsibility.
Yeah. And we understand that Senator Elizabeth Warren is contemplating proposed legislation to address this, as well as within the last hour, Congresswoman Sheila Jackson Lee is co-sponsoring a bill with Chairman Jerry Nadler in the House of Representatives to address these issues, because they think it's only right and proper to stand up for these black women, even if Johnson & Johnson still refuses to stand up for them and try to make them be 3/5 of a person. Are there any other questions? If not, we're going to provide you all with the complaints, as well as we will keep you updated on the proposed legislation as it makes its way through the United States Congress. Thank you very much for standing up with these women and to get their message out that their lives matter, that black women lives matter, Johnson & Johnson. And thank you to National Council of Negro Women.
We're honored to be part of it. We're honored to be part of it.
Thank you.
Thank you, everybody.
Oh, you want to thank Donna? You want to thank your board or anything?
Contact information, ncnw.org. Our health website is goodhealthwins.org. And our email address is ncnwhq@ncnw.org. Thank you. And we're on Facebook, Twitter, Instagram, Clubhouse, LinkedIn, YouTube, you name it.
Before we leave, I want to be clear that Johnson & Johnson gets the message. Black women lives matter.
Yeah.
Black women lives matter. Black women lives matter. Black.
So there we were just listening to the civil rights attorney, Ben Crump, now taking on this case, representing some of these women who have and are alleging that they have suffered or lost family members over Johnson & Johnson's talcum-based baby powder, saying it gave people in their life, women, black women in their lives, ovarian cancer. And so we wanted to bring you that update there. We do want to take just a quick 2-minute commercial break, though. When we come back, we'll be giving you more updates on some of these big stories that happened earlier today, especially out of Los Angeles, where former political donor Ed Buck was convicted in connection with the drug overdose deaths of 2 men at his West Hollywood apartment in 2017 and 2019. We'll have more updates on that after the break. We'll see you in 2 minutes. And just a beautiful live look there at New York City at this hour. It's a little after midnight there in the Big Apple. I'm Andrew Kraft. Thanks for being with us here on Live Now from Fox. We have just a little bit more left to get to on this, what has been a very, very busy Tuesday. We want to show you an event that we played live for you earlier out of Los Angeles, where former political donor Ed Buck was convicted by a jury today in connection with the drug overdose deaths of 2 men in 2 separate incidents at his West Hollywood apartment. One in July 2017 involving the death of Jamel Moore, and one in January 2019 involving the death of Timothy Dean. Buck, who in the past has reportedly given more than $500,000 to many prominent Democratic politicians and causes since the year 2000, was found guilty on all counts. We want to show you now some of the family members of those men who died. They spoke after the verdict was announced today. Their attorneys also spoke. And we just want to mention that Buck was found guilty on all 9 counts. This was just the first day of jury deliberations. So let's hear what they had to say outside the courthouse in Los Angeles earlier.
Made it out of Buck's apartment after he almost overdosed, and he's the reason why we're here today. Because he didn't die, and he came forward, and he stepped forward, and somebody other than us believed him. This is Miss Letitia Nixon, and put a capital T on that name. And she's Jamel Moore's niece. So in any order that you guys want to speak, I'll just go. I don't have much to say. I'm just over the moon excited for victory for my brother, Timothy Dean. We loved him so much, and also I'm excited for victory for Jamel Moore and his mom. And Ed Buck, I'm so happy that he will never see the light of day again. That this trial was overwhelming. It was grueling. This man did some terrible things to human beings, and I'm just glad that they found him guilty. Thank you, all of you. And what was your name? Joanne Campbell. Thank you. I'll give you all the stuff. I just want to make sure.
Hi, everybody. My name is Joyce. My last name is Jackson. Timothy Dean. Charges. Finally, Ed Buck will never harm anyone else, and I thank God for that. And as I leave LA, going back home, I thank everybody that has helped keep us strong throughout the 3 weeks that we've been here. LA is a beautiful place. It's just a bad timing that we had to come. But I thank God that we're leaving knowing that Tim did not die in vain, Jamel did not die in vain. And I just thank God for all of you. And I just continue to pray and pray for our family, because this right now is a time for me to begin healing. But healing will really begin to close once he sent us. Thank you.
That's right.
Hello, my name is Letitia Nixon. I'm Jamel Moore's mom. I want to say thank you to everybody that believed us. Thank you to everybody that reported correctly on my son, because my son was more than an escort, more than a prostitute, as many of you guys said. It's more than a movie or a documentary. This is my baby, my son, who is a human being and is loved by lots of people. But today is bittersweet. Today is the day that my son was murdered when he left my house 4 years ago. But we got victory today. We got victory in the West today. So I'm grateful and I'm happy. And thank you guys.
Hi, I'm Dane Brown. I'm the person who was able to walk out of Ed Buck's house and be able to tell my story. I want to say thank you to the officers, Paul Cadera and the ADA and everyone who listened to me and believed me, because I didn't think I was going to be believed. Walking out of that house, I didn't know what was going to happen next, and I didn't know all this was going to happen, but I'm so happy and I'm so relieved that these families can get the justice that they deserve, because they're the ones who suffered pain more than I did. I made it out alive, but they're suffering because they had to lose someone in order for this to happen. Don't forget about us. I'm not a sex worker. I may have been an addict, but these people need to be heard, and these people need to be helped, and listen to them when they have a story. Believe them when they need help, because without them, their family's going to miss them, and it's just going to be a sad day. Thank you, everyone.
And right quick, we had a whole team of folks that worked for 4 years to get to this day. Jerome Kitchen, West Hollywood Mayor, Lindsay Horvath, Sammy, Corey, I mean, all of Jamel's friends, Mark, our attorney, Nana, she's back on the phone, and Marcus and Hussein. So I just want to make it clear that this was really a community and a team effort that lasted 4 years. And I can't wait to make a victim impact statement at sentencing to let him know just how much he is hated. Did anybody else want to speak? Let them know who you are.
I'm Samuel Lloyd. Jamel was my closest friend. This case is a representation of how much this city has neglected its community in a whole. This should have never happened. It would have never happened to Timothy Dean. We were protesting in front of Ed Buck's home for weeks and numerous times before Timothy Dean died. We could have saved him. We could have saved so many people, but nobody cared. It's like the cameras show up here when it's like, oh yeah, now he's going to jail. But what happened for all the other people that aren't here? And for the people that we could have saved? Like, we have, as a community, we have to start standing up before it gets to this point, because we lost everything. We have people here that have lost, so much, and people that were neglected by our own community in West Hollywood, where that's our community. We should have been safe there. And we had a serial killer on the streets for years. For years.
I also want to just say one more thing. There's someone who died that was not a part of this case, but would have been a part of this case had he lived. He died from complications of AIDS. His name was Star. And he was one of Ed Buck's victims. And this day is as much for him as it is for Jamel and Timothy. I know if Star had been alive, Star would have testified. Star would have been right. Star would have showed up. Yeah. And so I just want to make sure we lift up Star as well.
All right, I think it's just important that the hunting of black men stop. The hunting of black men for our body parts and treating us like elephants, searching for our tusks and killing us for the process of getting our tusks has to stop. We are not creating the need and the desire for our body parts. Someone else is. Fortunately, someone finally went to jail for the need of our body parts. But it has to stop. The media creating this need for our body parts has to stop. The hunting of black men for some thrill has to stop. You all are creating it. You all are. So it's your responsibility to try to turn the light down on us so that they're not continuing to hunt for us for some exotic desire of us black men. We're not creating this desire for us. You all are. And this case is a result of them desiring us for our body parts. More of this is ongoing. This is just one example of it. This is an everyday occurrence of us living as black men in this town or in this country. Them hunting for us, needing for our body parts. Not us, but our body parts. We're not elephants, and stop killing us for our tusks.
Do you guys have any questions before we get out of here?
Quick question for anybody. When you heard the first guilty verdict, tell me what you felt. Was it relief? What was it like when you heard that first guilty verdict and then guilty all the way down the list?
For me, it was vindication.
Freedom.
For me, it was vindication.
For me, it was freedom.
For me, I knew it.
That's
I've
right.
been saying victory in the West from day one. And they can all tell you, I've been saying victory in the West.
For myself, it was a relief. I knew then Tim did not die in vain. So I was good.
Anybody else?
For me, it was a sense of release and relief at the same time, because we've lost a lot of people on the team. We put in so much work on the front lines, lost friends in the way, people doubt. But all of this, as a collaborative effort, whether you're working the case or your heart is tied to it, we put somebody away, and we also saved lives that he could have hurt going forward. So I want to thank everybody, whether you're here working the case or your heart is in it. As a collective, we did what we needed to do and got him away.
That's right, that's right.
And I'm Corey, his best friend, so Jamel Moore, and today is the best day in the world for me.
Any other questions?
What is making Cuba going for the last 4 years?
Go ahead. No, you were going to say something.
Thank you. I just wanted to say that today's verdict doesn't bring back Jamel Moore or Timothy Dean, but it demonstrates just how obvious the horrific acts that happened were to a jury of his peers. I am so grateful for the verdict today. I am so grateful that our community is now safer because of this verdict. We heard a lot of testimony about the city of a lot of allegations.
Thank you so much for believing. Thank you so much for believing in us. Thank you.
It was a tremendous honor to be able to vindicate the rights of the victims in this case. And Lindsay and I are absolutely thrilled that justice was served today in a sweeping guilty verdict. And I also specifically want to thank all of the victims who were brave enough to testify, because without their testimony and without them coming forward, we wouldn't be here today. So thank you to all of them as well, even those who aren't here today.
Thank you.
I'm Lindsay Bailey.
Girl.
Lindsay. Last name is Bailey. Chelsea Norrell. Norell.
Spoken prosecutors, I think.
Yes, ma'am. Yes.
But don't move.
Yeah.
Yes, we're Assistant United States Attorney.
Don't move. We're going to take a photo right here. Thank you, ladies.
Thank you.
Got it. Thank you. Any other questions?
Was there a sentencing date set?
We don't have a sentencing date yet. We're doing post-trial motions, which will be due sometime next week, and I think the hearing for that is set on August 9th.
And you had asked Patrick what kept us going. Well, I can speak for myself, and it's the fact that, like I said in the beginning, the lives of Black people matter, whether they're survival sex workers, escorts, HIV positive, unhoused, addicted to meth, their lives matter. And in a city like this where we have such a huge, I live in downtown LA, all I see are Black men on the street. All I see are Black men laying on the street of downtown LA. And to know that they're being hunted and preyed on by people like Ed Buck is trifling, and it's so sad. And whoever said just before me that we stopped a monster from killing someone else, we certainly did. Yes. Because as the prosecutors demonstrated in their case, each time a person died in Ed Buck's house, he never stopped having men come over. He never stopped. He just kept going and going and going until he was arrested. So we most certainly saved lives, and that's what kept me going. Also, the pain and anguish of Timothy Dean's family, Jamel Moore's mother. How this all started was she sent an email out to journalists in LA just asking for people to look into what happened to her son. A friend of mine at the LA Weekly named Dennis Romero, who I think is with NBC now, asked me to contact her and get in touch with her, and we've been in touch ever since. That's how, we've been working on it ever since then. So we've all been working on this for 4 years. We adopted Timothy Dean's family, and when it happened to them, we brought them into the fold, and all of his friends, and we've been pushing and doing this for 4 years strong. So I'm so proud of everyone here, and it's I'm gonna say a little bit of a joke, but it's kind of funny because usually we don't like the prosecutor. And we're not rooting for the prosecution, but we were rooting for the prosecution this time. So thank you so much, you guys, for believing these men. Thank you. I've texted a lot of them and told them what happened because a lot of his victims didn't come back for the verdict, but everybody is happy. A lot of them couldn't believe that he was actually found guilty. People didn't think that he was going to be found guilty. But the case that you guys built, it was very clear for the jury. And I don't think Judge Snyder wants to ever see another penis ever again. Yeah, right? So thank you.
Sorry, just real quick for the prosecutors, can I ask you what you thought of this 4.5 hours for them to come with the verdict? It's hard to read the tea leaves anytime you get a verdict. I think that they thoughtfully considered the evidence, and we had an overwhelming amount of evidence in this case. Once they started looking at it, they saw the verdict.
There was no glove that didn't fit here. The glove fit.
Yeah,
there are so many people that were not brought to light on this case. There were hundreds of victims. And were over 40 plus years of people that Ed Buck had did this to. You know, date raped and shot them up in their sleep. And then as they passed out and woke up, he did it again and again. Like, this was not a single occurrence. You know, and I mean, going out and finding these people and looking for witnesses in this case was so taxing. You know, but we did that in the beginning. I mean, months after, and no one listened. You know, no one listened. It was disgusting. You know, we couldn't even get the investigators that were on the case to take the evidence that was presented because the witnesses weren't credible. So to get people around us that were not only in the fight with us, but they were out there searching and taking everything you know, and using it. It wasn't just discounted. It's like, because we started on this case, it was like, it wasn't only that it didn't matter, it was like when you showed them exactly what it was, when you showed them the proof, it was not enough. It was not enough. And as a young gay black man in this city, going through Black Lives Matter and all that, it was a sudden realization that my life didn't matter to this city. And it is disgusting, and it has stunted my growth, and it stunts the growth of this city. You know, how do you build on that? How do you expect somebody to build and grow past that if you don't show them that they are valuable?
I agree, and I'll just add this to what Sammy is saying. To show you that he's telling the truth, we have a council member behind you at City Hall named Paul Koretz, who told a group of people that all of Ed Buck's victims were nothing but disadvantaged black hustlers. And that is how a lot of the politicians looked at his victims, which is why they, like Paul Koretz, never returned his money, never even tried to acknowledge this case, boo on the Democratic Party, of which I'm a member of, because like Sammy said, it wasn't just the investigators and the sheriff's department, it was the politician, it was the media worried about getting sued by Ed Buck, it was everybody. And so I think we all feel vindicated today, like, you know, finally. So anyway,
I just wanted to say one thing before we go. We are tremendously proud and lucky to have gotten to work with our law enforcement partners in the Sheriff's Department, in FBI, in DEA. They put together a tremendous case, and we would not have had the volume and quality of evidence without our law enforcement partners, who are the unsung heroes here. So
I agree with that 100%. It's so unusual to be feeling like that, but they absolutely, shame on Jackie Lacey. They had all that evidence, but I'm happy they were able to get it to you, and I'm happy you guys were able to use it.
And I just want to also say thank you to Jasmine Kannick for being a tireless advocate in the community who never let go of the truth and fought for the truth. What was said about my community in that courtroom was not true. What I know about my community is this is what pride looks like. This is what makes our community proud. People coming forward, standing courageously in their truth, and fighting for justice. And I am so deeply grateful to you, Jasmine, to the families who shared your stories and shared your courage. Dane, I don't have words for the courage and strength that you have shown.
Who made it out of Ed Buck's apartment after he almost overdosed, and he's the reason why we're here today. Because he didn't die, and he came forward, and he stepped forward, and somebody other than us believed him.
victory for my brother, Timothy Dean. We loved him so much, and also I'm excited for victory for Jamel Moore and his mom. And Ed Buck, I'm so happy that he will never see the light of day again. That this trial was overwhelming. It was grueling. This man did some terrible things to human beings, and I'm just glad that they found him guilty. Thank you, all of you.
And what was your name, hon?
Joanne.
Joanne
Campbell.
Thank you. I'll give you all the stuff. I just want to make sure.
Hi, everybody. My name is Joyce. My last name is Jackson. Timothy Dean. Charges. Finally, Ed Buck will never harm anyone else, and I thank God for that. And as I leave LA, going back home, I thank everybody that has helped keep us strong throughout the 3 weeks that we've been here. LA is a beautiful place. It's just a bad timing that we had to come. But I thank God that we're leaving knowing that Tim did not die in vain, Jamel did not die in vain. And I just thank God for all of you. And I just continue to pray and pray for our family, because this right now is a time for me to begin healing. But healing will really begin to close once he's sentenced. Thank you.
Hello, my name is Letitia Nixon. I'm Jamel Moore's mom. I want to say thank you to everybody that believed us. Thank you to everybody that reported correctly on my son, because my son was more than an escort, more than a prostitute, as many of you guys said. It's more than a movie or a documentary. This is my baby, my son, who is a human being and is loved by lots of people. But today is bittersweet. Today is the day that my son was murdered when he left my house 4 years ago. But we got victory today. We got victory in the West today. So I'm grateful and I'm happy. And thank you guys.
Hi, I'm Dane Brown.
All right, so we just wanted to show you some of that from earlier today outside this Los Angeles courthouse. So you're hearing from some of these defendants and family members of the victims who died, speaking after the verdict today announced against Ed Buck, a very prominent, former prominent Democratic political donor. And so we are going to be moving into some other stories that we have that we want to show you here on Live Now from Fox. I'm Andrew Kraft. Thanks so much for being with us here on your Tuesday night. It's been quite a busy day. A few things, though. We just want to remind you, you can give us a follow on our Twitter account. Our handle is @LiveNowFox. My handle is @AndrewKraft, and you can give me a follow there. You can go to our website as well, livenowfox.com, for all of the latest. It lists all of our streaming platform partners, and it shows you how you can stream us and where you can find us. So, but we're going to go into now one of the biggest stories of the day that we want to show you yet again, and that is the first hearing today from the House Select Committee on January 6th, with testimony from several Capitol Hill police officers. So we're going to hear from some of these members of Congress who were picked to sit on the panel, and then the testimony from the police officers recounting that really tragic, harrowing day just 6 months ago where pro-Trump rioters stormed the Capitol in that armed insurrection. And so we're going to show you that. It's going to include, after that, the White House press briefing from earlier today and a number of other events we've already shown you. So we will see you back again, obviously, tomorrow, Wednesday, for more top stories, more breaking news, live, raw, and unfiltered here on Live Now. So let's go right into this House hearing from earlier today.
that more than 140 police officers suffered injuries. We know that efforts to subvert our democracy are ongoing, and a major part of the Select Committee's work will be to find ways to eliminate that threat. We also know that the rioters came dangerously close to succeeding. If not for the heroism of the United States Capitol Police and the Metropolitan Police Department, many more lives might have been lost, and the rioters could have accomplished what they set out to do, upend American democracy. It's an honor to have 4 of these heroes sitting before us today. We welcome them for appearing here, and more importantly, for your heroism on January 6th. You have the gratitude of this committee and this country. You held the line that day. I can't overstate what was on the line, our democracy. You held the line. We're going to revisit some of those moments today.